Okay. Good morning. Welcome to the Pitkin County Board of County Commissioners work session on Tuesday, November 10th, 2015. John Peacock has an issue he's dealing with right now, and he'll be in this afternoon, he's anticipating, and Phyllis is filling in for him in the meantime. John said we have, things are in really good hands on the budget with Connie. So on our agenda this morning is the Livable and Supportive Community Budget Presentation. And I'll turn it over to you, Connie.
I'm Connie Garofalo, Budget Director. We're here this morning to present the 2016 budgets for the departments and funds that are under the Livable and Supportive Community core focus area of the county's strategic plan. Just an organizational note, in your budget binders, you will find today's presentation under the 7th tab under Livable and Supportive Community. And you will also find more detailed backup information under the Budget Profiles tab. This section of the budget is pages 55 through 106. The presentation and the backup material can also be found under the board agenda area of the Pitkin County website and also on the Pitkin County Finance webpage. The strategic plan guides our budget decisions and our priorities, and so we're presenting today according to the success factors under the core focus area for livable and supportive community. The success factors in this section of our strategic plan include a sense of personal and community safety, diverse and livable housing options, self-sufficient individuals and families, access to recreation, education, arts, and culture, and improved community engagement and participation. The department areas that are included in this part of the strategic plan include Health and Human Services. We'll be hearing today from Health and Human Services Admin, Human Services, and Senior Services, while the Healthy Community Fund grant presentations will be, or grant recommendations, will be presented next week on November 17th. We'll also hear from our public safety departments, the Sheriff, Dispatch, and Detention. The coroner is not here today, but the budget is included in this section. Then we have community relations, the library fund, and housing includes both the Aspen-Pitkin County Housing Authority, which is in the county general fund, and then also the housing impact fee, which is a separate fund for employee housing purchase and development. This part of the strategic plan has a budget for 2016 of just over $28 million, and it makes up about 27% of the county's total budget for 2016. On this pie chart, you'll see that the largest area of this section is for housing, with about $9.6 million, or 34% of this core focus area's budget. This area is our second largest capital expenditure for 2016, behind the courthouse plaza. And we are anticipating that anywhere between $7 and $8 million will be spent on employee housing development. The second largest area of this core focus area is public safety, with over $8 million and 29% of the budget. And then next we have Health and Human Services and the library, both at about 13%. The chart on slide number 7 shows a 3-year comparison for the different departments and funds in this core focus area. The first column shows 2014 actual expenditures. The second column shows 2015 original budget, and then the 2016 proposed budget. We have a mix of both operational and capital expenditures listed here on this chart. So you see that there are some swings in budget, especially with the capital and vehicle purchases in the general fund. There's about a 5.3% increase in this area between 2015 and 2016. Part of that, again, is made up of vehicle purchases that change year to year according to our replacement schedule. And then part is made up by increases in the Health and Human Services area that were made mid-year 2015. And you have seen supplemental requests earlier in the year for many of those changes. There's one correction on this chart. The dollar amount for 2016 for the Aspen-Pitkin County Housing Authority was not updated. It should read $214,300. There is a 9% increase in the county's contribution to APCHA for 2016, and we will mention that later on in the presentation. In the other funds, down at the bottom of the chart, the ambulance district number is not final yet. They will be coming back to the board on December 1st to present their budget, so expect to see that number changing as we get more updated information from the hospital and the ambulance district. You'll see that the large increase in this area is from the Housing Impact Fee Fund, going up to $9.4 million total, again for possible development of employee housing. Healthy Community Fund has an increase as their property taxes increased. And then the Library District has a very sharp decrease as 2015 had the budget for their building expansion and renovation. And so overall, the budget for this core focus area has actually decreased from 2015 to 2016. Any questions so far?
I wanted you to go over that housing number again because it's flat in this book. And what did you say it's going up to?
It is going up to $214,300.
And that's a 9% increase?
That's a 9% increase, yes. And we do have a slide on that later on in the presentation. We will mention that.
Okay, thank you.
Okay. Then I'd like to ask Nan Sundin and her group to come up. They will be presenting two different success factors in this core focus area: a sense of personal and community safety, and self-sufficient individuals and families.
Hi, good morning. I'm Nan Sundin, Health and Human Services Director, and with me is Mitzi Lettingham. She's our Deputy Director. And we also have Kim Dubois and Marty Ames here to present, and there's not enough room for all of us, so we're going to rotate, which we just had to work out just now. We are really pleased today to present our budget to you. We have a number of successes, challenges, and initiatives to share. I don't think any of them will be new or a surprise. But we wanted to start out with an org chart that identifies in the best color coding that we know possible to let you know the changes that have happened in Health and Human Services. And primarily, the changes that you see are because we got other dollars to support these positions. The only position up there that was not funded by external dollars was the Veterans Officer, which you all agreed to approve this year because of Garfield County's determination that they didn't want to serve Pitkin anymore. So that is a new position, new dollars, new cost. You'll see, and you probably remember that in 2015, we got money from the 4E waiver for a family engagement coordinator under Adult and Family Services. And we also got money from the workload study to hire a supervisor. And then in 2014, we got money from House Bill 1291 to hire the CCAP family engagement coordinator, and you may remember that that's Lihia Bonilla, and she's now working from Aspen to Parachute, finding families in Eagle, Pitkin, and Garfield that qualify for CCAP but need help with the CCAP application, and she's doing a tremendous job. That position is fully funded. And then we have the Healthy Community Fund Administrative Assistant that you all approved for last year because the the obligations of the Healthy Community Fund have grown so dramatically, and the resolution that adopted the Healthy Community Fund allows for up to 5% of the fund being used for operations. We currently are using about less than 2%, and we're proposing going up to 3%. So that position is in the mix to grow for 2016. We'd like to take it from a 0.5 position to three-quarters time. 0.8.
32 hours.
And then you can see the other positions that grew as a result of our partnership with Eagle County and needing to add staff so that we could serve El Jabal and Basalt. So that's the caseworker and the adult protective caseworker. And in 2012, we added our admin assistant for the building, and we've had a lot of success with that position recently. In particular, in the last year, helping merge our two departments. Our bilingual case aide, which is essential in our work, and a caseworker that we added in 2012. So it looks like a lot of growth for a small department, but we're really pleased to be able to bring in other revenues for most of these positions.
Nan, how secure is the state funding for these different additional things that we have done? The state has a negative budget this year, basically, in this upcoming year, unless a couple of things can happen there that they can help alleviate some of it. But what's it looking like in terms of us getting the promised money from them?
You know, for the most part, they're talking about even another 100 caseworkers in the budget. And I don't have a magic ball. What we decided is that we want to go with the money that we have today, and we're fully prepared to be nimble if it's cut back. We don't see that happening. We see a commitment from the JBC and the state still on child welfare in particular. That's where most of the growth has happened. If something changes, we're going to have to be nimble and respond accordingly. Hope that doesn't happen. We'd like to see more dollars come in, and we'll see what happens. Yeah, thank you.
Rachel?
Yeah, I just want to comment, I agree with how you put together, and I really appreciate the overtime and that they're supported by other state grants. But it makes it look larger because we have the senior services kind of
Yeah.
right in there. You know,
Yeah.
maybe next time we can draw the chart a little further out, give them a little longer branch there. And that, so I do support that, but I also was going to ask, and I know it's like a number we're going to have later in our meeting on Health and Human Services, but how many Medicaid enrollees do we have from Pitkin County now?
Right now, we have a little over 1,500.
A little over 1,500. You know, I think that that's an indication of the demand
Right.
of itself. I mean, these people have not been added for nothing.
Yes.
And I know
Right.
the numbers on our veterans in our valley is very high number as well.
Right.
So I think that
That's a good
it's good
point.
to always be able to put those things in context.
It's a really good point, and it's interesting because we thought, do we put the org chart first or last? Because what we're about to present is going to explain to you why all of this growth. But I think I wanted you to see it and think about it. So as the managers present to you, you can put it in context and ask questions with more information.
Great, thank you so much.
But thanks for pointing that out. We also thought about, do we keep seniors in or out?
Mm-hmm.
Because we saw it too, but they're part of our family, so we
Oh,
wanted
I
to keep
agree.
them in.
I agree. Thank you.
Okay, so then I'm gonna let Mitzi present on, or I'll just take this page. We have, you can tell me what that 655 means, 655.91?
That is the proposed budget for the Health and Human Services admin
Admin.
part of the general fund.
Okay, and it includes the Stop Fighting It Hurts campaign. We are going into the third year of that campaign, third year of funding from you all with county dollars, and we're rigorously working on assessing and evaluating the impact of that program and whether or not we continue, how we continue, what other funds we might use to continue. The main change that you're going to see with staffing, as I said, is the Healthy Community Fund Program Assistant from 50 to 80%. That's 100% funded by the fund, Healthy Community Fund. With 72 grants, we have obligations with site visits, with contracts, and with all the grant work. And it takes a full year for us to administer this program in a way that ensures the best investment of the dollars of Pitkin County. We take that very seriously. So we believe that by increasing the support person, that we'll be able to get that capacity that we need to manage the work, in addition to, because we're not just doing Healthy Community Fund, we've got all of the admin for human services, or all of economic services, Medicaid, food assistance, CCAP. So when you see Health and Human Services admin, it's all of that together, and all of it is growing. So that's where we thought the biggest impact would be for us, take the pressure off of Mitzi, so she can do more strategic work around our economic service, work fair, and all of those things that are going to be coming up. Are there any questions about that?
Dan, I have a question on the, you touched on this briefly, the domestic violence campaign. You're going to do an assessment on that. So that will be, I'm assuming, is a fairly comprehensive assessment, trying to determine successes, opportunities. But does that come out of, I mean, who does that? Does that come out of that budget, that $25,000 a year?
$25,000 comes out of the general fund,
Right.
and it comes to the Health and Human Services admin budget. It's in that $655.
Right, but who does the assessment, and does that get funded from the same?
It gets funded with this $25,000. So the first year was $25,000 to develop the campaign. The second year was $20,000 to implement it and pay for media, and the third year goes up again to $25,000 to help us pay for whatever we need in evaluation. So we have our MSW intern is working on that assessment. We're pulling our team together, and we're looking at all the Google analytics that help us really look at what pages are getting hit on, when do they get hit, what's the impact of the advertising, and so we can come with a full recommendation about whether we move forward, how to move forward.
All right, thanks.
Okay, thank you.
Rachel?
You know, again, it's part of our packet for later this afternoon for the Health and Human Services discussion. But the dashboard of results of timely applications, non-timely applications, everything, I think really helps demonstrate for our board the increased paperwork load, the increased administrative load. The state is trying vigorously and appropriately to really tighten everything up, make sure the services are delivered appropriately, and that actually affects the potential of a federal grant. So, and how much money the state receives, or whether they're penalized by the feds and things like that. So it's separated from this, but I can just tell you from what we've learned at CCI and other groups, the accounting of every dollar, every penny has almost become more, and the timeliness and how well the applications go through has almost become more important than the services delivered.
The audit and the compliance.
respects.
Exactly.
Thank
you. Thank you. So I'm going to turn it over to Mitzi, and first I just want to thank Mitzi, because Mitzi helped all of us pull this presentation together, and so we are indebted to her for how organized it is. And I'll let her talk about the administrative successes, challenges, and initiatives.
Thank you, Nan. Yeah, thanks. Glad to be here today. So we'll start out with the fun stuff, the successes for 2015. And we're really pulling out about 5 here. Starting with developing Western Slope 211. This is an ongoing process that is still evolving, but we've made some gains with trying to position that information and referral line essentially to become viable for Pitkin, Eagle, and Garfield County. Right now they're very heavily based in Mesa. They are in Grand Junction. It is a call center. And what we've done is we required all of our Healthy Community Fund grantees to make sure that their agency profiles were in the database for 211 as a first step, so that if someone from Pitkin were to call, you know, they would have they would actually have all of our agencies on hand that they could help someone with. They're a very small group. They have their own challenges in administration and management. Actually, we're going out to see them Thursday on a site visit to really try to bolster this plan to make 211 kind of the go-to information resource for our citizens. So it's developmental, but it's making some progress. We'll keep you apprised of that. As Nan mentioned, we are just absolutely thrilled with our departmental administrative assistant, Susan Markwood. She has really been successful, I think, in integrating our departments, having us have a better sense of a whole Health and Human Services department as opposed to, you know, separate entities, through her just ability to be that central front person. Also, she's our point person for all things technology, which is, as you know, fast moving in the county right now, and she helps to disseminate that info and keep us going. And really, what has really proved true is she's at that front desk greeting our customers and everyone who comes to the building, and that has just been so wonderful. People are not getting lost. We just have a seamless front lobby now, and that's thanks to that position. As Nan mentioned too, with the domestic violence campaign, the website, Stop Fighting It Hurts, has been really successful. I don't have the analytics of the moment right now as to how many hits, but it's grown, and as Nan said, our intern is working on that and making sure that we keep going with that. But, you know, there's ads in the paper, and we're seeing, you know, benefits from that message to families. If you are having conflict, it's going to affect your children. And so that's been successful this year. And then September 1st, the Aspen Valley Hospital campus, which includes our building, went smoke and tobacco free. And, you know, we had a small group that spent many hours in planning. We really did trainings with employees, customers. We really reached out, got feedback, and it just went like a dream. It just came and is now in place, and I think we're seeing much less issues of smoking in and around our building, and not very many complaints. So that's been a successful rollout so far.
You
Yes,
say
ma'am.
not very many complaints. What complaints have you received?
Well, I think in the initial stages and right prior to rollout, you know, we did have some customers in the building, in the agencies in the building, who, you know, asked, where do I go? What does this mean? And we're just kind of, you know, not very happy with this policy change. But it hasn't gone forward. We've worked individually. We've developed these little communication cards that we can hand out to folks. We've talked a lot about how do we approach folks when we see them smoking. It's not a punitive measure. It's simply, we'd like to let you know that we now have this smoke-free policy. Thank you for honoring it. That's pretty much the message. And I don't know, Nan, do you have any other
I have
input on
not
that?
received any
We haven't-
complaints.
yeah.
I've approached a few people, and they're always very kind and thoughtful. They put their cigarettes out right away.
Yeah.
We approach them in a way such that we simply ask them to respect our policy. And we continue to work as a group. We've been talking with the homeless shelter about whether or not they need help with NRT, because we could help pay for that. They have not identified an interest at this point, so it's not over, but it was much easier than we thought it
Than
would
we
be.
thought, yeah.
I'm glad to hear that, because I had concerns about
Yeah.
trespassing and people smoking in places that weren't appropriate. And I don't think you go out and patrol the bushes, so thank God that we had a wet summer, so we didn't see any little forest fires starting
Well,
out
in the
there.
winter, right, the winter might be a whole different thing.
Yeah, we'll have to see if we
So-
have a heavy
story.
winter.
Yeah, so we'll
Okay.
still be working
Thanks.
on it.
Right. And then last, I want to just mention that we're pretty pleased with how it's going with the city funding for health and human service agencies. We've had Councilwoman Ann Mullins has been sitting on our review committee. We'll talk more about this next week as well, but she has really been successful in, as sitting in on our process, developing her own sense of good funding from the city side and putting that forward to the city. And they're going to be issuing letters, they've defined how much they're going to give the agencies. So that looks good right now. Still moving, but. Okay, so moving on to challenges. The things that we're really aware of, that we're working on, and that will move forward into the next year. Workforce development. As you know, with the changing requirement of the Employment First program, which essentially is having adults without dependent children now will be required in the counties that are rolling out this program. Pitkin has been exempted for 12 more months, but those individuals are going to have a work experience in order to continue to receive their food assistance subsidy. EAGLE, as you know, is our close partner in IGA with economic assistance. They are beginning this program January 1. They have just hired a worker to begin to put the planning in place. And again, you know, Rachel, you mentioned staff time and paperwork. That's really what this is going to be challenging about, is keeping track, maintaining the kind of the rigid requirements, and most importantly, developing these workfare sites where folks can get employment training. And so what we're doing in support, and I think what we'll move forward on, is try to develop we will develop our own workfare sites in Pitkin when it will be time for us to consider rolling out this program as well.
So Mitzi, that's part of our involvement with the Colorado workforce.
Absolutely.
Yeah, and I noted that they have an office in Glenwood Springs at
That's right.
at the mall.
That's right.
And it's been kind of frustrating for me sitting on that board because we're not mandated to do it like
Not
they are in
yet.
those other
I know.
counties. Nothing really happens there, and Mitzi and I sit there going, okay, when are we doing something up here? You know, and when's the 82 quarter going to be involved?
Right.
So we just need to keep hanging in there so that our presence is known when it gets
Okay.
around to something happening over here.
And we have been doing things locally through the Healthy Community Fund with the Go to Work program and other things that we can endorse separate from the Workforce
Right.
Center until we get it together.
Right,
So we are trying.
because it's mandated that a commissioner from each of the counties
Yes.
sits on that board.
Right.
So you sit there from Pitkin County and they're
Mhm.
like, oh yeah, we forgot about you guys over there. So hopefully our efforts that we're doing now will roll over when we have to do them.
Right.
Yes, I think we're definitely keeping our eye on it and working on it
Great.
as we go forward.
It's always nice to see you there since you and I
Oh.
are not the only ones in the room then.
It is good. It is good for us to be there together. So, and then again, challenges, as you are noting throughout the year, we just have had the growth in economic services. Both the cost of eligibility has really gone up. The increase in applications and caseload is monumental in Medicaid specifically, and in the other programs, very tight. The service demand for redeterminations, eligibility determinations, as we've already mentioned, is very stressful for staff. It does impact on morale, and it's just really much more work with the same people almost, and we don't see that lessening, unfortunately. And then one of our biggest rocks, which I think you'll continue to hear about for a long time, is the lack of supportive housing for our vulnerable populations. And those are mostly our folks affected by domestic violence, mental health, disabilities, of course, homelessness, and seniors. And we really don't want to let this issue go away. So we want to work on it strongly. We recently did have one of our Health and Human Service Network pod meetings in which we invited the sheriffs, the police, the hospital, the schools, and after that meeting, And the jail, thank you. After that meeting, we had a discussion about, let's create a strategic plan for this. Let's get set to do this, possibly in the beginning of 2017. Let's keep this going. And Don Bird from the jail emailed back and said, I am all in. This really impacts the jail and law enforcement. And that's what came out in our pod meeting. They really talked about housing, so big one for us. Yes.
Ironically, today, there was an article in the paper by Snowmass Village discussing housing issues, and perhaps particularly senior housing.
Oh,
And
okay, yeah.
while there's the desire to age in place, so many of their affordable housing units have a lot of stairs. And so they
Stairs.
were kind of calling for some sort of regional look at housing. Again, it's just in its infancy as an idea, but that was in the paper today. But it seems that there's one other big challenge that we're tackling that I don't see up there, and that is the availability of Medicaid and Medicare providers.
Oh, yes.
Access to care,
That's going to come
which
up
we have in our initiatives.
Yeah, that's in
You're right.
initiatives.
But that is,
Yes.
that's
It
a
is
big
a big
challenge.
one.
But
Yep.
it could also have easily been on there.
Oh, that one.
Thank you, Rachel.
Thank you.
That one, yeah.
Thank you.
Okay. And then what we did with this next slide is we just pulled out a little bit more of numbers for you to see in relation to this growth in eligibility demand, growth in service demand. And this is usually you see the numbers on calendar year. This is state fiscal year, so July 1 through June, okay, is what this represents. And it just gives you a sense in the different programs of where our numbers have moved from 09, 11, 13. It's just a snapshot, if you will. And the caseload, by the way, is point in time because usually we just take 1 month. We usually take the month of June to say caseload because that number, of course, is cumulative. Caseload, it's not, you carry a caseload through the months. So it kind of makes more sense to just take 1 month's caseload number. The total applications those are unique numbers that you add. So to pull out from there again, I think most notably is Medicaid, medical assistance. I mean, with the Medicaid expansion, has just really been, that's the biggest program in the room since 2013 for us. Any other questions on that? We'll dive into more, of course, this afternoon. And then, so basically what we're looking at for 2016 is, as you know, we have our new veterans officer, and he has hit the ground running with interviewing veterans and does have a goal, hopefully. We're really trying to see at least 25% of that 925 number that those are the veterans numbers in Pitkin County. And what Scott Ring would love to do is see how many of those he can meet. And so capacity building, this is a new unit, new office, and we'd really like to see it grow. And first step will be some renewed open houses, planning one in January. So we'll really try to partner with our other county VSOs. And as you know, there is a lot of growth and development in veterans services. We have a Veterans Coalition now in the Western Slope and some very strong key partners. So looking forward to that. Strengthening healthcare access. Not only is there a large group of providers through the Regional Health Alliance working on this piece, but there's now a small group that is working specifically on how do we improve our healthcare access in the Upper Valley with Mountain Family, AVH specifically. So there's just a lot of emphasis and energy in this arena. Also, public health service delivery is a major initiative for this year. I believe that a consultant has been named or is being vetted right now to, that you all approved for the hiring of a consultant to really take a look at the structure of public health And so I don't know what the time frame is, but I'm assuming it's at least 12 months for that.
It's actually, will be coming to the Board of Health with recommendations, we hope by June
Okay.
of next
Yeah,
year.
oh, June, that's.
For the
okay.
budget cycle of 2017.
Right, so that's a very important initiative for us. We're starting to develop and think about succession planning in our division. So that's a big one.
It's time.
Yes, it is. And then, of course, here's another big rock. This one you'll hear more about. We're really dedicated to creating a comprehensive strategic plan and approach for food security. We have very low numbers of food stamp or SNAP recipients in Pitkin County. Actually, abysmally low. We're only serving 10% of those eligible in that program. And the state is recognizing that. They have contacted us, and we are starting to work with some of the advocacy programs that are really involved in this. Hunger Free Colorado is one of the major ones, and so we are going to be really working hard on this. One of the ways we've done it now, and it'll be recommended to you next week, we're really wanting to support Lift Up, okay, who has been here in Aspen since 2010, and they've been operating in a really small food pantry. Well, they just recently found a bigger space where they can have refrigerators and freezers, and they can actually take fresh fruits and vegetables. And what we really would like to see is a standalone food distribution site, as opposed to the mobile pantries, someplace that we can really direct folks to for food security. That's one arm of the issue.
Mm-hmm.
So there's a lot of development going on.
Can you define food security for the public that watches it? Because you can
That's a good
question what
question.
food security means.
That's a great question.
Did you get the definition for the meeting that we had? It's
No.
To me, in this use, it is to provide food resources for people, not secure food. I mean,
Oh,
for them to
yes,
secure
yes.
food, but not to keep food safe.
Well, it's so
Food-
that folks are
Food
not
security
hungry.
is like safety security, right? You don't want people to have to decide whether to pay their mortgage or buy food,
Okay.
pay for insurance or buy
Right,
food.
so it's,
So what we need is for people to have enough capacity to buy the groceries that they need to feed their families in a healthy way.
Okay, great.
Okay?
right, so actually, we're talking about grocery and food safety, really, now.
Yeah.
That's the new term that we're using for.
So people have access
Right.
to
So
food
people have
supplies.
access.
Right, exactly.
Thank you. It seems that this goal was going to relate back to the new work requirements for obtaining food stamps as well, isn't that?
Potentially, but
That's a
you
good
know,
point.
there's one thing to keep in mind with the work requirements. People can be exempted if they have mental illness or they're aging. I mean, there are exemptions. And what I'm hearing is that the counties that are being successful are the ones that are helping people find appropriate exemptions. So we may lose some people off of food assistance, but we're missing potentially 90% of the people who could be on it. So those numbers, you know, only give us a concept, really, that we're missing something, and
Yeah.
we can be better at it.
And I appreciate that, and I just kind of wanted to point that out, that there seems to be parallel efforts, or efforts that are going to have strings attached, as it were. The other question is, when is the food pantry moving? Do you know? You know, because it seems that that would be a perfect place to have a large poster to say how to see if you qualify and how to apply for other types of food assistance.
Exactly. Thank you, Rachel. That's one of the early pieces that we're going to put in place in partnership with Lift Up, is actually, we'll go even further. I think we'll be developing a plan where food assistance applications will be there at the pantry, and training so that staff can actually have folks, you know, take an application, actually fill it out right there. But yes, posters and information, we can do a better job. They have just moved, I think at the beginning of October, but they're planning an open house, Lift Up is. So we're going to be very shortly here rolling out more connections and message that people there. Right now, they're still operating two.
Is going to interview people at every point of. There's a belief that we're like 48th out of
In the country?
in the country. We're not doing well statewide. There's a belief that this is happening because HCPF chose to go with med-only applications in the open enrollment. HCPF is Healthcare Policy and Financing. And so all applications that go in for open enrollment of insurance through the Affordable Care Act go through a Medicaid filter. If people qualify, they get Medicaid, but it's what we call a med-only application, and they're not. Then we haven't found a way to catch them and say, oh wait, if you apply, if you are eligible for Medicaid, you're likely also eligible for food and possibly CCAP and these other programs.
Right.
So we're not the only ones who have this problem. We just have a bigger problem than other counties, just in terms of numbers. But we'll figure it out.
Thank you.
Thank you. That's what I had. Any other questions? You're welcome. Thanks. Okay.
Okay. So we have about 20 minutes, which is probably what everybody likes. You can go faster. You don't have to
I'll go
cover everything.
Hi, everybody. My name is Kim Dubois, and I'm the manager for Adult and Family Services, Pitkin County. And I will go through this pretty quickly because I know we've presented before throughout the year because we have so that's the difference that you can see between 11 and 13. That definitely bumped things up. Does anybody have any questions regarding that? Okay. The next piece, we want to talk about trends and themes, and the next piece, of course, is the practice changes that are happening statewide and locally. And so this is just another picture of some of the continuum of care that we're trying to provide for families and kids, and some of the initiatives therein that help us move the needle, hopefully so that they can exit the system but still get the support that they need in terms of prevention. Do you have any questions on that? Okay. And this, of course, ties to what we talked about earlier in terms of the expansion and staff. I know that our department has probably had the most significant expansion within Health and Human Services. And so I can see, and I really appreciate the questions about that. And are we maybe being too aggressive, and could that funding go, and that kind of thing. And I just want to share that in terms of the state funding that we're receiving, I don't anticipate that there would be a lot of change. Of course, there might always be a wild card, involved in that. But what we do is we model our decisions after our practice. And our practice is, all the practice changes have been about making thoughtful, deliberate decisions, even if they seem speedy to everybody else. And that is the same with our staffing patterns, our decisions to bring people on board in terms of our services that we can provide through Pitkin County, and then bringing them before you for your approval. So I just want you to know that we're not, for lack of a better word, willy-nilly making decisions, that we use a lot of processes to manage those decisions. And we also use a lot of our internal partners to do that. And I think I've mentioned this before, which includes finance, which includes HR, which includes BITS, and all of those different areas, those infrastructure supports to help us make really good decisions and hopefully long-term decisions. And
I just want to, you might have been going to say this, just want to point out that when we got the Colorado Community Response Funding, we opted not to hire a staff person for that, but to actually enable one of our partners to do that. So the school district has taken on that position. We have to be the fiscal agent, so we're the pass-through. But we do look at, are there other people who could do this service better than we can, or in a different way that will impact families in a better way? So we were always looking at that as well in terms of our practice change.
Absolutely.
And
Yes.
one more comment on this slide, the dollar amounts that you see there are the funding amounts, the revenue that is being brought in to support those FTEs or those services.
Is the other half, the 10%, our match then?
That's
Okay, thank you.
Right. Very good grant writing. Helps us bring this money in.
And then some of the challenges, of course, for last year and this upcoming year is just managing the multiple system-level changes in practice. We're still building our bicultural, bilingual resources. And another piece of all of this, of course, is supporting staff well-being. When there are transitions and changes, we all know that that can be stressful for staff, and they're also doing a really challenging job. And our goal is to retain staff for as long as possible, because the costs attached to losing staff and rehiring staff and training staff are pretty monumental, especially in child welfare. In terms of, I was looking at the wrong. Our initiatives, we're building prevention programs and systems of care. And as Nan just mentioned, we're really looking at our partners to help fill the gaps in those areas, whether it be staffing or other resources. And we can act as fiscal agent or support or whatever to make sure that those services are implemented. And of course, enhancing our workforce well-being. And we're really focusing on strengthening all of our partner relationships to maximize all of the resources that are available and that are coming into our community.
Great. Any questions for Kim or thoughts?
One question on the earlier page, you refer to FACET, F-A-C-E-T. What is that? Is that an acronym that stands for something exactly?
You know what, I meant to try to put all the names for acronyms, but it's FACET is Family Assessment Community Evaluation Team. And that's actually implemented by Youth Zone. And they received a Healthy Community Fund grant to implement that program. So it's just another part of that whole prevention service support for families.
It takes at-risk families before they enter our system, our child welfare system, and provides multidisciplinary team support to the family, finds out what their goals are, how we can help. We pull resources together. Really, it's a try to keep families out of the system.
Okay, and I know when we do the Healthy Community Fund, they'll be on there.
That may come up again.
Yeah.
Exactly.
Rachel?
You know, I just wanted to kind of ask and give you guys the answer, the opportunity to answer. There really is some overlap perhaps in programs, but there's not duplication.
Correct.
Right.
Correct. Yeah. And because as with any continuum of care, continuum of services, there's going to be that flow and the flow goes back and forth and across, but it's not meant to be redundant. We don't want to inundate people with a lot of things. We want to support them where they're at and give them the right services at the right time. And that may be somewhere on that continuum that kind of maybe even is in the middle of all of that. But yeah, that's our goal.
It makes it difficult because the names of some of these programs are not intuitive, like CCR,
Yeah.
Colorado Community Response. But basically what we're building is a toolbox so that a case manager, whether it's our case manager or in youth services or somewhere else, can pull from these tools to best support families and children.
Thank you.
Yeah, I think the goal is that no child or family falls through the cracks, really.
Right.
So,
Good point. Okay.
thank you.
Thanks, Kim.
Thanks, Kim.
Thank you.
Marty put pictures in here of characters that you know.
Our most,
So do not get distracted by beautiful Jim there.
our most photogenic
he always looks
senior in the
good.
community.
One and page
He's
two.
on page,
you notice
he's
that?
constant.
Yeah, it's a constant. And we like that about him.
Hi, Marty Ames, Pitkin County Senior Services Director. Lame duck.
Marty, don't even start. I knew I
I'm
needed
in
that
good
clean.
company with the president, you know.
She thinks she is retiring in the spring. She
Marty
thinks
thinks
she is.
this is her last budget presentation, but we have ways of bringing her back.
We have to allow that, you do know that.
We can just move to successes. I'll just hit a few high points here. I think we're running a little short on time. This first bullet was a last-minute add-on because we just found out that the results of the state and federal funding decisions by the Northwest Cog Area Agency on Aging. And we received a 35% increase for this next 4-year period for our nutrition programs, which are congregate and home delivered, and also our public information, which includes our newsletter and a lot of the radio contract we have with public radio for advertising, you know, keeping our ongoing programs in people's awareness, and some other things. We're very pleased about that. That was one, public information was a very clear message in the Aging Well strategic planning process from the entire community across every goal area that information was important to our community. Access to information, understanding what's available. So we're very pleased to have been funded for that. The hiring our part-time Aging Well plan coordinator has been very helpful. It's allowed our staff, while we're still involved very much with the different initiatives, to to also maintain our regular operations better. We put a lot of time and energy into the Aging Well strategic plan for about a year and a half, and having this person to make sure it's moving and make sure we're on track with our 2015-16 and on the way the goals have been prioritized, and staying on top of that in the reporting has been extremely helpful. The community participation and ownership of programming for older adults, that was a cornerstone of the Aging Well strategic plan. That concept of generating participation and ownership by all entities in the community for programs and services to the older adults of the community. And it's really happening. The Being Mortal program tonight is one example of that. 2 collaborative fitness and wellness programs that included the hospital and the recreation center, City of Aspen Recreation, and others. There are many examples of kind of the movement, that direction of ownership in the community. The space needs study, I know we've reported on before, that Powerhouse application was a challenge, but it really generated some great results, and one of which was the need for a space needs study. Kitchen staff turnover last summer was, most of these things have aspects of challenge and success in them, and they're under success because we accomplished it successfully. We have a great new cook and an increase in the congregate meal numbers, participation numbers, which reflects that. New logo, you've seen that. We're very happy with that. And a very successful renovation of the public areas in the senior center. It's brighter, it's more up to date, and it's really reflects a respect for the older adult users of the senior center.
Rachel?
Thanks. Marty, one thing I want to ask you about, I noticed through the newsletter that you're beginning to ask for reservations for the Monday, Wednesday, Friday lunches.
Yes, we are.
Is there a maximum capacity you have at any given lunch? You know, I'd said that if you haven't made a reservation and you show up, you will be served last if there's food available. But is it fire marshal code, or, you know, are we seeing a point where we might consider 2 seatings?
Good question. The reservation system has actually been a requirement of our state and federal funding
Okay.
for a long time. We applied instead, and it was accepted, a kind of a trending where we would track our meal numbers from month to month. They might go up in the summer, down here, up there. And that was successful for a long time, but it wasn't then successful. We had too much fluctuation. Our waste had increased, and that understandable fear or sense on the part of our kitchen staff that they didn't want to run out of food. So the over-preparation of food and then the waste. We were over budget on the food supplies and realized that we finally had to bite the bullet and do the real reservation system, and we've had overwhelmingly positive response to that by our participants. A few people aren't happy with it. We're working with them. We so far have not had to turn anyone away. We're pretty good at guessing what the, you know, that little factor should be of extras that we prepare. Where we do, however, to answer your question about capacity, we do have a capacity issue. We do have numbers. When you're in the senior
Fire
center, you'll
marshal.
see capacity numbers. But we also have chairs and tables and just space in the room and the size of the kitchen. We have a capacity limit. But the only time we need to apply that is our special events. So Thanksgiving, we have a limit on how many people can come. And Christmas is the same thing, and also the New Year's. So we try to work with that and keep wait lists and very close track of the people who called at the last minute who can't make it, and pull those other people in. Does that help? Does that answer your question?
Yeah, it does. Thank you.
Yeah, and just tagging on to that, I was proud of myself the other day. I called up Ruth to say, Ruth, I'm going to be there for lunch today. And Ruth says, you're supposed to call yesterday. So you are supposed to call, you know, the day before at least. But a lot of the seniors have just a standing reservation because they attend virtually 3 times a week. And
Yes, it doesn't really help with the food purchasing to find out at 11 o'clock someone's coming at noon.
No, it was
Hey, we
first
go
thing
with
in the
it.
morning, but it was still too late.
We're happy to have you
So
there.
what happens, you get on a wait list when you get there, which there were 15 names on the wait list, and we all got served. There was plenty of food.
Yes, it usually balances out, and thank you. I mean, I'm really glad you come. Oh, and that was our flood, oh, never
That
mind.
was the flood day.
well,
And
we
I was
won't go
going to
there.
ask you, Marty, is that all taken care of, the flood? Or is it still an ongoing issue?
Yes, it's all taken care of, and I'm working with the right people at the hospital to see why this situation has increased in the last year. You know, we had one major problem in the first 24 years, and now 3 times in 10 months. So we're working on it, but thank you for asking. I mean, we were all set by the close of business that day for the current issue.
Okay. Patty?
Yeah, do you participate in the county's food waste program?
We do not participate regularly in that. However, we are participating, I should say, our new kitchen manager is participating in a separate program for composting with, and I can't remember her name, I'm sorry, with
Julie.
Julie. No, I know her, I'm sorry.
oh,
She
oh.
is participating with another person she knows who is,
Another Julie? No, we don't know her name.
But we need to make sure that we're doing that if we're
Sure.
encouraging the rest of the restaurants and food servers in town to participate. So as long, because we really need that food waste into our composting.
Sure.
Yes.
We can talk to Julie.
Thanks.
Are you talking about Julie Bloomingdale,
Yes,
our
I am.
chef? Yes. The reason we were not able originally to participate in that is the storage of those things on the hospital premises. We have a lot of bear problems there, and a bear has actually been in the assisted living facility and in one of the apartments. And so we have to balance safety and the
Work on it
benefit.
because we have other entities in town that are able to do it, so it's just a further discussion.
Great.
And I know Julie
Thank
well, so I can pick her brain and see who she's utilizing.
Wonderful. Moving on to challenges, this year, really pretty much ongoing, we continue to be a little confounded by our identity, the clarity of our identity. People are still finding us, which is evidenced by some increases in our congregate meal numbers and our Medicare assistance numbers. It still begs the question, are we doing the best job we can do for the most older adults in the community in that location? We've outgrown our exercise room, anyway, and our coworkers even in the hospital in the county really don't know the difference between Whitcomb Terrace Assisted Living and Pitkin County Senior Services. It's very sad, despite 25 years of effort. So the continued efforts to support rural Pitkin seniors is also, one of those rocks for us. We just finished Blizzard Box and flu shot, and the annual Redstone program. This week we're delivering Blizzard boxes up on the frying pan and working more closely. But one thing that we have accomplished, actually, I think it's on the next slide, so I can talk about it there. And that is in 2016, we just found out yesterday for sure that we have that we were selected for one of the Roaring Fork Leadership projects this year. I know a number of you have done Roaring Fork Leadership, and that is to develop jointly with El-Jabel, with Eagle's program in El-Jabel, a better volunteer program for providing transportation, that being the highest ranked need in recent surveys in the Mid-Valley.
I just want to tell you guys that this issue came up at a staff meeting on a Thursday. These applications were due on Friday. Marty went back to her office and wrote this, and they were accepted. And so this is how fast these guys work. And they're amazingly resourceful and dedicated. They work well beyond the hours that most normal people work, and they're successful. So I want to thank Marty for that effort. She worked with other people, but it's sometimes we learn about this money or these opportunities just before the due date, and so this was a success.
Thank you, Nan, and I'll pass that that on as far as Patty Kravitz really carried the ball with this. She had just finished Roaring Fork Leadership last year, and actually spent hours at home the night before this presentation on Friday, preparing it, and Kim just told me this morning that what a great job she did. So thank you.
Mm-hmm.
You would expect, as you would expect, addressing the 2016 Aging Well goals while keeping the momentum going on the accomplishments in 15 is one of our challenges in 2016. And then there is that thing about me leaving sometime in the first half of next year and successfully transitioning. I've just been here a long time, so it will be it'll be really fun for Nan to to work on that and find a great match for our team and someone who will bring in the new fresh ideas while I get out of the way. When I started 30 years ago, it was a blank slate, and it was wonderful to be able to go in new directions, and I hope we can provide that for the next generation of our team. Completing a new website design again on those on that access to information goal. And then I just wanted to mention that when this says enhance workforce well-being, which of course means our workforce, our team's well-being. Our team, all but our newest person, Julie, completed the community listens training in the last year, and we were all very impressed and feel very strongly about the method and the goals of that, and we've decided as a team to really work on that in 2016, both internally and also with and for our customers, and to just really provide that kind of communication that is respectful and generates great results.
Any questions for Marty or any of us? All right, we'll pass the torch then.
Okay.
Thank you.
The next success factor in this strategic plan that we are going to look at this morning is a sense of personal and community safety. And we have our Sheriff Joe DeSalvo here to speak about the budget of the public safety departments.
Morning, Commissioners. How are you? Okay. Where do you want to start, Connie? On the next slide? On the next slide, unless you want to look at those lovely pictures of our staff. I know. Thank you. So what we're going to start out with first is, as you see, our proposed budget. Not a lot of changes to it this year as far as my asks. The ones that I am asking for, I'll explain in detail for you. If we go to the next slide, I think we'll start with our successes. You know, my business is difficult because we're so reactive. So it's hard to really measure our outcomes and what we're going to project for the next year. The climate of public safety has really changed, as we all know from watching the news for 15 minutes. And that's driving a lot of my decision making over the last year especially. And I think that's going to continue to happen in my field. One of the things that has come up in the last year for us, as you see, our first, what we would call a success, is PPCT, which is a standard arrest control technique that police officers, street police officers, use to control suspects pre-arrest. We've really never had a program like that in the jail. We've had what we would call a PPCT Lite. We've elevated that to training all our jail deputies to the same standard that our road deputies are trained to as far as arrest control, things like breaking up fights, handcuffing, etc. And that is 40 hours of training per officer per year for us to do that. So that's quite an impact on our time and our budgeting and our overtime, but I think it's worth it. Hurting somebody in my custody is the last thing I want to do, and hurting somebody in my custody because they're not trained well is certainly the last thing I want to do. So that is something we're proud of. We're still working on it, and I think it's going to be good for inmate safety and officer safety. We continue to manage and get more high-profile events, X Games, dignitary visits, bike race, Tough Mudder, all of those things, and I really think that we manage them at a high level, and that comes from the compliments I hear from the agencies that I get to respond here from the Front Range to help us out, who are more or less the professionals at this, and they're very complimentary of how we do things. So much so that we have decided to create a countywide Type 4 incident management team. example of what a type 4 is. If we had a wildfire here at the level of what Colorado Springs had 2 summers ago, you'd probably see a type 1 federal management team come in here that is staffed with all federal employees and workers. Clearly, that's the gold standard. Level 4 is the basic standard. Most counties don't even have a level 4 incident management team. We have created one that helps us manage our large-scale incidents, anything from a true public safety disaster to a First Lady visit. And that's something we're proud of. We could possibly in the next few years, and it would take a few years, elevate to the Type 3 team, which I think would be a real feather in our cap if we could get there, but that will take a long time.
Joy, when we had the training, the training that we did at the Mountain Rescue, when we had everybody, was it last spring? Remember it was,
Oh, the ESF training.
yes,
Okay.
was that our Type 4 team that was there?
The Type 4 team is the overall management team. They were there.
Okay.
They're doing
Because that's when we brought in, and is that made up of just local, or is that valley-wide entities, or we had a lot of responders from Grand Junction?
It can be both.
Okay, so we can.
Because we only really have staffing to manage a full-scale incident for about 12 hours at
hours,
a time.
okay.
So
That was a
after the
great
second 12
exercise.
hours would be brought in by somebody from Grand Junction who's trained at a Type 4 level.
Great. That was a great exercise, and it was really good for me as a commissioner to stand on the sidelines and watch it in action. It was
Yeah,
great.
I have to tell you, I've been involved in incident management since its inception in 1987 when Steve Crockett rammed it down our throats and we went kicking and screaming. But it is now the industry standard across the country, and I'm really proud of the Type 4 team. It's something most counties don't have, especially
Great.
rural counties.
Thanks, John.
Review and repair our current compensation. There is an ask in the budget for a compensation adjustment. I consider this a success so far, although it's not approved. But I'm going to get into that a little later. A lot of my time has been spent in the last 6 to 8 months on the new facility that I know you guys are brought up to speed on. And as I mentioned to you the last time I was in front of you, that I'm happy to say that I think the project is appropriately sized for this community, scaled, and very budget conscious. We're trying our best to knock dollars and cents off of this thing, and I think it's getting done in the form of millions of dollars, affecting the bottom line. So I'm real proud of that, and I think we've beaten up our facilities enough. Let's give them a rest. Clearly, they need replacement, and I think we all agree on that. The other successes I think I should just go through here is my deputies, my direction to them, if you're not doing anything better, I want to see you on Highway 82 addressing traffic safety issues. Because if you were to ask me what the day-to-day number one public safety threat to Pitkin County is, I'd have to say it's the highway that runs through here. So when officers are not doing anything else, I expect them out there to be active and to pull cars over. This doesn't mean issuing everyone a ticket, because that's not what I believe in. I believe in education, and sometimes people are slow learners, and those people deserve tickets and usually get them. So a few years ago, for the commissioners that are newer, we adopted the model traffic code, which means that we collect the revenues from our tickets that we issue instead of the state. And what you could see, I don't have a lot of sources for revenue as a sheriff's office. This is one of them. We've gone up around $15,000 since last year in our traffic summonses that we're issuing. I by no means want to create a system where pulling people over is a source of revenue. I think this is just a indication of activity. Not that I mean, the last thing I want to do is use tickets as a revenue source. So that just goes to show that the deputies are responding to my request to go out there and be more active on the highway. Any questions so far? Yes,
Yeah.
Rachel?
Joe, let me just ask, is some of that ticket revenue related to the large trucks over Independence Pass who are violating the rules
Yeah.
there, or does that
And
money go
if
back
I
to
was
the
more
state?
prepared, Rachel, I really should have brought that to you. Since the inception of the law, which we all had a part in creating,
Yeah. Thank you.
I think this year we may have written 4 or 5 tickets up there. The minimum is 1,000. 1,500 is the max. So that is in that number, but I don't have a dollar amount for what it actually extrapolates into. I will tell you from experience this summer, the signage, the new law, the fines
making much
did
difference.
nothing.
Yeah.
It did nothing. Tax strips might be the only thing that might help.
Yeah.
But the drivers are still ignoring it and coming over. And we had somebody stuck really badly in August up there, and it really caused us it's a public safety hazard if we can't get to the other side.
You know, I was just trying to think about, where and how we bump that up, in terms, we talked about it before not long ago about contacting. Now there's so many different map providers between Google Map and all these, and as Patty said, we finally got them to where they put it to seasonal closure at least, but we have to pursue that further, and maybe that's somewhere where they're not doing something better. They could be up on the pass on some key days during the week as well to look for that.
And the motor carriers were reluctant to help us with the GPS
Yeah.
and the mapping programs, but I really never understood why.
Yeah.
They offered a few explanations, but they really didn't.
But we need to
I
go a
really
little
didn't
further. When
George,
I've
do
run
you
in-
remember what their excuse? I know you were at the Capitol with me, but I can't remember what their reasoning for not
Yeah, I don't know. I
helping
can't
us with the
remember.
GPS.
I think they wanted us to do it, kind of. They
Probably.
just didn't want to take on that load or that responsibility, and I think we need to kind of redouble our efforts there. I did see the fellow not long ago at another meeting who's the head of the Motor Carriers Association, and he said, well, I think the word's starting to get out. Once a few people have that fine, it starts getting known, but, I know we want it to get out faster, so.
And anecdotally, we had a driver this summer who was ticketed. The truck had to be driven down. We needed, the money needed to be paid immediately. He called his boss, more or less, and they said, park the truck, we'll send you another driver, you're fired. And I had this guy standing in my office with no way to get home, nothing, and he's just standing there. So they take it pretty seriously as well.
Okay.
I know you're tight for time, so I'm going to keep moving unless there's any more questions
Thank
about
you.
traffic safety. Once again, the next issue is high level of training, firearms, defensive tactics, and legal issues. This may affect us, as I said, in the next year, the next 2 years. I think the standard is going to continue to climb for what the expectation of police is and the level of their training. I don't really know how that's going to affect me today, but I do feel it coming down the pike, and I want to be on the front edge of it when it comes to police training, how we interact with the public, how we arrest people. We've always been a compassionate, caring organization. That's not going to change, but the scrutiny certainly has. I think we could probably be one of the gentlest, kindest public safety agencies on the planet. Unfortunately, we do have to deal with people who have severe problems. I guess would be a good case would be the person a few weeks ago that we had to follow through a neighborhood. He went over hill and dale until he was eventually stopped. Those things happen here, and they will get scrutinized more than they ever have. And that may mean increased training. Right now, it doesn't, but that might be something we may be looking at in the future. Yes, George?
Part of that, are you using or utilizing videotaping with on stops and chases? And
Well,
things like
George,
that,
I was
just to
going to
protect you and your
wait to bring
officers?
that up later, but since you've opened the can, let's talk about it. I was asked to be part of a study group asked by the governor, myself, another sheriff, and 2 police chiefs to be on a study group to examine the best case practices for body-worn cameras. That group consists of not only me, but 12 other people, ACLU, NAACP, a bunch of other alphabet agencies. And once a month, I've been going to Denver to study body-worn cameras and the best case practices for them. That group's going to continue until April, when we bring our recommendations to the legislature. Right now, not one of my cars has video, and not one of my officers wears a body-worn camera. If that is something I want to change, it will, since this is a budget meeting, it will be incredibly expensive. I've never felt the need for the in-car camera, so I certainly don't see the need for the body-worn camera. But as I was saying before, my industry is moving towards a lot more accountability. And that may mean I may have to succumb to an in-car camera or a body-worn camera. But I don't see that right now. I've been asked a lot why I don't have in-car cameras. I rely on my officers and their observation and their professionalism to document the event as well as a camera could. So, no, I don't have any video. The Aspen Police Department does, and most agencies do have in-car cameras. I don't. And I would tell you that in the forefront of my mind is a budgetary decision. So I'm not sure we need them yet, but when we do, we'll talk about it. But the body-worn camera study is a very interesting group. As I said, I'm not seeing the need for it in an agency of this size, mainly because with 30 officers, I feel like I've hired them. I think they're good people. I have basically 3 officers on a shift and 1 supervisor. I think they could pretty much keep an eye on my officers as well as any camera can. So that's the answer to that. Any questions about body-worn cameras? Thank you. Another thing I'm real proud of is every year the FBI puts on a 10-week academy for executives. It's a 200-person class. You usually see people who go to this thing from the New York City Police Department, very large agencies, Los Angeles, Miami, et cetera, et cetera, et cetera. And it's usually a 2-year waiting list to get into this thing. It includes a rigorous physical component. It's about 10 hours a day of classwork for all 10 weeks. The FBI, for reasons that are not really known to me, extended us a scholarship and said, we're not going to have you wait. You go to the front of the class. Sheriff, would you like to go? I said I'd rather send somebody who is my undersheriff, for example. They said he's got the invitation. Right now, Ron is at the FBI Academy for another 5 weeks. The training is supposed to be, by his accounts, off the charts as far as leadership. It covers anything from leadership to psychology to crime scenes, investigations, management, all these things, hiring, what to look for. So I'm really excited to have him come back. It's a real feather in our cap to get a scholarship for it, and I'm real proud of Ron for going. Any of us going away for 10 weeks, he's got 4 kids and a wife. That's an impact on anybody, so I think this is almost above and beyond what he's doing, and he's doing it for us, all 17,000 of us.
Could we have him come in and do a presentation?
I
at a
would
work
love to.
session when he gets back?
Because I'm going to have him for about 8 hours just picking his brain on what he learned, but I would love for him to do that. So, yeah, Steve, I think we could make that happen.
I just want to make sure he's coming back.
I just want to make sure he's the same person he was when he left.
Yeah,
That's
well,
what I'm
we'll be checking in
concerned
on him.
about. I don't want to come back with a different guy. And I'm still continuing to send my upper management staff to Roaring Fork Leadership, which I think is a great program for everybody to attend. I went through it. It's fantastic.
Has anybody done community listens?
I don't believe so.
Yeah, that might be something you might want to talk to Nan about. It's a great program. I would like to look into it for myself, but that might be another great avenue for some.
I'm sorry, I did do it. I forgot, but I didn't know it was called Community Listens. Wasn't it something else and we did it? It was a great
Called Joey
program.
Listens.
It was a great program.
Yeah, so that might be something. That's a good one too locally.
So now we move on to our 2016 goals. Once again, the facility is always at the top of the list. We are considering moving our dispatch center to the North 40, and I think you guys have some information on that, partially due to its location during the construction. I think it would be too much of an impact on them to stay there, so we'll relocate them. That may also help with a issue that we're having with dispatch is hiring. And I don't know if that extra 5 miles closer to Down Valley is going to help me get any better employees. But right now in dispatch, we have a real shortage. And I really don't want to ring the alarm, but it's close. And it's something I'm concerned about. And a lot of that has to do with compensation and location, housing, all the things it's the same mantra for almost every problem that we have is compensation and housing. Where are we going to put people? And I think you'll hear that as a theme, whether it's coming from me or Brian Pettit at Road and Bridge or Nan or whoever else. So I want you to be aware of that because, once again, compensation is going to be a theme that I'm going to talk about a lot during the next year. Let's talk about compensation. This year in March, I did a compensation study on what we would call our D2. A D2 is any officer, it's the bulk of my department. You start out as a trainee, which is a new grade that was just invented. You go to D1, which is kind of trainee. Then you settle into a D2, and you may elevate up to what's called a D5. But most of the people who work for me are D2. They are the patrol officer grunt out there doing the traffic stops. When I started to look at their salaries, I found out that out of 8 agencies, and those agencies are Aspen, Snowmass Village, Basalt, Larimer County, Eagle County, Summit County, Garfield County, Pitkin County, and Routt County, we were the lowest paid out of all 8 of those agencies, and it floored me. Number one payer is the Aspen Police Department at $34 an hour, and we were at $26 an hour. I never, ever had a hard time hiring people. When I was first sheriff and when Sheriff Broadus was steering the ship, when we had an opening, we usually had somebody from another department who couldn't wait to come and work for us. I do believe this is the best government agency to work for, not only Pitkin County Sheriff, but Pitkin County in general. And I can't attract people anymore. Openings, I had a great officer who took a $2.50 an hour cut in pay from Basalt to come to work for me because he wanted to work for Pitkin County. He didn't care how much it cost him. I think we need to get competitive. I can't tell you how it makes me feel when officers sit in the same building, because we do occupy the same building, and compare pay stubs, and there's a $4 or $5 an hour difference between an Aspen police officer doing the same job as a Pitkin County Sheriff's officer. And that is a hard pill for me to swallow. It's a hard pill for them to swallow. So the bottom line is you've given me, or you're about to hopefully give me, some money to change our compensation. It's really not enough to fix the problem. If we get the money that's proposed, it'll only move me up 3 spots. There's still 6 agencies that are making more money than we are. And they're still the ones that are closest to us, Aspen, Basalt, and Snowmass Village. Yes, George?
Joey, when you do those comparisons with some of these other municipalities, are we not competitive in addition to the overall compensation package, which includes benefits, which is usually a large part of a compensation?
I could speak for the Aspen Police Department and Snowmass. I think their benefit package is comparable.
Okay.
And I think they're all good packages, don't get me wrong. But when it comes to the dollars that guys are taking home, that's what we're really focusing on. But I think the overall compensation might be pretty close. So I guess I'm just whetting your appetite for next year's budget when I come to you. And I have to tell you, Phyllis and Mary Kate have done a lot to get me to where I am today. We have raised the standard, raised the salary. It's pacifying the deputies so far, but I do have people looking for new jobs in other organizations that are in this valley only because of money. And that is something that concerns me. It's affecting dispatch now. It's affecting the jail now. When we start somebody at $24 an hour to work as a patrol officer or in a jail situation, that's really not a lot of money. When Rafter's paying $18 an hour to start driving a bus and there's no stress there. Well, I drove a bus. There's a little stress. I could say that because I drove a bus for 5 years. There's different stress. So that's my pitch to you guys, that in 365 days I might be back with my hand out for for another compensation change. Let's move on to the jail, because the jail is something that Nan and her group spoke about. About 1/3 of the population in the jail is mentally ill, and right now we have some seriously mentally ill people in there. This is a societal problem. I don't think we're going to fix it in Pitkin County, but we do need to be aware of it. When people are brought to jail, usually their primary issue is mental health, but they're brought there as a secondary issue because they've committed some usually low-level crime because of their mental illness. And we end up storing them and releasing them to the community, only for them to reoffend, to come back into the jail, because it's the only place for them. It is a continual revolving door of the same 6 or 8 people that are in and out of our jail with mental health issues. One of the best things that I could report is, as we know, there's not a lot of services for mentally ill people or addicted people in jail. We happen to have a good amount of services. We have AA, NA, prison fellowship. We have a lot of programs available to people who are sick. But one of the ones that I'm really looking forward to seeing how it works is this year, Mind Springs Health has dedicated 6 hours a week of one-on-one treatment with an inmate. These guys usually get group counseling, which isn't as effective as if you could sit with a shrink for an hour a week, talk about your problems. He may medicate you, and then you're in a facility, you're clean, you're sober, at least for now. The meds that we're given may have a chance to work, may affect you differently. When you get out, you may just stick to the program and hopefully make an improvement in your life. So I think that 6 hours a week from Mind Springs Health is real innovative, and I think it's going to help us out a lot with our mentally ill population in jail. That is directly from Mind Springs, and they got funding through...
Yeah, I want to make,
They have funding through Healthy Community.
yeah, but I want to
That
make.
is from the Healthy, okay. So I think that's going to be a real interesting, and I hate to use the word experiment, but to see how men and women in jail who, without the influence of drugs and alcohol and
Respond to
one-on-one
that.
counseling, can really see if they could change behavior. So it's going to be interesting, but our mentally ill population in jail is a national problem, and we have it as well.
Rachel?
Yeah, just a kind of small side note. The National Association of Counties and CCI have always been strong advocates for changing the way that Medicaid operates. And when someone is admitted or incarcerated, they lose all benefits. It's not innocent until proven guilty. They have suddenly lost their medical insurance. And so when they get out, they don't have access to the same prescriptions that they would have before or other medical needs. And frankly, if they have medical needs beyond the mental health issues, your county ends up picking up those costs because the insurance has been eliminated, and it takes quite a while to get them back on. So there's efforts, and I think we should try to work as well to continue to integrate our Health and Human Services with the release dates with folks. So as much as possible, we can get them signed back up and get them back with an ability to get their meds. But that's one of the biggest issues. People say, you know, they lose their meds and then they come back. And
I think the great point that you made was innocent till proven guilty. Pretrial people in jail have lost their benefits.
yeah,
And they are pretrial. They're not convicted of anything. They're just sitting there because they can't get out without their benefits.
Have an MOU with the sheriff's office and the jail to do a warm handoff with people before they get discharged from the jail to get them enrolled in Medicaid. when
Okay.
they leave.
Okay.
So we're obviously
Have Joey
doing
repeat.
that, and hopefully we're capturing people early.
Okay.
But it's still a challenge.
Yeah,
Joe, can you repeat that really briefly, just because you're on microphone and she's not?
Sorry.
Yeah, why don't you do it?
Okay.
I'd rather come from the professional than
Yeah,
me
there we go.
butcher it.
We have an MOU with the jail and with the sheriff's office between Human Services and the sheriff to ensure that anyone who's being discharged from the jail and is likely qualifies for Medicaid gets an application beforehand, and the application gets started before they leave. In addition, if someone's in the jail and has a hospitalization, now the law allows for them to get emergency Medicaid. And so we're involved on that level if that happens.
Okay.
So we're feeling better about that, but there's definitely opportunities for us to work with the jail more comprehensively around how we support the inmates on their transition out.
Thank you.
I told you she could do a better job than I could. And to add on that note, our inmates are becoming more expensive, the more mentally ill inmates. We have an inmate currently that is so high maintenance, I cannot manage her in the facility I have. And we ship her off to another facility. I'm sorry, I just identified the person by gender, but we send them to another facility, usually Park County, who's a for-profit jail, and that costs me $70 a day instead of the approximately 30 for here. So the more inmates I have that are more difficult to manage, the more that number goes up and the more it affects our bottom line.
What was the word you used to describe
I'm sorry?
the word querulous? I don't know if you were the one who wrote that in the thing, but it means it's describing that type of person as a whiny complainer.
Knowing that word, I would say that word came from Don Bird, who is an incredible
Maybe
wordsmith.
that was his word.
Steve, you would never hear me use a word
Okay.
like that.
I'll have to thank Don if I see him.
So that continues to be a problem. Like I said, these are national issues, not Pitkin County issues. If they were Pitkin County issues, I think we could probably tackle them, but they're bigger than that. We have, as we said, one new position is a dispatcher FTE. Right now, dispatch is in, as I said, a shortage. We are shipping dispatchers here from Vail to help us and paying them an hourly rate that's probably a little more than what they get. We had a one-time increase to our hourly salary during this time. We were down 5 or 6 dispatchers. That means I have dispatchers and supervisors working 50 hours a week. So we had to give them additional $3 an hour bump to more or less hazardous duty pay. But we're having high retention and hiring issues there. And once again, stems from probably housing, I would say, is the bottom line. I think everyone wants to be here but can't afford to be here. And lastly, and I don't know, I'll leave the rest for questions, is the $5,000 jail PREA audit. PREA, as I believe I explained last year, is a pilot program that the Pitkin County Sheriff's Office and Jackson County Sheriff's Office took on. This program got a lot of pushback from the other 62 sheriffs in Colorado. They did not want to participate in PREA. PREA is an acronym for the Prison Rape Elimination Act. It allows for inmates in a safe environment to report crimes against them, either by jail staff, prison staff, or other inmates. I hate to be the downer in the group, but sexual abuse and sexual assault in a jail and prison environment is very high. It's a dangerous place. Don't fool yourself. Even our jail could be a very dangerous place. So the feds told us that we had to comply with PREA. We volunteered, got some pushback from other sheriffs. Now the feds have said the program is a success. All sheriffs have to comply. The ones that don't will lose federal funding, and some are willing to do that because they don't believe in PREA, which I can't get my head wrapped around. But that's some of the mentality that we deal with. So I believe that's my presentation. But I'll be available for questions, or if I missed anything, guys, please fill me in. Michael?
Joey, it occurs to me that, I mean, you were reluctant to ask for video cameras for your vehicles and for your...
I'm sorry, Michael?
You were reluctant to ask for video cameras for your vehicles and for your officers, but I think you should put some plan in place to figure out what structure you'd like to introduce that into. So whether it's a few cars one year and a few cars the next year, because I don't think we can not have it. Personally, I don't know how the other commissioners feel, but I think it leads to a huge liability for the county. And without that kind of documentation, we'll have the word of an officer, and that'll be hard on that officer and hard on the department. And so I don't want to wait until we have to do it all in one fell swoop. I think we need to gradually do it and get it done within 3 years. I don't think there's any way around it. So that's the way I feel about it.
Well, you know, the city sent out their survey asking city residents about, you know, video cameras for the officers, and I wasn't necessarily supportive of it. But in light of what's happening on a national level, I think for the sheriff's office, it's more to protect our officers, our deputies, I think, because of issues of coming up of false claims. And so I think it's a discussion we should probably have at greater length, especially in light of your participation with this this appointed committee, and that's hopefully they're going to be coming back in April. Did you say?
We're March to April.
Okay, then I think that's a discussion we should have when there's some findings there, because I have a feeling it's going to be going in that direction.
I hear what you're both saying, and don't disagree with it 100%. The body cameras I have a problem with because most agencies are employing them to keep their complaints down against their officers, or for if Patty Clapper comes in and says this officer mistreated me. A lot of these agencies are going to the videotape, as we would say, and say, sorry, Miss Clapper, I don't know what you saw, but, you know, and it's kind of a gotcha moment, as we're hearing in the papers now. I get very little complaints about my officers, and I have not had an instance yet where I said, wow, I wish I had an in-car camera where I could see what really happened. I'm learning a lot about video and officer recording. The angle is not always what it appears.
Yeah.
And Michael, I've given this a lot of thought, and I'll continue to do it. But I also want to be responsible with why and how we do it. If we could phase them in slowly, that might be an option. The cost is really something that sticks with me, and that's not a primary reason to say why we shouldn't do it, but it is costly.
No,
I mean, I have, excuse me one second, Michael. The other issue I have is that with I think it's different than the Aspen Police Department, is they have 10 vehicles, I have 30. And to outfit every one of them is a chore.
Yeah.
So,
you know, Joey, I just want to tell you that I'm comfortable with working with a plan for funding. I'm not going to say you have to do it. You know, you're the expert at that, but I don't want to put the county in a position of having to do it in 1 year because we have a lawsuit. You know, I just want to be prepared for the future, and that's all I want. And I trust your judgment on how to be prepared for the future, but you need to trust the commissioners that we're committed to public safety. The buildings are a manifestation of that, and they're a manifestation of we've moved into a different phase of this community, a more sophisticated phase where we need more facilities. And part of that is videoing. So let's leave it at that. I just wanted to let you know that I'm here in conjunction with you and with your needs.
And Michael, and I hear you, and that support feels unbelievable to me to hear a commissioner, and I'm pretty sure you all would feel the same way after discussion, that you would support this. With that in mind, I can now knock the financial end off of this plate and make a real good decision based on whether or not we really need them or not, and that I'll do that. And thank you for that support. That really means a lot to me.
Rachel?
Yeah, thank you. I can appreciate the concerns Michael's bringing forward, but I'm not ready to make a judgment on that one way or the other. In terms of supporting your office for public safety, absolutely. But as Patty has said, I'd rather have a much larger discussion once the report comes out. You know, I can't help but think of football games when they call the play back and the refs review, and you know, it looks like it was you know, intentional grounding, but now at a different angle it's not, and you can tell, you know, from 3 different camera angles how easy it is to make the wrong call, or to think it was legitimate and it wasn't legitimate. And so I am concerned about that, and I would like to really understand the full set of costs. You know, the storage of 30 videos for how long, from 30 cars, and how are they reviewed, and who does the reviewing, and how do you maintain the equipment, and are you creating a bigger liability when someone's equipment fails and that's the one that didn't get recorded? And I look at the salary issues that we have, and you know, for me it might be better to keep incredibly well-trained community policing officers here instead of losing them, than saying, hey, you're not getting a raise this year or next year, but we're investing $750,000 in equipment for your cameras. And so to me, it's been a very concerning issue that we see nationwide, but I really don't see that we've had those sort of larger issues within the attitude of our sheriff's department. And so I don't want to just jump on a bandwagon because it sounds like the right thing to do, when perhaps it's more important to have a housing program going forward within our budget for replacement and succession training on officers. So I just want to look at the big picture.
I will tell you, from what I'm learning, the storage, redaction, and equipment for a department this size, that $750,000 to $1 million wouldn't be too far off. Mm-hmm. It is incredibly, video, as we know from downloading Netflix and stuff, takes up an incredible amount of room on a hard drive somewhere. This is massive. And whether or not some of the things we're talking about, and I'm off track on our budget thing, but some of the things the group talks about is should the cameras be on all the time, 10 hours a day. When you're on your shift, that thing's activated. Unless you're in a private meeting with a spouse or a supervisor or a men's room or ladies' room. That's it. And think of that storage over a 10-hour day of what needs to be over 30 cops or 100 cops or 200 cops.
Yeah. Again, we'll have a bigger conversation.
Yeah, but I appreciate the support. I appreciate that input. I believe in hiring really smart people who can do this job without relying on going back. And this is a problem for me with the video. There's a lot of officers go back, plug the video in, and write their report based on what the camera saw, not necessarily what they saw, remembered, or interpreted. And that changes things and slants it very much in the police favor. But this is a philosophical discussion for another time. Any other questions about the sheriff or his budget?
Well, just real quickly weighing in on this same issue. I've driven school buses and Snowmass Village shuttle buses for years that have had cameras in them. The cameras are not always on, and you don't know sometimes when they're on or not. That's up to the management. But it's, I think on the village shuttle buses, I think they're on all the time. The school buses were only on once in a while, but it was a deterrent to the kids to behave well on the bus. Was one of the reasons for that. But then I noticed the officer in Commerce City who was just shot in a traffic stop, and they weren't even sure of the license plate on the guy. They had the numbers mixed up, so they weren't positive on the numbers. And if there had been a camera that had recorded the license plate of the car he stopped, then they wouldn't have that discrepancy.
And I think that's Michael's point 100%. That car had no video, and a vest saved the guy's life, but there's no way to find out exactly who that person was or license plate. And the two biggest fears I have is losing a deputy or losing an inmate. And I'm going to agree with Michael. If that were to happen here and I didn't have a camera, I'd feel pretty bad. We all would. That's stuff to take into consideration. How are we doing on time, Connie?
I think we need to move on.
Good? Okay, thank you all.
Thank you very much.
See you in 365 days.
Does the board need to take a little break before we move on? We still have 3 sections left of our budget presentation. We could do a 5-minute break and,
Sure.
I'm
is that
okay.
okay? Or
Okay.
Yeah, let's take a 5-minute break. Okay, Connie, continuing.
For employee housing, and which leads us right into our next success factor, which is diverse and livable housing options. We have John Redmond, the finance director here, who will talk about our housing budget.
That housing budget really is two parts. There's our partnership with the City of Aspen through taking half of the net operating expenditures for APCHA. The other side is about acquisition of existing housing and creation of new housing. I think at the very beginning of today's presentation, you saw a pie chart of the entire group's spending, and it's somewhat dwarfed by housing, and that's because our piece of the action, so to speak, is really a capital expenditure, which is about 90% of that slice of the pie is really about capital spending, not operating expenditures on labor and those kind of things. So I think we have to kind of see one side is a little bit more about labor, and this giant piece is about future acquisitions and or creation of housing. Overall, we have for APCHA, we have a $214,000 commitment to them. There's a slight increase, a 9% increase to their budget, and a 3% increase in the out years. I think one of the big things that we've seen with the new director is to focus more attention on enforcement of people in the existing units within the big umbrella of community housing. And there's a little bit money in there towards new facilities. Is there any question about APCHA?
My question is, I'm assuming that the 9% increase on our budget is matched with a similar increase on the cities.
Yes.
So that's showing about an 18% increase going to APCHA just because of enforcement issues or administration issues, or it seems like it's a big jump.
Yeah, I think it's probably the devil's in the details. I would have to go back and kind of get a little bit more definitive answer for you, George. But it is substantial.
Yeah, you'd have to think, because of their move to their new facility, has to bring up some increased rental costs, because they're renting that facility there.
That's probably a good piece of it. I know that when they were in the garden level with us, it was what would be considered quite reasonable rent, as opposed to free market rent. So that may be a big piece of it.
Well, and do we know if they will be moving in when the city builds their new facility?
From what I've heard, yes.
Okay, so that'll be helpful, hopefully. Okay.
Yeah, I was just trying to think about the process here. Will we be doing a joint meeting with the city to go over some of the joint budgets like APCHA?
I believe so.
Okay, because often their operating and administrative expenses have been offset or are offset by the revenues they receive from new sales of units or resales. And so it would just be interesting. I would imagine it's because they don't have or anticipate having a lot of new units coming on the market this year, but I would really love to see that relationship between the revenues into the office as well as our expenses.
Yes.
You know, I mean, we're just seeing one number of our input into a larger office, and I'd like to understand the office's overall
And it
budget.
may be a timing difference in terms of normal expenditures versus, like you say, there's a wave of transactional stuff.
Yeah.
So, Rachel, are you saying that where our funding for APCHA comes out of the general fund with this increase, but the city has a different funding mechanism that's not tapping into the general fund?
Well, yes, they have their sales tax and real estate transfer tax, which don't have quite the same restrictions that our mitigation money has. So yes, our funding of the office comes from our general fund, but also the support of the office itself in the past has been in large ways offset by the revenues of the commission on sales. And so I just would like to see more of the whole office's budget as opposed to just our share of their budget.
We can bring back more information on that at our next meeting.
Okay. Yeah, and again, just in the past, I think we've done some joint meetings on it. We don't have to do joint meetings, but I'd just like to see the whole picture.
You know, for EOTC things, we look at everything with a fine tooth comb. We see the line item things. And here we just have payment to APSA, $214,300, and that's all we really know.
Okay.
So I agree with you, Rachel.
Yeah. And, the one thought for me, and I'm assuming it doesn't include the property management fee on our units, and that would be separately paid to them as well.
That's paid out of our housing fund.
Yes.
Okay, thank you.
Now, on the other side, which is about acquisition of existing free market housing, I think we have here in the slide 35, we're showing 2 units were acquired in the last year, but it's actually 3. We have a unit at the ABC, and in the fall, we've just had 2 units which we picked up down Valley, which are currently getting repaired and ready to go. Overall, we continue to acquire a couple of units a year. The housing market has really picked up, especially down Valley, so it's getting more and more difficult to find quote-unquote deals that really fit our requirements. And we believe in 2016 it's going to continue to be that way. Probably the biggest well, not probably, but absolutely the largest projected expenditure that we are looking at in the future is a potential partnership with the Aspen Skiing Company and creating some units on the south side in Basalt. At this point, it's still somewhat conceptual drawing-wise. We're looking at potentially our side of this deal would be that we would acquire 12 units, and those would be currently what we're talking about is 2 and 3 bedroom units, although the final mix in terms of what those are going to be has not yet been decided. The projected top line on that project is roughly $8 million, and we're hoping to come in substantially less than that. Any questions about acquisitions? Okay. I think the challenges, again, are about finding new properties, managing existing properties. Demand for these properties is kind of all over the map. We have, gosh, just in the last 30 days, we had somebody from what we would consider to be public safety, that being a dispatcher, come into a new job, needing a unit for 30 days. We were able to take care of that on a short-term deal. And I think as part of the conversation with Joe, and I think in looking at what Snowmass Village is saying, can there be priority housing for certain, for teachers, for public safety types? We really haven't seen demand from public safety for housing, which is an interesting part. In addition to that, we're trying to do some other things. John, I know, has spoken to you about a joint equity program, which is still in development, which would be, in a brief description, the county would take as much as 40% of the purchase price of a unit as a partnership in a way to get people into better housing as an incentive to be either continue as an employee or come to be an employee at Pitkin County, because in recruiting people, it's difficult. People are coming from the Front Range or other areas where they've had a large house, and they come here and suddenly it's, guess what? You can have a 2-bedroom apartment, maybe, down Valley. And so what we're trying to do is enhance that. Any questions about that? Okay.
Okay, we do have a decision point on the budget and 5-year plan for the housing fund. We have a total of about $916,000 in revenues, most of which is housing impact fee money. and then also some rental income. And the expenditures, we have $1 million set aside for possible purchases of individual units in 2016, and then a maximum of $8 million for the partnership that John mentioned, and then some other miscellaneous expenses for a total of $9.4 million.
Rachel?
Yeah, I'm willing to support the budget as it's being presented. Again, I would like more detail on the housing office itself. But I guess the 8 million, 12 units, you know, and I know you're putting a conservative high number in there because that's coming out to like $666,000 per unit subsidy, and that seems very high when you're considering that you're getting down to basalt. It's not a in-town Aspen land price type of project, and so I just would be interested in how that compares with the subsidy required at other projects in the future, and what we're getting out of it for that.
Well, and that number comes from an initial estimate of the unit size to be 1,500 to 2,000 feet. So
Yeah,
we're looking
I don't
at,
have the number of bedrooms to divide it by bedrooms.
no, but
you know.
it's, I think on a per square foot, it's somewhere in the $300
$300.
a foot plus. And again, it's a conservative estimate right now.
Okay, thank you.
Okay.
So do we have
So
the,
let me
go
make
ahead.
one other last comment, but just by chance last night, I had been contacted by a few members of the Aspen Next Gen Committee who are working on housing issues to kind of get the history of the housing program and general broader philosophical. And they said that one of the things the city of Aspen had asked them to do is look at the concept of regional housing, and could there be a regional housing authority. And of course I said there's a lot of issues to be worked out there. But that, and then followed, of course, by Snowmaster's newspaper article today about what about regional housing. And if anyone saw the Denver Post had a large layout in their Sunday issue about the extreme crisis that's hitting other resorts that had less rental units available and things. It really seems that focusing on the housing outcomes and certainly succession planning within our county should be a key discussion item for us next year. And you know, perhaps one of our retreat topics that we really delve into in some greater depth. What's I thinking? The challenges are just creeping up on us more quickly, and we'd have to take a bigger look at it. So I'd like to do that.
Well, one of the big things that we've seen is the school district lines is also impacting us, in that people want to be in the Aspen School District. And there comes a big price with that. And it just makes it even more difficult.
Thank
you. I remember when I was campaigning before my election, one of the questions the press was always asking was, what would I do with our housing money, that $12 million or however much the amount was. They were trying to make it a campaign issue, I think. But I'm proud of what we have done with the money. I think we've spent it wisely, and we have, you know, different individual units that are in circulation, people living in them, and we're working on big projects. So, you know, I can support this budget the way it is. I'd love to see our big partnership project come to fruition, and we're going in the right direction, though.
Yeah, I can move forward with this, but I do want to see the breakdown for the APJA, so we can figure out those numbers. I think that's important for us to have that information behind us before we do our final approvals. Thanks, John.
Thank you.
The next success factor is access to recreation, education, arts, and culture. And Kathy Chandler, our librarian, will come to present her budget for 2016.
Morning.
Morning.
Well, part of John Peacock's philosophy of life is that you should celebrate successes. So I thought maybe we'd do a fast review of some of the things that we were about to be able to celebrate in reality when the library reopens. And so I thought maybe we would start with this picture of the design and just sort of click through the different promises that we had made to the public when we started this project of the things that we were going to accomplish if we were able to do the addition and the renovation. One of the program priorities was to take advantage of the site that the library was built on, to try to bring the outdoors indoors and vice versa. So when you look at the new addition that's being built right now on the top of the parking garage, you can see that the architect has made use of some big sliding glass doors that will lead into, on the right-hand side of your screen there, you see the new community meeting room, and on the left, there's an amphitheater that goes down into the new children's library, and both of those have really great views, and I think they're going to be a pleasure to be in those spaces as opposed to the old meeting room that had such a low ceiling down in the lower level of the library. Also, some of the other priorities that we were working on was to reduce the carbon footprint of the building. And so there's a lot of things that are happening inside that building that will help with the lighting. We're trying to bring more natural light into the areas that we can. We've moved a lot of the staff offices that were in areas that had windows. We've grouped the staff down in the lower level of the library near the alley that goes into the parking garage, and opened up a lot of windows to public spaces. So we're also going to replace the skylights in the building, and they were just on the verge of failing when the roof had several leaks in it, and the first thing that we did when we started this project was to replace the roof, and then we put a lot of insulation in to increase the R factor there. But when they were working on the roof, they said that the skylights were just about to start to fail. So we decided that we would go ahead and replace those because we were repairing the interior ceiling, and we didn't want to have new leaks as soon as we reopen. But with the new skylights, we can have more. And then we're also putting LED lighting fixtures throughout the, or LED, I should say, lighting fixtures throughout the entire structure. And hopefully those will make a big impact in our use of electricity. Also, when we started the project, we had just found out that there was some radon in the lower level of the building in the storage rooms and some of the staff areas. And so we've incorporated the radon mitigation in with the rest of the building project. And on the roof of the children's library, there'll be an outdoor reading deck, and that has a bioswale in it. And so a lot of the stormwater rain runoff will run through that bioswale and be filtered before it enters the Roaring Fork. There's also a big retention tank that has been put into the driveway on the north side of the building that leads into the parking garage. It's been buried there, and there'll be a couple more bioswales in the front lawn to help filter the rainwater. Another thing that we were working on was ADA accessibility, and I don't know if you want to scoot through. If you go on through to the blueprints, one thing that we're doing is putting much lower shelves in the building and wider aisles between the shelves. So the highest any of the shelves are going to be in the building will be 66 inches high, and we used to have them over 90 inches high. So this way, if someone's confined to a wheelchair, they'll be able to reach all of the items in the collection. And we've also done some grant proposals and received funding to put hearing loops in the floor of the new meeting room, and also in the floor of the area of the children's room that's going to be the crafts and story hour and science portion of the children's room. So let's see, we're also putting family restrooms on every floor so that if people need help from another family member, that will be available. And we've promised that we would make the children's area more secure. Our old children's room was just a couple of steps off of Mill Street, and everybody in town used that as a shortcut into the library. So now the children's room's going to be a dedicated area that will also include this programming area so that we can take all of the children's programs out of the meeting room and open that community meeting room up to a lot more community use as opposed to using it a lot of times for library programming. So let's see, we're kind of flipping around here, aren't we, Connie? I'm sorry. But if you want to back up to the fundraising slide. We're continuing to work on the fundraising. We're hoping to raise another $835,000. And if we're able to do that, then we'll be able to pay back the loan that you folks said that we could borrow if we were not successful. And the way things stand currently, if we do need to borrow that money from the county, then there will be 12% of the project will have been funded through taxpayers' money. If we're successful with our fundraising, that will only be 6% of the project will have come from the library's regular operating budget, and that amounts to $790,000 that we took out of our regular capital replacement schedule. But with the different things that I've mentioned about fixing the roof and the skylights and the lighting, there were some other things that needed to be done in the building because it'd been 15 years since we worked on it, and that was replacing the carpeting and the painting. And so when you put all of those normal capital replacement schedule items together, that's about $1,400,000 worth of just regular fixing things up. And I'm also thinking I didn't include the new chiller. So anyway, we're feeling good about the fundraising effort, and hope that people at the end of the year are looking to make donations, and we would be looking to receive them. So let's see, if you wanted to look at the floor plan again, Connie. Some of the other things that we accomplished that we had as our goals was to make a new teen area. So when you look at that blueprint, what you can see, the entrance there is in the lower left-hand corner. Up at the top of that blueprint is where the teen area is going to be, and over in the far left-hand corner will be a small group study room or a meeting room, and those will be available to the public to use, and there's going to be 3 of those in the building. They'll seat about 10 people around 3 flip-top tables. We're trying to make them as flexible as possible, and each of them will have a large screen TV that you'll be able to bring your own computer in, and then using a puck system, you can either turn your computer on or off and, share your different images of a group of people working with their computers. They can take turns displaying them on the large screen TV. And that capability is also available right next door in the teen library. You can see that group seating area there, and there's also computers that are specifically for the teens. And then as you move further to the right along the blueprint in the top there, you'll see the maker spaces that are being created. And part of the work that the staff is doing now while we're in the smaller old powerhouse that the city has been nice enough to loan to us for a temporary facility, staff is using that time to hone their skills with a lot of the new equipment that's going to be available for the public in these spaces. So in there, there'll be computer equipment that people can work to make digital presentations. There'll be a green screen there and video cameras. There'll be a small sound booth with digital keyboards and guitars so that people can produce music. And then in the content creation lab, there will be things like sewing machines, craft things available so that people can actually make things. The whole concept in a newer library is that it's not just a repository for somebody else's work, it's also a place where you can create your own content. And several of those spaces used to be dedicated to the compact shelving for the periodical collection, so that will now be moved downstairs because, again, that was a room that had windows. Another one of those was a staff office that will be freed up for the public on the main floor. Right in the center of the room is going to be a cafe area so that people can bring in a light lunch, or there's also a coffee bar that will be there, kind of a serve yourself and on your honor system. And the main floor will also have the DVD and the CD, the music collection. So we have a really large music collection to support the MAA, and that will be featured there on the main floor. And we don't have blueprints of the upper or lower level, but the lower level will primarily be the nonfiction collection and reference. So that will be more the contemplative, quiet study area of the library. And as I said, it will hold the staff offices, and then we have a storage room that we'll continue to use, but the compact shelving will be moved down there so that we can keep the recorded performances of the MAA secure in that area. And then up on the mezzanine, we've done a lot of infill. The area that's over the children's library has been filled in. It used to just kind of be a walkway, and now it will contain the fiction collection, and there'll be seating along the windows looking toward the ski mountain so that people can enjoy that view. And over in the northwest corner of the building will be tutoring spaces. They'll be open, but they'll be kind of split with whiteboards that people can use to make notes on. But English in Action has 85 volunteers in town, and a lot of those people meet with their person who's working on their English language skills in the library. And then there are a lot of just tutors that meet with students after school. And the other part of the mezzanine will hold the periodical collection and have easy seating for reading magazines. And then you'll be able to go out on the rooftop deck over the children's area too to read outside when the weather's pleasant. So, John, oh, well, also, people thought that you guys might want to see what the meeting room looked like. So this is just some samples of different ways that that room can be configured, but should be able to hold 98 to 100 people seated just in even at the lecture tables. I think there they could get, how many in there? Well, I can't read it. But anyway, good-sized meeting room, and with a really high ceiling, hopefully very good acoustics, and projection screen that's up high enough so that it's over people's, the image will be higher than people's heads when you're seated. In the old meeting room, if you weren't in the front row, you really couldn't see the screen very well. Then John Peacock had suggested that we let people know that the building is actually going to look different on the inside when we open it. So this is kind of a sample of the color palette that the people that we've been working with on the interior design, we're trying to put some of the colors in the building that are, you know, on view here in our spectacular neighborhood. And here's just a tear sheet from what some of the furniture in the children's room will look like. And, oh, well, you want to pop back again. On the lower right-hand corner, that shows some interactive panels for early literacy skills. And this is kind of part of the notion that kids are too small to fail, as opposed to the banking industry being too big. These tools, we received a grant from the Lewis and Harold Price Foundation to help pay for these, and also for one of the hearing loops. And these are things that little kids can use with either by themselves or with a guardian, who they sort of encourage discussion. And a lot of studies of being ready to go to school, a lot of that readiness has to do with the amount of language a child has been exposed to when they're really little. So these things kind of help promote an adult talking to the child about what's going on with these little boards. So we're looking forward to that. And then to the left there's a bench, and underneath that there'll be tubs of different kinds of activities, things for different sort of activities that the kids can pull out. And then we have after-school crafts and science programs on Wednesdays when there's early release dates, in addition to all of the regular reading programs that we have. So anyway, that is some of the children's furniture. This is some of the adult furniture that we picked out. These are just samples, so they'll actually have different kinds of upholstery on them. But the couch in the upper left-hand corner will actually be in the fiction area, along with some of those kind of sculptured chairs. And then down in the lower area, we selected this chair when we were on our way to the airport to go look at furniture in Minneapolis with the furniture consultants, but we stopped by one of the office supply places there that we'd worked with before, and found this model. It was just really comfortable. So we've been trying to find things that were comfortable, but also we have a wide variety of furniture in the new library that we did not have in the old building. We used to just have all of the chairs at the tables, and we had 22 lounge chairs that were all the same. And now there's actually, I think, 26 different kinds of seating in the library, and it's basically designed to come in and either meet with other people quietly or work on a project individually. So did you want to say anything about the budget, or is this the budget meeting?
So this is the 2016 budget and 5-year plan for the library. You will see there's $4.5 million in revenue. 3.7 of that is from the property tax. And that's at the top of the sheet in the green column. And still anticipating some donation pledges that will be coming in 2016. Then expenditures are in the middle of the page. 3.7 million in expenditures. This does not include the building expenditure, which was already budgeted in 2014, 2015, then another supplemental request mid-2015. So the full capital expenditure has already been included in 2015, and we are not budgeting any new money for that. 2016 and beyond is basically just your general operations and normal replacements for the library fund. Down toward, and you do see that there is an annual surplus each year. Their budget is balanced for the 5-year plan. Down below towards the bottom, you see a negative 500,000 in 2016 and 17. That's for repayment of the general fund for the loan that was done this year. And then the fund balance down at the very bottom. Are there any questions on the budget and 5-year plan?
Rachel?
Well, I'm really looking forward to cutting that ribbon when that's open, and I'm sure you are too. And I think you've done a wonderful job, you and your board and staff who's been supportive of that. It's going to be a great asset for the community. I wanted to kind of point out something perhaps for you to keep your eye on. I've recently noticed that Mill Street, where it joins Main Street, has been reduced down to 2 lanes, and it used to be 3 lanes. So there's if you're coming up Mill Street, there's a left-hand turn, and then there's a combined right-hand turn or straight across. And that was changed by CDOT, and I believe the city engineering department is taking a look at it now to see if it can be restored to 3 lanes. But if you have a car that's waiting to go across while the pedestrians are all there, no one can take a right-hand turn. Or if you're waiting for someone to take a right-hand turn while all the pedestrians are crossing, no one can go straight. And I'm really concerned about that backing down into the crosswalk, which all the kids from the Yellow Brick Center use to come over to the to the library. And so it's outside of the library, but yet it impacts the safety of people coming to and from the library. And so they're working on it now, and you may want to just check in and be sure that the input and the safety of our patrons is considered. Thank you.
Decision points, we need not move our heads.
Yes.
I
Do
would
we have a-
echo, Patty and I went on the tour,
It's
and
great.
you could just see the whole thing unfolding, what we've been looking at on paper. So it's like this vision is being built, and I am really looking forward to having the new library open, and I think the community is going to really love it.
Steve, I just want to, and I appreciate in that first slide that you showed us of the exterior of the library facing, you can see the blended glass and steel, and I appreciate that. So it's not this shiny metal so far that's facing out there, because it was important for me to keep those structures as close to the historic as possible, and since we couldn't use brick there, I think you've done a great job.
Yeah, the weight was going to be prohibitive, so
I thank you for
thanks.
that.
So the budget looks good. I know you rely a lot on donations to make it work, which that's an ongoing effort, but thumbs up for the, this is decision point to approve this. Any
You've got
objections
3.
to it? Okay. So, thank you.
Thank you. Thanks, Connie.
Thank you. The next success factor is improved community engagement and participation. And I know we're running a little bit late on time. If the board will give us another 5 minutes, we'll finish up.
Pat's really good at communicating quickly.
Yes, right. I'm always last. I'm Pat Bingham, Community Relations Coordinator for Pitkin County. And wow, I've sat through this budget hearing today, and I don't always get the luxury of watching all of the budget hearings when I'm at the desk at the office, but I think this should be required viewing for members of the media. Hi, how are you? And the public, because what a great way to find out what this county is doing, the stories that are being told today, the things that are being accomplished. I couldn't do it any better. It's all being talked about during these hearings, and I'm inspired. I think it's great. And it inspires me because my job is to tell the story of the county in lots of different ways. Starting with the first, just the budget, the biggest change in my budget is going to be the fact that this year is our year to do a community survey again. So that'll be kind of fun because we can take the information that we found last time and ask many of the same questions again and add new questions and compare it and see how we're doing overall. So we're looking forward to that. I've spent a lot of time this year working with several departments on who they are, their identities. And in that process, I think just trying to come up with a logo or a brand, it really forces the different departments to think about who they are and learn more about who they are than they already know. Healthy Rivers and Streams, this board has been around for a number of years. And in coming up with this logo that you see, they had to decide what differentiates themselves from other people that do river conservation work. And they really came up with these strong terms, protect, defend, enhance, which really separates them from some of the other good work that's being done for the health of rivers. So that was a really, I think, an enlightening process for them. Pitkin County Senior Services, that was a difficult image to come up with, something that would resonate with not just really elderly people, but people like myself who are approaching, we're in our 60s, we're seniors, I guess. Oh my God, I can't believe I said that. Yeah, okay, so anyway, that's been a really interesting process, and I think it's been more valuable than just coming up with an image on paper. It's been valuable in that we look inwardly and ask ourselves, who are we? And then how can we communicate that to the public? So that's been a bit of a project. Then we've had some of the success stories, I think, are the ongoing airport campaign. I fly my selfie. I know some people thought that was kind of silly, but We had a lot of fun coming up with the images for that. The one that you see here is Noah Hoffman. He's our U.S. Nordic team member who's been very successful in racing all over the world, and we had people sending us pictures like this that we used in this campaign, so we found it to be kind of fun. The new GIS, Maps and More, Pitkin Maps and More. We've got GIS Day coming up next week on the 18th. I'm not a map person, but the more I met with Mary Lackner and Tyler and all the people in that department, I found out there are so many things, user-friendly things that you can do online that you can do through maps. One of the big things for me was make a mailing list using a map. And so we're really excited about promoting the GIS department in a much higher profile way than we ever have before. You're going to be seeing more from them, and that big open house next week, a little plug for that, GIS Day at the Firehouse in Aspen next week will be neat. We did a very big campaign for wildfire, and we had a very wet summer. So I think, though, that it wasn't wasted effort, because with all that moisture that we've had, we're going to have more fuel to burn in the future. So I think just continuing to talk about the risk for wildfire and the need to mitigate, that's an ongoing effort. And we work closely with Valerie McDonald on that, and I think that's been a successful project. Produced a few videos this year. One of the most recent was the airport triennial emergency drill video. I don't know if you've had a chance to see it. It was really action-packed. It was very, we wanted to try to give the community the feel of not just what a drill is like, but what a real incident would be like. And so if you haven't had a chance to look at that, it's short and really tells the story of the kind of training that these firefighters have to go through if the worst should happen at the airport. We did a video on the facilities and told the story of our facilities. We did a little how-to video on Maps and More. Mary was able to be in front of a green screen, which is kind of fun. She was very nervous. She didn't want to be on television, but a green screen is a thing you can put behind and put any image behind, and you can be discussing it as you talk. And that was a really good way to introduce Maps and More, with her describing all the things that it would do. We did some short little pieces with all the fire chiefs in the valley, from Aspen to Carbondale, talking about wildfire problems. And they were really short, so we could use them on social media. Some of their biggest concerns as fire chiefs, and each of them had a different concern. And so we were able to do a lot of good education with those. Of course, the library, groundbreaking, and we have the ribbon cutting to look forward to. We'll definitely catch that on video. And one of the, I guess, a big success story is the hard work of Health and Human Services. Connie, do you have audio here? Because it won't work if you don't have audio, the slide with the video.
I'm not sure if I can
I don't think it
pull this
shows.
up.
It didn't look like it got properly inserted. Anyway, they did a series of very short video spots that were played not just on government television, not just on this station, but on Comcast, which we can lasso an audience between Rifle and Aspen. That's the smallest audience we can capture, and get a really good deal on Comcast TV. So you may be watching a football game or something news, and it's a high-profile program, and you'll see the Stop Fighting It Hurts ad or the airport ad. It's been a low-cost way for us to get the information out in a much higher profile way. So that's been, and they won an award for that spot.
Did we produce the spots, or did we buy into a larger campaign using the spots?
We produced them.
They're amazing.
Yeah.
Pat, great production values.
Yeah, that team takes a village.
Huge.
So I didn't really, everybody else talked about challenges, and mine were just success and then my new initiatives. So I thought, well, I'll bring up a challenge. I was sitting there taking notes. I think one of the biggest challenges I face in my department is continuing to support our embracing of technology as a county government, internally and externally. How do we offer things to our public? We seem to do a really good job of outreach, but we also have ways for the public to get information that we need to teach them about, that have to do with going to our website, opting into some of the things that we offer. We have many, many different agendas that you can opt into, whether it be the open space and trails, your county commissioner meetings. We do our press releases there, planning and zoning commission, and a number of other things you can opt into to be automatically emailed with that information via our website. So, so encouraging the public to embrace the kind of technology we have so that they don't ever have to ask, well, what does Pitkin County do? What do they do? Well, we show our really riveting budget hearings live streamed on television and after the fact. You can go right to the point of a meeting by clicking on an agenda item and just listening to the one you want to listen to. So we have a lot of technology that we can use to help tell the story. Internally, we face the same challenge in teaching our employees, all 200 and odd more of them, not they're odd, but they're more than 200, how to embrace the technology that we have, because we're a big organization, and I'm a one-person department, and I feel responsible for external and internal communication, but I can't do it for every single department as well as it needs to be done. So we are, as a county, are going to have to learn to embrace technology, our intranet with the tranet. That's where we're going to keep essential information for county employees, and they're going to have to kind of self-serve a little bit. We're going to have to get used to, rather than picking up the phone and saying, oh my gosh, what do I do, what do I do? We've got to take a deep breath and use the intranet and read about what each other is doing. Should be required, budget hearings should be required viewing for every county employee, because I've learned more today about the departments that presented today than I ever knew before. I mean, I didn't know Joe DeSalvo was on a team to look into body cameras. I didn't know that, you know, some of the things that were going on in the jail were going on. I had no idea that of the many, many programs that Health and Human Services is doing in the library. I didn't know what the furniture looked like. I mean, this is a wealth of information. So we're telling our story even without, you know, making a big effort. We do it every year automatically. So I think my initiatives this year are going to be that community survey and doing a good job with that. We'll use the same company, and they're going to offer it to us at the same price, which is really nice. We don't have to start from scratch, which will be great. We've already worked with them. They did a good job, and we'll use them again. I'm getting more and more involved with the Healthy Rivers Board. They have been around for several years, and they are now ready to elevate their profile with the public, because they find that the public doesn't always know exactly what it is that they're doing. One of their highest profile projects is coming up. It's the kayak park in Basalt, and I've already attended a number of meetings with Basalt officials, with Healthy Rivers people. We're coming up with a plan to really raise the profile of Healthy Rivers through that project, which not only is creating a great amenity, but the real thing that it's doing is keeping water in the river. And so that's been a fun project to work on. Broadband, I'm sure I'll be busy with doing some things with broadband. Don't know what they are yet. Airport environmental assessment. That's taken a lot of time this year, and it will continue to be one of the biggest things that I do. You will see, starting probably after your December meeting, some boots on the ground events for the public. We'll be ready to take the public out to the airport and show them. Once you decide on the terminal layout concepts that you think should be studied going forward, we'll be able to go out to the airport. And I learned what a story pole. Does anybody know what a story pole is? I didn't know what a story pole was. It's a pole that tells a story. It can tell a height. Tells you how many stories. But so once you decide which layout plans you want, we can put story poles on the tarmac where the proposed footprint is for a terminal building, and start talking and bringing the public out there, showing them, let them look around and see where it is from the highway. But we're going to combine that feedback with the feedback that we've gotten at the open houses. Facilities, woo, that's going to be internal and external communication. divide where we are. We're keeping certain departments in town, and some of us will be down valley. Talk about the need to be able to communicate using technology internally. We're really going to have to do that. We'll probably see ourselves using Skype and Google Chats and Google Meetings and things like that, and really be pushed to use that technology to communicate with each other. But I think that's going to be exciting to incorporate teaching the public about what we're doing. We have some things coming up about facilities really soon in the next, well, by December, we'll be doing some more things, outreach for the public on that. So that's what I'm looking forward to in the coming year. And there are always those unexpected things, you find between the cracks of the wall that fall into our laps. But any questions?
Yes, you were talking about having an intern this summer?
I thought about it last summer and didn't get going on it soon enough. It would be something interesting to pursue. It would be helpful. For instance, you could get an intern to help create a shiz-bang, really good internal communication plan. Someone who is tech savvy, who could come in. It seems like our youth today are born and bred on technology, and so I could see a lot of uses for somebody who could help out with technology, editing video, social media, coming up with some creative ideas for using the intranet, things like that. I think it would be helpful, and it would just be a summer-long internship, but it would be very helpful.
We have not included it in the 2016 budget, but it's something that could be brought forward again in coming years.
Rachel?
Yeah, just on that point, if that's the case and you need to bring a supplemental back so you can really go beyond, I certainly would look at it. But I agree fully that utilizing the tools more completely, and I think he agreed that, advancing the training aspect for our employees is going to be one of his next big challenges as well.
And without taking any of the thunder away from BITS, my job would just be to tell the employees that those things are happening. They're really the ones who are initiating those programs, and I would just be a cheerleader saying, hey, here's why it's fun to Skype or, whatever, try to sell it to employees, because it's really hard with we have an older employee population. We have some youth coming into the organization, but it's harder for those of us who are older to embrace technology as easily as it is for the younger. But it's been fun to watch some of our new employees, especially the BITS people and some people in HR who are just, right there. They're great. Yeah, they're just not afraid of it at all.
Well, so. I can support this budget going forward, and I really can just thank you. I think you do a superlative job, and it's hard to believe it's just a one-person department.
It's kind of easier that way.
Pat.
Does that?
Thanks, Pat.
So, Pat, you hit the nail on the head when you were speaking about listening to the other departments' presentations on this. And I think that's why, for some of us, we love the budget process, because we get to look at all the successes from the past year and look at all the great things we're going to be looking, the challenges we're facing that will become great things that we are dealing with in the next year. And we have the perfect seat right here as commissioners to do this every year and see the whole big picture. So that's the process we're going through right now. So.
Thank you.
So we have touched on the different success factors in the livable and supportive community core focus area. You've heard from Health and Human Services, Public Safety, Community Relations, the library, and housing. We hope that we have given a comprehensive look at the 2016 budget for these areas. And with that, are there any other questions before we end this presentation? Okay. Thank you very much for your attention.
Thank you, Connie. Appreciate it. Okay, we have a lunch break and we're scheduled to start at 1 o'clock. We need to start at 1 o'clock. That's in 35 minutes. So.
You know, we're gonna have to have.
Have a
more
little bit
time.
more time?
This is so far from any place to get in.
So what do you,
Unless you bring it in.
what's the preference of the board?
John,
Should we
can,
do an extra
we can do an extra 15 and
15
move
minutes and
future
start at
agendas to the end of the day.
1:15? And how is that going to work on the rest of the scheduling?
So
Okay, so
back here-
1:15 we'll start.
Great, thank you. Grassroots, are you ready for us to take these off?
start here and just Okay, welcome back to the work session on November 10th. Next item on our agenda is an airport budget supplemental request by John Kinney and Connie Garoppolo.
Morning, Mr. Chairman, or afternoon, excuse me, members of the commission. I'm John Kinney, Airport Director out at Pitkin County Airport. So the presentation is very brief that we have for you today, and it is, as the title states, a proposed reorganization. And what we're trying to do is do two things. One is a little bit of a cultural transition, and that is, second is to that of building capacity within the existing staff and minimizing the additional FTEs. And what I mean by the cultural change is that as we go through this environmental process and we start to have a very heavy assessment and planning process, we're really transitioning from the staff's performance to that of maintaining an airport to that of potentially developing one of varying magnitudes based on how the EA comes out and then the approval of whatever is implemented from the BOCC. So in doing so, we took a look at the organization and really asked ourselves, how can we do this transition and how can we get the most buy-in from the staff? So the why is going from maintaining to planning and developing. The process that we took was very, very, very intensive in terms of employee participation. So we did an assessment of what the strengths and opportunities were for improvement, but at the same time, what is it that the organization likes and wants to retain and take forward into the future. We also define defining the why we were doing it, as well as crafting a new vision with the organization. We then put together an org chart, which I'll show you here in a few minutes, that was heavily edited and improved by the staff's involvement as well. We then went into crafting 15 new job descriptions, either updating or creating brand new ones that we'll get into in just a moment again with the org chart, as well as them crafting the new schedules. There was minor tweaks, but substantive tweaks, even though some folks are starting a half hour early, other folks starting a half hour later. It really created the opportunity for us to reduce a significant amount of overtime. And then also they went into defining what outstanding looks like. So they wanted to have some type of metric in which they could gauge their performance against. So the goals of the organization, as I stated a little bit earlier, one of them is build greater capacity inside the staffing without just throwing more additional FTEs at it. It was also an opportunity for us to take a look at the opportunities for people to grow in terms of enrichment of their job satisfaction, but also opportunities to move up in the organization. There's somewhat as a huge age wave out there that is very similar, with the exception of a few people. So if folks were feeling a little bit of stagnation, and with these new opportunities for development of the airport, we also saw opportunities to develop the staff. It's also to reduce the overtime, when I say that as burdensome, and that there was many shifts that people were working out there because they were overly compartmentalized, double shifts. So people working 16, 18-hour shifts 2-3 days in a row. And that's just something that makes me very, very uncomfortable from a safety standpoint, especially when you have some folks on the front line of first responders. And we did that, the reduction of that overtime, by cross-training the employees within the different service areas. So specifically the air side, the land side, which would include the terminals, or correction, the parking lots, the surface transportation, the rental cars, as well as the terminal itself. Historically, you were one or the other, but not all three. And then also with the emergency management, safety, and security. So now you're going from having 6 people doing one service area, 4 people doing another, and 5 doing another. You're now putting 10 operations, safety, and security folks together collectively doing the air side, the land side, the terminal, emergency management, safety, and security. And all those functions really go hand in glove, so you truly get the economies of scale. And then the same with the facilities folks. They would be cross-trained as opposed to just the airfield, just the terminal, just land side. And then we were also looking inside this, one of the goals of this reorganization is deliver an outstanding passenger and customer experience in an aging and a constrained facility. So you have a terminal building there that has a very rich history of activities taking place, but at the same time it's aging. You also have an increased flights. You're going to be going to 38 flights this year, which is the highest that the airport has had in its history. And it also necessitates, based on that scheduling, where the peaking of the flights, they're all coming in kind of banked periods of time so that they can meet those connections, which are also peaked and banked at the destinations they're coming from Dallas to Houston to Atlanta to Denver to LA and San Francisco. So based on that, you get a tremendous amount of people coming into the facility at once. You got to be bumping your head against the fire code, so you need to meter the people into and out of the sterile area. And in doing so, it's very labor intensive. When you cross-train, you have the bench depth, the ability to manage that a heck of a lot easier than when people were overly compartmentalized. So that's the ability to deliver an outstanding past year customer experience in somewhat of a constrained facility. And the final is it reduces our reliance on consultants. We'll be reducing a fair amount of work, and each year progressively reducing, taking some of those tasks back inside the house where I think they really belong. It's an opportunity for staff to grow. It's an opportunity for staff to put their own signature in their respective areas, and it delivers a better and cost-effective service. So this reorganization will be cost neutral. So here's the actual reorganization chart itself, and let me break it down for you just to are actually new positions. This position, the executive assistant office position, thank you. Will that show up on that? Yeah, it will. Thank you.
You can use the mouse, the cursor from the mouse.
Then it'll show up on
It shows up on TV.
Oh, it shows up on here?
On both the screens.
Not working. It's showing on my computer screen, but not on the bigger screens.
So, go ahead and use the
laser. Promise not to. Okay. And looking at the top right, you see the first box, Executive Office Manager, Stakeholder Liaison. That will be filled with an existing FTE opening. So although we have 3 blue boxes, we're only seeking 2 new FTEs. The 2 positions off to the left in the peach or orange color is Air Service Development and the attorneys, and you can see the sources that we use for those. Coming down to the next level, the first kind of tier of managerial responsibilities, you have Controller Revenue Management. That will be a new position. Going left to right, Director of Operations, Safety, Security, Emergency Management. It's gray, and grays are existing FTEs, but a little bit different positions by their function. So security and emergency management was added to this particular group of folks. Going down below that, you can see operations supervisors, again, existing FTEs, but their jobs will be modified slightly to take more of a supervisorial role and have a presence there 7 days a week. And you also have operation leads. Since we have 3 shifts, they will also be covering 7 days and being accomplished through existing FTEs. And then dropping straight down into the operations coordinator, also a gray box. Those operation coordinators has potential to be a 1, a 2, or a 3. And as you can see, that is being fed by the boxes to the left or to the right. To the left, it's the operations officers, where we have 6 individuals, and to the right, it's the security landside specialists. So they used to be very compartmentalized, siloed, if you will, of what they did, and they really didn't cross paths, that model's really just been outgrown. So we'll combine those 2 and then give up people opportunities based on very specific training criteria as well as certification criteria to move from a 1 to a 2 and to a 3. So they know what their path is, they know what they can do, it's up to them if they choose to go to a 1, 2, or 3. And one of the main differences between a 1 and a 3 is you would be certified under the airport rescue firefighting. So you become a first responder for the fire function. Going back up to the managerial level, the 3rd box from left to right, it's also blue. It's manager planning and development. And as we undertake this very large planning effort an assessment effort, as we're in right now with the environmental assessment, we really need someone at the tip of the spear to be coordinated with the FAA, the TSA, the EPA, the federal agencies, and a variety of then of functions from engineering, planning, development consultants, environmental consultants, and contractors. So this is kind of a spooling up position that we're looking for, and that's the second FTE. And then going to the right is the facilities, general aviation, and safety management environmental position. New function, existing FTE, and dropping down, no changes with those three individuals in terms of the manager or the on-call seasonals or the supervisor. And then during the winter period of time, when obviously we have the extensive snow effort out here, we're going to create 2 lead positions that is going to be seasonal. Again, existing FTEs is the gray box. And then you can see the facilities technicians also have a path between a 1, a 2, and a 3 for career progression. Right now, there's just a 1 or a 2. And in the operations world, the center of the chart at the very bottom, there's really just a 1. There is no 2, there is no 3. So those are the proposed FTEs, again, 2, cost neutral, offset by the savings of the consulting services that we're scaling back in next year's budget, and greater job satisfaction for folks, a little bit career development, as well as building greater capacity for us to deliver a service that's upon us now in the existing terminal with the existing flight activities. So I will stop there and see if there are any questions, be happy to answer.
So John, you started this presentation saying that you've redone or revamped job descriptions for all of these positions?
Correct.
Yeah, and so for these 2 new positions, controller, revenue management, that's a specific skill set, obviously, in terms of the job description. And then for the manager, planning and development, that's maybe a broader skill set for job description.
Mm-hmm.
And if you were to utilize someone in-house in terms of a career advancement, that would open up another hiree, perhaps a new hiree, to fill another position. So
Could have a ripple effect, correct?
yeah. So what sort of timing are you anticipating in this?
Well, the job descriptions were crafted, and they were crafted in such a way as we basically facilitated a conversation with staff. They shared a lot of the nuances and idiosyncrasies of those individual jobs. We put a draft together, we shot it back to them. Did we hit the mark? So there was a lot of catch with the documents. So we finally got it where we think from leadership as well as the staff's perspective, it hits the mark. So now we've turned them over to HR department, and they're going through them and doing their voodoo of HR to make sure that they're consistent and plug well into the Pitkin County process. And so there was also a salary survey done at that particular time, and so they're weighing that with internal issues as well as the job description issues. So in about 2 weeks, we're looking to get that feedback from HR. If it's a go from the BOCC's process of the 2 FTEs, we'll probably be advertising for these in about 3 weeks, 3 to 4 weeks.
Okay. There's always that challenge, as we heard this morning, in terms of the challenge for all departments to fulfill positions because of housing or cost of housing. When you're looking at trying to fill job positions and you advertise and you sort of have a broad net, sweep net in terms of going out beyond this community. And then there's always the reality that you come down to finding some potential applicants. If they're from out of town, you bring them up. Then the reality hits, geez, I can't find housing, I can't afford it, and then it sort of delays that whole process. So I'm sure that's part of your thinking in that timing, but it's always challenging. And so,
Very much so, having lived that saga just recently,
right.
More sensitive to it than I was a year ago, even though I thought I knew the story. So you're exactly right. We actually we're doing some recruitments for the executive assistant position, since it's an existing FTE that we have. And one of the individuals was trying to come from out of state and had to back out for that exact reason. So we've definitely sensitized HR. They know it as well, probably even better than I do. But that's all part of the equation, what we're trying to do.
So, but you can incorporate this new organizational structure as positions get filled. You don't have to fill them all at once to sort of make this structure work in terms of the responsibilities and job duties.
Right, right. I mean, we don't have a start date. We have to have this by the end of this year. So we're, yeah, it's going to take several months to implement.
And I just add, George, I think for particularly like the controller position, there may be local applicants for that kind of position. We'll have to see. So I don't think it'll necessarily all be out-of-state candidates, although we'll have that challenge just like we do with every one of our professional recruitments, and we'll work through it.
To add to that, this is probably the worst time of year to try and find housing. Not that any time of year these days is good, but you know, the ski companies we're geared up for winter here and the holiday season, so it might even be that it rolls over into spring before people can even have any options for rental housing, especially, or any kind of housing.
That brings the question to me, is it worth trying to look and see if the Burlingame seasonal and Mayo Merle seasonal are already fully occupied, and would there be an opportunity to rent a unit for airport personnel for future recruitment needs? I don't know.
Based again from this morning's conversation, one of the opportunities perhaps would be to utilize one of our newer units that we purchased this past year down in Basalt, lease even as a temporary 6-month measure or something like that. So we do have some housing that would be available.
Yeah, but potentially, and I think we will, you know, I think if the board approves of the concept of moving forward with the reorg, we will tackle all of these issues, and we may need to come back to the board if we're hitting real stumbling blocks. But I think right now we'd approach it just like we would for any other positions. Yeah.
And in light of George's comment, I was thinking that too, but we also have maybe a few other critical positions in the county right now that we may be looking at filling on a really, really emergency basis. So we need to keep that door open.
I'm supportive of the reorg.
Yeah, I am too. I really like the process you went through, having the employees really do a lot of the input into creating this organizational chart, and they're going to have buy-in into it because they helped create it, and that will make the whole thing work so much better.
Yeah, I'm supportive of it. Thanks, John.
Thank you.
Okay, thanks. Moving on to the next item, which is another airport-related thing.
And the next item is somewhat of a hugely connected. So this is a consultant process account. So we're asking for the transfer of funds within the airport budget, savings from one account to go towards the consulting contract that we are just near the end of in terms of cultural transformation. So we brought in a consultant to help us with this assessment, helped it with the facilitation of putting together the staff of job descriptions and schedules. And so it's the same process that we just identified. This consulting process really was in 2 phases. One was the assessment of the report, as we mentioned earlier, the organizational strengths, weaknesses, and what you want to carry forward. And then phase 2 was really the deliverables, the new organization chart, the job descriptions, the schedules, and really defining a new vision. So that is the process that we're asking for today, is the approval for transfer these monies to cover those additional costs.
John, has this, I mean, in some places you put it in future tense, and in other places it's in past tense, as if all the work's already been done. Is this something, I mean, a lot of the stuff, it seems like you've already done, the phase 1 and phase 2, but probably not all of them. There's some tasks still remaining to be done. But is this work to come in the future, or is there already a consultant working and you
Well,
just need to transfer funds to help pay for it?
Yeah, this request is for the transfer of funds, and my bad. I think I got this somewhat out of sequence, not fully understanding the processes associated with the county. We had some long-term staff absences, so the safety net of saying, John, we know what you want to do, but you need to do A, B, C, and then you can get to D. So I assure you this will be the last time you see it so out of sequence, but yes, the majority of work was concluded, and I didn't realize it had to come before the board, so my bad. That falls on me, bottom line. So.
Well, I have my apologies too, because was also part of my misses as John was going through this process. So work still to come. Obviously, if the board doesn't approve it, that work does not get finished. We had identified funds within the existing budget to keep it budget neutral to do this. This was an important step, and so I apologize for the mistiming on it.
Well, I'm supportive because, not just because some of the work's been done, but because we need to finish it in order to make sure that the decisions we've made in moving staff around, adding staff, et cetera, works for the staff priority, and it works for the airport.
Michael?
So, how come we don't use our own planning department for these kind of things?
Our own HR department, did you ask
No, our
Mike?
planning department, our community development department. Because if it's about cultural aspects of the airport, who better knows cultural aspects than people who are already in the valley?
So Mike, I think what we're talking about might be a little bit of kind of internal jargon. It's more about the internal culture of the airport organization, not about how the airport fits in to the broader community, which I think our community develop. Yeah, and so what we're talking about now is the internal culture of our employees. For a long time, the airport has been operating in kind of a maintenance mode. There hasn't, there's been one major project recently, which was the runway extension. As we go into the environmental assessment process and then pending board approval and potential development projects, it's really changing the demands on staff and how staff has to be oriented towards the work of the airport. How do we keep it open? How do we continue to maintain a high customer service level while we're also going through these discussions about planning for a new airport and possibly developing. And so the external side, how the planning fits into the community, is really being dealt with in the environmental assessment process. This was about how do we realign and rethink our jobs and our roles in the airport as employees of the airport. So it'd really be outside of that community development piece. So sorry if I confused you. Culture is really about the internal culture.
Yeah, so the language isn't very clear. So why wouldn't you say, internal organization?
We could have said that, and that probably would have been clearer to you. I think maybe we were too far into the trees, missed a little bit of the forest view on that.
So what we saw just previously is the result of this
Correct.
consulting.
Well, and it's ongoing work, and we had identified funds within the airport. We had missed this critical step of transferring them for use.
Getting
So
approval.
coming back to the board to say, can we, transfer use of these funds for this purpose? So part of that was the transition, and
So this is retroactive.
some of it is retroactive, yes.
John, who is the consultant who's been doing this work? Is it from just somebody from J'viation or somebody else?
It's a mixture of both. Background, heavy HR background, and consulting for corporations, how to create high-performance teams. And the person's name is Alan Schnur, the Schnur Consulting Group. And he has worked at several different airports, but mostly corporations and companies, and trying to put together teams. And
And then is Javiation also involved in it? Because they would be the ones, I think, losing some of the contract with the 2 new FTEs taking over some of their work, or?
No, none of the consultants are involved in this process.
Okay, okay.
Yeah.
I just wanted to make sure there wasn't potentially a conflict there. They're helping plan stuff that would take away some of their work from them.
Right.
Okay. Well, I think it's good. I mean, the work product so far looks terrific, and obviously we need to finish up the project and see part of it is in recruitment effort for the unfilled positions, and that's an important part of it too. Rachel?
Yeah, I would just like to kind of comment broadly. Since joining Pitkin County, you've really applied a critical eye and a strategic eye to the airport issues and to your staffing, and you're really starting to make it your own, and I appreciate the improvements you're bringing forward.
Thank you.
Any other questions, comments from the board? All right, thanks.
Give my apologies. Well, thank you.
Okay, next we have, well, are you ready? Do we have anybody here from facilities for this?
No.
I will do my best, although I do not
Okay.
know this as well as
So
Jody.
this is
I can
the
speak to it
courthouse
also if
snow
you'd like,
melt
John.
supplemental budget request.
And this is, Connie and I will tag team this one. This is an item that actually Jody came in front of the board during a work session on to ask about installing the infrastructure, the piping for snow melt under the sidewalk on the, is it
On the
north
west
side,
side.
west side of the courthouse during the Galena Plaza project. At that time, the board had given the okay, but we hadn't actually brought it through the supplemental budget process, so we felt it was just cleaner and more transparent, even though we had had that discussion, to go ahead and bring it back to the board. The board's direction at that time was to go ahead and spend the money to get the infrastructure in place for the snow melt. There was an outstanding question regarding the hookup and rent fees or no rent fees that we committed to bring back before there was any hookup of the system. And I do not believe those questions have yet been resolved with
Not
the
yet, no.
city. And so this is really just for the infrastructure so that we're prepared to do snow melt at some point in the future without tearing that sidewalk back up.
So, yeah, that was going to be my question, because I don't remember being part of that discussion. But, so there would be an additional $55,427 to pay to REMP if we hook it up for snow melt? Those are the numbers on the form. That
Right now, if we were to be responsible for the full REMP payment, now there is a public infrastructure exception for REMP, and that is the piece that we weren't prepared to answer for the board. And what's happening is a construction project obviously is moving ahead of answering
yeah, I
this
totally
question.
understand
so.
that, but I would just be concerned then at the end of the day, if we were to pay that fee as it is estimated on this information, we'd be paying $85,437 for snow melt.
Correct.
So I think we need to keep that in mind. That's a lot of money. I know it's a public safety issue, and it's a city requirement to shovel within so many hours of the snowstorm. And that's that long section on Mill Street, which also has a slope issue, and it can be an ice skating rink for the most agile. Isn't it the west side?
It's of the courthouse.
Oh.
I'm sorry, of the courthouse building Galena.
Then
So it's
that's
along
the-
Galena.
Oh, just that narrow section on the alleyway.
Look on the back side of the
But that's on the
sheet,
alleyway,
has the
right?
map. It goes clear over to the library building,
Yeah.
actually, and to the, looks like clear to the Rio Grande building.
So, yeah, what it does is so
That's
if
a
you,
very hard map to read.
it is on the Galena Street side of the old
Oh, so
courthouse.
it's way over here. Oh,
Yeah, so Patty, if you think about Galena Street where they're doing all the work right now
Right,
and
right.
landscaping, it's the sidewalk just adjacent to the courthouse along there going into Galena Plaza. So where you connect with the parking garage and the library, this is
Right.
our section that we have to maintain, and it is a section that we currently maintain manually by shoveling and brushing, chipping to the best of
Right.
our ability, but it's oftentimes in the shade. It hits a melting period and then it shades. And it's an area that has been difficult to keep ice-free.
so
over
wait,
the years.
so did we, on this map, it says snow melt final. So all these other colors, did we already install snow melt for all those other sections?
Well, yeah,
I think you were having your eye surgery when
Yeah.
we did discuss
When we
this.
did this.
But the city has put in all these other pieces as part of their project, and the walkway was going to go halfway into the center of the plaza with the brown and then stop. And so it would have basically been a snow melted right up to a ice that has to be removed periodically.
That's this section right
And
here.
we looked at it similar to laying conduit before you really were gonna fire the conduit up.
Right, I don't
And-
have a problem with that.
And so that's what the expense was. We were told there would be potential ramp cost to it, but that there'd be an issue to work it out. It may be that we can be like other private businesses that put more energy efficiency items within the library, and then we get the
Buy it
credit
down.
from that, buying it down. But, you know, we felt it was necessary to hold ourselves to the same standard that we would hold anyone else. We can look at the public exemption perhaps for part of it, which we did for RAFTA prior when they had some larger issues because it is a public facility. But the real question at the time was, while they're pouring the concrete, do we put the conduit in, or do we want to let it go and decide later on that we have to retrofit, or that we just live with that system as it is forever?
Okay, it's just that when John said west of the library would be,
I meant courthouse,
Mill Street.
actually.
Okay,
If I
you
if
totally
I
put
said
me on the wrong
library, I've got
street.
too many facility projects going on
okay.
in my
I
head.
just
apparently.
am
I meant the
concerned about
courthouse.
if it goes to the end of the day, $85,000 cost seems extreme, especially now that I'm looking at just these two little pieces rather than that whole sidewalk.
Yeah. And for us, it did complete because the city's got some, the library's
Right.
got some, we've got some, but
Well,
from
even
a
looking at that
pedestrian's
map, it's
perspective,
very confusing.
yeah, from a pedestrian's perspective, it's all one corridor.
So, John, just for clarity, what we're talking about is just the red outline part just to the west of the courthouse? And not the green, which would be the library's responsibility?
The green's a library, and what I'm looking at,
The brown's the city's responsibility.
it kind of looks like almost an orange on my screen. It's hard, sorry we don't have the projection up.
So we're only talking about the red part just by Galena.
Yeah, I see what you're looking at. It is just the portion adjacent to the courthouse, yes.
Okay.
The library, I think, is already budgeted on the green
Correct.
for their portion, so this would be.
Okay.
And we're not doing the sidewalk along Mill Street where it's so slippery.
Correct.
So we'll still have to continue to ice skate down the street there.
And the ice skating rink where the sheriff's vehicles park, when we do the new building, that will solve itself because it.
The drainage
be an-
issues that we've experienced there should be fixed by the
They
project.
should be underneath the building.
Yeah.
Okay, Michael?
Yeah, you know, I can understand putting in infrastructure. But we don't really have a way of addressing how we're going to do snow melt as a body. And so we do things like put in electric mats in certain places, and now we're putting in what you call the infrastructure for heating, and then we're all aghast at the rent fees. Although we're not aghast at spending those rent fees, we're aghast at paying them. So somehow we have to come to some sort of policy decision about how we're going to do snow melt when it's necessary, when it's useful, and because this still doesn't talk about the ongoing costs of snow melt, which are really significant. So you're talking about a budget of a couple of houses here all the time, all winter long. So we need a comprehensive look at this, and I don't know where we get it, but I don't want to deal with these issues on a sort of, well, we'll pay some of the rent, we won't pay all the rent, we'll pay all the rent, no, we're not going to pay any of the rent. You know, so I understand this project, and I understand why it needs to happen, but I don't understand how we're going to address it in the future in a comprehensive way.
That's fair.
I would favor, when we get to that point, if there is an opportunity to do some sort of a geothermal or a ground heat assisted thing to aid in doing this snow melt project sometime in the future, when we, if and when we do actually, turn the valve and start doing the snow melting, that would be good, because that could be a very low cost and sustainable way to do snow melting.
Well, and so we are going to be looking at, as part of our facility project, is geothermal, not necessarily tapping into heated water geothermal, but just using the cooling, heating properties by going deep enough into the ground to supplement what we do with our boilers and cooling system. I think it's anticipated this infrastructure would probably be hooked up to our boilers, and so geothermal may very well end up being evaluated as a way of supplementing this system. Whether it's feasible or not on the site that we have is a whole nother question, and we'll be looking at that.
I just bear in mind that the city spent 2 seasons drilling over by Heron Park and didn't find a source, so.
Well, what we would be looking at is just where can we leverage the ambient temperature of deep ground?
Yeah, no, I understand.
Okay.
So that's why I
You're
said
right,
ground heat assisted, which is, you're going just fairly close to the ground surface with pipes back and forth to get the heat from there.
Yeah.
You're not going 1,000 feet deep trying to tap into
Well,
something
you
like
did
this.
first say geothermal, but.
Like the city did. Well, I said geothermal or ground heat assisted. There are 2 different processes there. So definitely, I mean, it's the prudent thing to put the pipes in before we put the sidewalk in. So I would favor doing this.
Is that a head nod?
Yeah.
Okay. All right. Thanks, Connie.
And we'll look forward to the further discussion in several years' time or whenever.
Yeah, no, and we'll bring that back, and I like the idea of developing some, at least, if not a policy, at least guidelines. When do we want to apply this type of infrastructure, when is appropriate, and what are we willing to pay for to make it happen? I think it's your turn, Dan.
Okay, and moving on to the next one is Human Services Financial Management Supplemental Budget Request.
Well, we're very excited to bring to you the final stage of the CDHS, the Colorado Department of Human Services audits from the federal government dating back through 2007. And what they discovered through these federal audits was that they had undercharged for the county portion of admin over a period of time. So what happened was, we got an allocation, say we got an allocation of $50,000, we pay 10% of that. If we overexpended, they never charged us more of a county share. That's basically what happened. And they did this across the state. So every county owed the state money, except for those who don't overexpend. We do on an annual basis. So the result is that we owe them $41,930.58. We believe that the best way, we waited until the very last minute to pay this off because we had, probably unrealistic hopes that the JBC would relieve us of this obligation, but that is not happening. And so we feel that it's the best move for us to pay this in a lump sum. Otherwise, it becomes a bureaucratic obligation to track it. And we have money in our social services fund balance. So our recommendation is that we take it from there. It still leaves 90,000 in our social services fund balance, which is dedicated to social services. And by doing this, we get to relieve ourselves of this obligation.
Seeing that I don't see we really have any choice but to repay it, and this seems to be a good way to do so. I am supportive of moving this forward. And it would have been nice if the JBC had, yeah, especially the 58 cents.
Yeah, right.
Rachel?
And did they also set up some protocols so that there won't be this sort of unknown hit in the future? I mean, is it remedied?
They have actually cleaned up their accounting significantly so that in 2015 there were actually no audit corrections, and that is their new standard. Things got lost in transition. This was noted, as far back as 2007, and through turnover it just didn't get addressed. So I think we're in pretty good shape that this will not happen again, and we certainly know to watch for it.
Yeah.
Right.
Okay, thank you.
Man, this is no fault of you or your department. It was the fault of either someone at the state or somebody at the federal government?
State level.
Yeah, it wasn't something that we were able to see on our side, oh, they didn't charge us for that, great, we'll keep the money. No, that's not what it was. We thought that we were contributing the full amount that needed to be contributed.
Yeah, you were doing what you thought we had to, paying the amount that they said. They just told us the wrong amount to pay.
Right.
All of it happens through a database called CFMS, and then before that, COFRS, coffers, right? So a lot of, I think it was a technological oversight, and I believe that they've taken a hit for that oversight, and our job now is to pay the debt.
Okay. And I think paying it in a lump sum rather than coming back to us each year for the next 4 years and asking for 10,000.
Thank you, Steve.
200 and whatever.
Okay, anybody against that?
Nope.
Okay, we'll do it.
Thank you.
Thank you.
Okay, let's see. We're supposed to have our special meeting, and we should be having Ann and Marky coming for this, and I see neither one of them yet. 10 minutes ahead, so, okay.
Do future agendas, because we didn't do those.
All right, thanks, Michael. I didn't, my clock is sitting at home, so I'm unaware of the time. So let's do the future agendas right now.
Okay. Thank you, Steve. There's been a little bit of moving around that you may have noticed in the future agendas. Specifically, we do have a few items we've been talking about whether we are going to use November 24th or not. We decided instead of trying to find one date where all of you could do that final budget wrap up, that just wasn't working for us this year. So we actually are going to have two opportunities for that to happen. We will have time on the 24th to do a little bit of budget decision points and review. We've scheduled 90 minutes. I don't know that we'll actually need that much time to do that. I think we'll see how our last budget workshop goes with you, and we may amend that if we get a lot of questions or concerns or requests for information to bring back. We'll extend that. We also have a brief wrap-up period scheduled for early December then, which I believe is December I'm sorry, scrolling through here. December 1st is another opportunity that makes sure that we've overlapped with all board members. Again, we have an hour scheduled. Based on how our workshops have been going to this point, I don't know that we'll need all of that time, but we wanted to schedule that because there was concern about everyone having an opportunity to weigh in on those final decision points. We'll continue to refine the agendas. The 24th, we'll try and wrap up in the meeting so that the board has the afternoons. That's all I have for you. I just wanted to bring that to your attention. We have done some moving around there based on our last discussion, and the desire for everyone to be around for the final budget discussion.
John, we had talked about having Kurt Dahl coming in and talking about the restaurant inspection fee, and maybe we were just going to do that as an open discussion.
Yeah, Kurt will be here, and I think maybe we can talk about that. How's the foot, Kurt?
And I guess we could talk about it today, even whenever he's prepared. So, but
Is it in his presentation for today?
So we'll have a little opportunity to talk about it.
yeah, and we didn't have it. It wasn't anywhere else on the agenda. I just wanted to make sure we didn't drop that ball. Michael?
Yeah, I won't be here on the 24th.
Okay.
And on the 17th, ACRA's decided to have a retreat. So I'll miss the morning session on the 17th.
Okay, and Michael, if you want to go over any of the budget stuff in any more detail, we can do that one-on-one. Just let me know.
I will.
Also, just so it's correct on here, Wednesday, December 2nd, I think, again, both Steve and I will be at the CCI conference, which is our regular meeting on December 2nd. It's noted for the work session the day before, but not on the regular meeting
Oh, not in the regular meeting. Okay, we'll get that. And just, I will also be attending CCI on that Monday also. There's a county administrator session, so Phyllis will be filling in. And Michael, I'm sorry, I got the 17th and I missed the other date that you said.
The
24th, thank you.
17th, I'll be there in the afternoon, but not in the morning.
Okay.
Okay, any other agenda items, future agenda?
Could take a
Okay.
5-minute break while folks are collecting. Do we have everyone?
Okay, let's do a 5-minute break. Well, hopefully the rest of our team will get here in those 5 minutes. Okay, welcome back. I'll call a special meeting to order and entertain a motion to go into Board of Health session.
So moved.
Second.
All in favor, say aye.
Aye.
Okay,
Hi.
and Liz, are you gonna, why don't you take the ball and run with it?
Okay,
Thank you.
I'll get going. I'm Liz Stark. I'm the Director of Community Health Services and the Pitkin County Public Health Director. I'm joined today with our other public health partners, Dr. Kimberly Levin, our Medical Officer, Kurt Dahl, Pitkin County Environmental Health Manager, Tom Dunlop, Pitkin County Public Environmental Health Advocate, CJ Oliver, the Director of the City of Aspen Environmental Health Department, and Rachel Burmeister, also with the City of Aspen Environmental Health Department. We presented a lot of information to you in your packet today. All the way ranges from restaurant fees to water and air quality and bat colonies and virtual dentistry and community water fluoridation, noise regulations, and the tracing of environmental exposures to illness and disease. So I think that gives you an idea of the depth and breadth of all the services that all of us in public health provide and the work that we're doing on behalf of the City of Aspen and Pitkin County. There's a lot of information in your packet, and what I'd like to do is just briefly go over some of the items that I mentioned in my memo and allow others to do the same. But we'd like to spend most of our time today talking about community water fluoridation. As you're probably aware, Snowmass Village recently went through this debate, and it's come before the City of Aspen City Council several times over several years. And other Colorado communities too, it's been a subject of debate lately. So we thought it was important for you as the Board of Health to hear the public health side of this debate. So we'd like to spend some time in that discussion, conversation with you about it, answer questions, be able to sort of give all of our perspectives about that. So that's how I thought we'd present our information today. So I'll just start. Yes.
So as a Board of Health, would we have any jurisdiction in terms of determining who or when a municipality or a county would fluoridate or not fluoridate its water? Or what is our role in this?
That is a good question. I think, well, I'll just say one thing, and then I know that in Snowmass, for example, the Snowmass Water and Sanitation Board had that ultimate decision in the City of Aspen, because the water treatment plant is in their jurisdiction. They had the ultimate decision. What's your?
Yeah, I think it's an interesting issue. It was decided that it would act on a local level, so every community makes the decision, and it's from the water board that actually makes a decision. So the Board of Health doesn't actually have decision-making power over it, but just in terms of being informed and knowing what's going on, I think that's important. And so 75% of communities nationwide have decided to put fluoride in the water, and 25% haven't. So it's very locally, it's an interesting way that they decide to regulate or make decisions, that it's just very locally decided by water boards in each community. So it's more of an informational
Okay, great, thank you.
understanding.
Just a comment that while we're in this temporary room, you guys may want to pull that microphone all the way to the edge,
Okay.
so that grassroots can pick it up. Okay, thanks.
Okay, I'll just start with.
We need to hook Marky up too. Sorry, Liz.
Yeah, thanks for being here, Mark.
Hi, Marky.
Oh, it's great to see you guys. Sorry for the
That's okay.
Yes, right on time.
I wanted to give you an update on the public health consultant. If you recall, back in at our third quarterly Board of Health meeting, you gave Pitkin County permission to fund a public health consultant to look at the structure and the function of the public health services provided by Community Health Services. And that process involved putting out a request for proposal, which Nan and I partnered with Katie McIntyre on that. We recently received 7 proposals, which we reviewed last week. They were all quite impressive. 5 of which were from in-state and 2 were from out-of-state. We narrowed that down to 2, and Katie then checked references, and we're now in the process of making a decision about who to offer that proposal to. So we hope that that will happen, gosh, today's Tuesday. It might happen that make that offer this week. So we'll have a final decision hopefully soon and get started on that work. The work would start as soon as possible and hopefully end in the spring of 2016, the culmination of a report to you as the Board of Health on what their findings are. Access to care, and also over the summer, a group of us presented issues related to access to care as one of our public health priorities. And we had formed a work group that included Mountain Family Health Centers, Aspen Valley Hospital, Health and Human Services, Public Health, and had done 2 presentations to you regarding that topic. Since that time, that work group has met once. We actually have another meeting scheduled this Thursday. And so far, the conversations have really been about the financial sustainability of Mountain Family Health Center in Basalt, creating them as the hub for access to care for low-income Medicaid and Medicare recipients from Pitkin County, and how Pitkin County and Aspen Valley Hospital can work together to sustain their financial support of that organization. So we'll next be really looking at what Mountain Family Health's vision is for space and staffing and services to be offered in that location. So that's basically where we are with that conversation. More to come on that. We hope to be meeting at least every other month, if not monthly, to continue these conversations. I wanted to let you know about the bat colonies in Snowmass Village. In August, we were notified about a couple that had had a bat exposure. They woke up one morning to bats in their home, which is considered a risky bat exposure because, as you may have read in my memo, if bats' teeth are very small, and unless you are conscious and aware, you might sustain a bat bite and not know it. So it's recommended in those cases that people receive post-exposure prophylaxis for rabies, because bats are a common carrier of rabies, and rabies can be a fatal disease. So it's really important to receive that post-exposure prophylaxis. In this particular development in Snowmass Village, they've been having bat colonies migrate to this location for years and years, and have been a problem. So it was a recommendation of the Colorado Department of Public Health that the Homeowners Association do some mitigation to those structures to prevent bats from entering their homes. So the Colorado Department of Public Health's veterinarian came up to attend the Homeowners Association. They had a whole panel of experts about bats to talk about all the lifespan, the migratory paths of bats, and from that, I think the Homeowners Association finally heard that something needs to be done to mitigate the structures there at the Blue Roofs to prevent them from entering people's homes. Community Health Services provided education to all the homeowners at the Blue Roofs. We worked with Environmental Health on really trying to understand what is our jurisdiction or our legal capacity to enforce any kind of the Homeowners Association to take action. And of course, we didn't have to even go there at all, which was fortunate. But it was quite a learning experience for us to be involved in something like that, and coordinating these folks getting their rabies prophylaxis was challenging because it's a very expensive vaccine. It requires a 3-series shot. So coordinating with the hospitals in the valley and all that was part of our work, along with Colorado Department of Public Health. So it was really interesting.
I just have to ask a couple questions on this one. It was so unusual and so interesting. First, as I understand it, there's no kind of immunization against rabies that you can get. It always has to be after a bite or after an experience.
You can receive this vaccine prior to any exposure.
But
it's not
a true immunization.
Standard routine vaccine.
Okay. And how large was the colony in that area? Is it roosting under their eaves? And what sort of mitigation are they going to take to get them to move along?
I think there were thousands and thousands of bats that come every year, and it's that whole.
Up by the chapel.
That's why there's no mosquitoes.
Yeah.
Well, that was brought out that that bats like it there.
Yeah.
Because there's a creek that runs through there,
Yeah.
I guess, and it's good feeding
Right.
grounds. But bats are protected as migratory birds, so you can't kill bats. And so they are on their migratory. They come around every August, I think, and stay through the end of, or maybe July, August, stay through the end of September into October. And I'm not privy to the exact structural changes that the homeowner association is going to make. But there was activities with discussions with lawyers and bank loans and all that kind of stuff to try to make it happen.
Okay, thank you.
Remediate or mitigate for them, much like you do the swallows in Capistrano. You screen underneath or you close off underneath where they can actually make their bat homes. And it's the same thing they do in the buildings in San Juan. We know that, Kurt.
But I think it's important to know that you can't get rabies from just bats that are swooping, thank you, around. And you know, when you're outdoors and they're swooping around you, you know, you have to have a bite, and so you definitely don't want to be handling bats, but they are not dangerous if you don't go near them.
The issue also is that you don't know sometimes whether you've had a bite or not. Like,
Right.
it might just hit you, or it might bite. And so if you wake up and there's a bat in your room, you can't assume it hasn't bitten you. So you always have to assume, since it's such a
So if we mitigate for them in snowmass so they can't roost there, does that mean we'll have to be looking at the next, we hate to have them leave snowmass, Mark.
Oh, I know, they've been part of our business for many years.
Yeah, so, I mean, so we need to be alert to the fact that they are gonna have to go somewhere, you know, just like the swallows in Capistrano went to the May Company after they left the mission.
They will find a home. Well, the point is, we don't want to get rid of them completely. We just don't want them in
They're-
your home.
Right,
We don't
right.
want them to be able to get
So
into
it's
your
okay
home,
if they
your
hang around
bedrooms.
outside the house, you just need to keep them from getting inside the house.
Right. Yeah.
Literally hang around outside the house.
Liz, is there any way to tell if a bat is rabid? Like, or would they be acting strangely or lying on your floor dead or something after they bite you if they were rabid? Or do they just go up and roost in their normal place and continue to be rabid, and therefore you don't know whether one that bit you is rabid or not?
I think you have to assume that it is, just because it has such a high mortality. But I think a lot of animals that are rabid exhibit strange behaviors. In terms of a bat, I don't know exactly what that might be.
I think activity in the daytime is one thing that I know.
Right.
That's one of the things that we highlight if we hear that activity. But it's presenting different than they normally would otherwise. There was a rabid fox that they had in Colorado Springs that actually presented as tame. And that's where I learned it's a completely different way of behaving than they normally would. And in that case, kids actually were able to come up, put a leash on the fox, walk it around. So it's the key there is it's not behaving how it would normally behave.
That's where they get the saying going batty. When they start acting that way.
I know some communities, and this, I mean, you could take this under advisement, Marky, but there are communities where, because of where bats are roosting, they don't like it, like in the football stadium or something at some university. So they built a big other structure where the bats could live. It was like a big bat house at the university. I don't even remember which university now, but bats are really good because they do keep the mosquitoes down. And maybe Snowmass Village would want to consider doing a bat house, or have
put it right
the
up where Related
Rotary
was
Club
supposed
or
to be.
somebody maybe could take this on as a project.
Housing as it is.
Sorry. We can have some fun with this one, guys. But no, we'll be talking about it because I'm aware of what was occurring in the Blue Roofs. And I don't know what the Snowmass Village Homeowners Association, how they were made aware, or if they were. Do you happen to know?
How they were made aware?
Well, I know the Homeowners Association down at the Blue Roofs knows about it. How about the Snowmass Village Homeowners Association, which is a whole separate entity?
I'm not familiar with
Let
that.
me do a
group.
little work, okay?
Okay.
That way they can get
Yep.
ready for the migration of the bats from the blue roofs up to the.
Up to Base Village.
Yeah, pretty much.
And I will say that animal control in both Aspen and Snowmass Village regularly have bats tested for rabies. If they find a dead bat, they'll scoop it up to be tested. And Pitkin County has not had a positive rabies bat in many years, but coincidentally there was a bat from Pitkin County that tested positive for rabies the week prior to this incident.
That's interesting.
So it just shows, even though the chances are very low, it's not a risk that people should take. So, next, I want to just mention the virtual dental home project that the Aspen to Parachute Dental Health Alliance is partnering with Mountain Family Health Centers on. This is an exciting new project, a pilot project funded by Caring for Colorado that will allow a virtual dental home to be established in our community, where a dental hygienist and like a patient navigator will partner and go out into schools and provide basic cleaning and restorative care to children in schools. And in our case, we'll be in 2 targeted schools in the Mid-Valley area working with the school-based health clinic. And the dental hygienist will send reports back to a dentist, and in this case, the hub dentist will be the dentist at Mountain Family Health Centers in Rifle. So through an electronic health record, that information about that child will be sent to the dentist, and any treatment recommendations will be sent on down via the dental hygienist, or that child will be referred to see a dentist. This is a relatively new concept, just started in California several years ago, and they've shown great success in increasing access to dental care for different populations, particularly children in schools, residents of nursing homes. So the first year of this grant will be planning in terms of getting all the partners on the right page, and then we'll be implementing the grant in years 2 and 3. So that'll be probably 2017 and 18 where we'll be actually implementing this. So it's a real exciting opportunity for collaboration between the Dental Health Alliance and Mountain Family Health Center's dental clinic and the school-based health clinic. So we're really excited about that.
Just before we move on, because it was something you touched on with the access to care issue that's going forward, and what facilities we have at the Basalt Mountain Family Clinic. I think it'd just be really important to also continue to scope the potential of a dental outlet in Basalt as well. You know, I applaud this program. I'm really glad to see us starting to plan it and implement it. But I know the referrals is always the hard part in finding both openings, and you know, it's a pretty far haul to get to Rifle and back. And so you know, we've talked about briefly, and there, you know, is not the enough groundwork right now for a grant for a dental facility in Basalt, but don't write that off, and be able to come back and let us know what would be needed to see that happen.
Thank you, Rachel. That is an important part of the expansion at the Basalt Mountain Family Health Centers that Ross is proposing to integrate dental health and behavioral health. So that's the package that he's proposing there. Yeah. Before we get into community water fluoridation, I just wanted to open up to see if you guys wanted to, particularly Tom and Kurt, you wanted to touch on anything that you presented in your memo?
Do you guys want me to touch on retail food fees really quick now, or?
Well, I believe this would be a good time to do that.
Okay, I'm trying to put bullet points together. So there's an effort ongoing to change the fees for the retail food restaurants that we charge for licensing. That fee is actually set in state statute, and there was a legislative effort last session earlier this year that what came out of that was a stakeholder process where environmental health directors, Colorado Restaurant Association, State Health Department, and others are participating in a stakeholder process. It's become a negotiation piece of increasing the fees. There are things that they would like to be seen done. The Colorado Restaurant Association has been the most vocal of the stakeholders in terms of what would change in fees. When I went to the directors meeting earlier in October, what the directors were going to propose to a meeting that happened, I believe, 2.5 weeks ago, that I think Steve listened to, was that we were going to agree to an incremental increase over 3 years in the fees, so it would not be a one-time fee increase, but it would be a 25%, 30% fee increase. I don't have the exact numbers in front of me. And in the process, what we would then agree to would be that there would be some commitment to staff time from all the various organizations that administer the retail food program, the City of Aspen and Pitkin County included, to things like complying with the FDA standard for their program standards. The FDA has a program standards that basically is a model program for an ideal retail food inspection program. And they have various standards that as part of this program, you're expected to meet. Some of those standards include things like a baseline for training for each individual staff member. I believe there are 9 standards. Is that right? Do you guys know off the top of your head? I think it's 9. And so there were some commitments that I believe the initial year, 75% of the jurisdictions that do retail food inspections would meet this, like say the FDA standard 2. So there's a compliance piece and some commitment to staff time, and there were a series of those commitments. That was presented, and we are now in the process of awaiting feedback from the Colorado Restaurant Association in terms of what the agreement is. One thing that the Colorado Restaurant Association is really adamant about is, as part of this fee increase, they do not want to see ratings of inspections, which is something that we have been talking about as an environmental health group. We used to do it years ago. We've gone away from that. We had been talking about starting to do restaurant inspection ratings like you have seen from other jurisdictions around the country. They were pretty adamant about how we would go about doing that. They did not want to see an A, B, C, D, F, which is a common way of doing that. The other thing that they're pretty adamant about is they did not want to see that information posted at the door at entry. So there's some things that are still being negotiated there that I know you guys are working with CCI on, and that's really all I have at this point. We're waiting on feedback. I think the biggest concern I have is that when you go back to these FDA standards, I support the program. I think it's a great idea in terms of laying out a landscape for a model retail food inspection program, but we're committing staff and not really getting a lot in return initially, and I've got some concerns about how that's going to shake out because, you know, Brian and I are a two-man group, and, you know, to meet that compliance is going to be some give and take, and that's just a piece to discuss. So.
Yeah, that was the first thing that I thought when you mentioned where these negotiations have been going. You know, if the 25 to 30% increase in fees results in a 40% increase in cost, then we haven't accomplished what we were hoping to accomplish. And it seems odd, but it almost seems a little bit like a transfer of the responsibility and obligation of a restaurant owner to properly train their staff to having now county government or health departments training their staff. And so I would be a little concerned about how far down that goes down the line, so that it doesn't, you know, end up being an increased burden that the new fees don't cover. So I think that is going to be really important to perhaps have some stats for us when we get to CCI so we can talk about it. Because I'm just sitting here thinking, how many restaurants do we have? How many employees do they have? How much time are we going to spend with each employee? And if it's on a one-on-one basis, that they're each trained, or hey, I just got 3 new staff, when can you come by and train them? You know, we'd have to make sure the expectations are really very clearly laid out, and it doesn't actually by default become some sort of city or county liability of did we train them well enough or often enough or things like that.
And the training is actually specific to the, like in our case, my department, not necessarily the restaurants.
Okay.
Although we do offer training, you know, a lot of times we work with ski company at the beginning of the year to train all their new employees. That's one example. But this is training specific to each department. Okay. So in this case, Brian and I would both, in my department, have to. City of Aspen, it would be Rachel, and I don't know if Jeanette and CJ, but everyone would have to have a laid out training and be specific to it and be compliant with it. Okay. In principle, it's a great idea. It's just the give and take of, you know, we were already looking at needing help, and to have the FDA program standards is a great program, but it's a heavily administrative type program where there's a lot of documentation, a lot of record keeping, and we don't have an administrative person. So there's going to be some help and give and take from my department, I know. And I think that's kind of the program itself from the FDA was written more when you think of larger jurisdictions that have multiple people. And when you're looking at a smaller jurisdiction or a rural area, I think that really becomes a difficult thing, because I'd like to do the program, and we've been in the program, but we haven't been able to meet any of those standards or have the time to meet those standards because of all the other pieces of the puzzle that we're doing. So.
Yeah, and the other last comment is that when I was just in Boise, Idaho for the Western Interstate Region meeting, I noticed in their newspaper they had a restaurant rating chart. And now I'm not sure if they ran it every week or they ran it every month or quarterly or whatever, but it was actually a matrix that would tell you what the violations were. So it was restaurant, A, and it had violation 1, 4, 7, and 9. And I think that goes a long way towards restaurants making sure that when they're in the paper, they don't have any bad marks, or as few as possible. And so that wouldn't be at the front door, and it wouldn't, but, I have a hard time wanting to keep information like that from the public.
Right, and our inspections are open record, so people can request them, but again, it's an inspection report at this point, and I think that's one of the keys that the retail food program managers, which is a subgroup of the environmental health directors, they've been the ones putting this together, is communication to the public and all of these violations, if you will, this inspection, and how that actually equates to what does that mean? Floors, walls, ceilings, dirty isn't as important. It's important, but it's not as important as washing hands and food temperature and sanitation. And communicating that to the public has been tricky, and that's something that we've been trying to discuss. And I know that the recommendations will come out of that group, that they're going to work with a marketing staff person, consultant, to actually try to work some of those pieces out so that whatever program we come up with, and then it will be up to local jurisdictions to adopt it. So we may in the future want to talk with you guys about that. But again, the retail food piece has to go through first, and we'll have to see how that affects what gets proposed. So.
Thank you.
The piece about the training for the inspectors was asked for by the Restaurant Association. So there would be uniformity across the state on the inspections done in Burlington and in Denver and in Grand Junction, and different places would be getting the same inspection done, even though some might be county health people, some might be Colorado state people doing the inspections, and they just wanted to have it be a level playing field by having all the inspectors actually using the same system and having the same training to do the inspection.
Right. I completely support the idea. I think one of the things that's been lost in this conversation, though, is when we did our last fee change with retail food, which was 2008, is that right? That was one of the complaints. We've been working towards that since that time period, and even really before then. So it feels like that gets lost in the discussion. This is something that's important to all of us, and we've been doing it. We've changed our inspection forms. We now actually have the state health department come out to each individual jurisdiction, and they literally standardize an individual within each department. I know that that's obviously a work in progress, because every year you have turnover, but there are a lot of steps that we've done to try to already address this that I feel like has been dropped a little bit in this conversation, and we're continuing to do it, and we should, absolutely, no two ways about it, but it seems like we've forgotten that we're already been trying to move down that path to begin with.
Yeah, part of the piece too was that the Restaurant Association didn't want to be paying for the inspection of the exempt organizations.
And I think that's fair.
To me, that's a fair thing to have, have us foot the bill for inspecting the school cafeterias and different things like that.
Right, so there's an exemption for nonprofits that they actually, if they're operating within their jurisdiction, county or city, they get a free license if they're operating 52 times or less per year, right? And so, I think that's a fair concern, and that's something that's been brought up is, how does everybody else is footing the bill for that, and whether or not that goes away or how we're going to handle that. I think that's one of the pieces of it.
Yeah. So, let's see, Kurt, I wanted to look at our economics of our local inspections. Now, the state has already given us a higher standard to meet at this point, haven't they? In terms of having to do a certain percentage of the inspections, the timeliness of the inspections and that sort of a thing?
You know, that's an ongoing piece that has been changing. So the city of Aspen, and guys pipe in, please. And Pitkin County as an example, we have a contract with state to do the inspections. The larger health departments actually don't. But our contract used to dictate how many inspections we would do per year. And one of the concerns became that we were actually doing quantity over quality. And so in the last couple of years, what we've seen is a change in that contract and dictating the number of inspections to try to go towards a more qualitative type inspection and uniform inspection instead of just, I've got to get my numbers done, I've got to get 90% of this contract done by the year. So it doesn't necessarily dictate that anymore. What it does is basically says there's an expectation that you should get a percentage done, but you know, if you don't, there's a place to actually discuss why didn't you get 85 or 90% done. You know, if you have turnover in staff, things like that, it was recognizing that. And it's also, I think, recognizing a little bit that since I've started this job, I think the time that it takes to do an inspection is probably doubled on average, which is, a good thing. I got trained, and I probably got trained a little bit differently because I got trained from a quantitative point of view of you've got 700 inspections you got to do in a year, you got to get out there and do it. And so we're changing that perception. So it has changed a little bit. I'm taking too much time, sorry.
Okay.
Yeah. So when I get an update, I emailed the environmental health directors that are at the meeting and just asked them for an update. When I get that update, I will let you guys know. I believe there's another meeting scheduled here next week, maybe, that we're going to get feedback from the Colorado Restaurant Association on this proposal of, you know, this tiered proposal for increasing the fees, and then, you know, if we do this, we'll do this type piece, and see where they came from that, because what we didn't have was a follow-up from the other stakeholders as to whether or not that was acceptable.
And they were saying that this next meeting will be the last one before they actually start writing the legislation. It's going to go to the people in the Capitol who draft the legislation. So it's sort of like the last crack at it. This next meeting, I think, will be very important because there are still especially the two unresolved issues, that the amount of what the actual fee increase will be, and then the posting or the publication of the results of the inspections, I think, are the two sticking points right now.
Right. And I think there are alternatives that we'll discuss for especially like the rating system. I mean, they're pretty adamant against A, B, C, D, F, but there are other alternatives that are out there that they've been discussed. So I think once that gets solved, we'll run with how we want to do that piece. So. Thanks.
All right, thanks, Kurt.
I have just 2 minutes.
Sure.
Okay, thanks. I took a little bit of a different direction from the traditional way that I report to you and what I've been up to. I just picked one of the programs that I'm involved with, the Environmental Public Health Tracking Project, operated through the Centers for Disease Control, and I tried to refocus that to me in what does that mean to Pitkin County and City of Aspen and Snowmass Village and all our constituents here. And so I compared the goals and the missions and the objectives of that federal program and the state of Colorado program to the Pitkin County Strategic Plan, and found that the message that we are sending to the community through the strategic plan is exactly what is involved with this federal program, which is associating various forms of illness and disease with various environmental stressors and environmental exposures. So I looked at the strategic plan in the three categories of flourishing natural and the built environment. The second was livable and supportive community, and the third was a prosperous economy. So when you look at the broader picture of what that truly means, it's a quality of life issue, it's The economy of our area is focused around people doing things actively outdoors, being very energized. When they come here, they want to be in the environment. They want to not be exposed to things they may be exposed with where they live, air pollution and water pollution, noise and so forth. So that reflects specifically the tracking program as a quality of life issue as well. So the built environment is truly a reflection of how the land use codes are developed and administered in Pitkin County, Snowmass Village, and the city of Aspen. So I felt very comfortable that my engagement representing the Board of Health at this one particular activity fits nicely with what you are sending out to the departments and to the community as what the vision and the mission are for Pitkin County. And then lastly is the Ecological Bill of Rights, which I was very involved with just prior to my retirement. I was able to convince Dottie Fox and Connie Harvey and Joy Caudell to get together one more time to restructure and resurrect the Bill of Rights that they'd passed and shepherded through 10 years prior. So I just copied them in my memo to you, but they appear on the wall of the Board of County Commissioners meeting room, and they appear on the wall of the Aspen City Council chambers. And the Bill of Rights were unanimously passed by both boards, supported by many activities and many nonprofits, including the Aspen Skiing Company, which is not a nonprofit, but they were supportive of it as well. So looking at the Bill of Rights and the 14 items that appear there, the Environmental Public Health Tracking Program fits nicely in that as well, because it links cleanly what the citizens expect under the Ecological Bill of Rights and what's being promoted as quality of life and disease prevention and ecological protection at this national level. So the bottom line is, I think there certainly is going to be an ongoing need for a presence of local people in these national and federal and state programs continuously. So I'll stop there. Thank you.
Okay, I'll get started talking about community water fluoridation. As you know, most likely, Snowmass Village recently has gone through a several-month-long debate about whether to fluoridate their water. In July, the Snowmass Water and Sanitation Board voted to take fluoride out of the water. It became known to the public that there really wasn't a lot of public input about that, and so the Water Board then did a community survey asking their constituents what they wanted. And so in October, there was another board meeting where proponents and opponents of fluoride could come and speak again to them, and they announced the results of that survey. Several of us spoke at that board meeting in October, as did an equal number of opponents of fluoride. It's probably very evenly matched. But I think that the one thing that changed one member's vote had to do with the results of the community survey, where 64% of them indicated that they were in favor of community water fluoridation. So they reversed their decision and indicated they'd start fluoridating the water the very next day. So several of us were there to speak, as I mentioned, and we just wanted to sort of give you each of our different perspectives. I'm going to just talk a little bit about the public health background, and Dr. Levin from the medical point of view, and CJ is from the City of Aspen, who's been through this debate with the City of Aspen a few times, and of course Tom from the environmental health aspect. So tooth decay is 100% preventable, and there's multiple ways that you can prevent tooth decay, most of which require active participation on the part of the person. You floss and brush daily, you get yourself to the dentist on a regular basis, but community water fluoridation is the most effective and affordable public health measure that reaches all sectors of the population, regardless of their oral health habits or their ability to seek regular dental care. Dental disease crosses no socioeconomic sectors. No one's immune from getting this illness, and preventing it can be very challenging, even in the most affluent communities. Dental care in and of itself is very expensive. dental insurance is very expensive, and most of the time dental insurance does not offer a broad set of benefits. Just because you have dental insurance doesn't mean that you have access to good dental care, which is what we know particularly well in this valley. And we know that children are the most vulnerable to tooth decay. They have to rely on parents and caregivers to educate them about the importance of oral health, get them to the dentist, teach them properly how to brush and floss. And we do know that there's a disconnect between how people value their oral health, how it relates to their overall health. People are just getting it now that what happens in your mouth does affect all the other parts of your body. So we know that there's a disconnect there, and it's not truly valued yet in our society, so that parents can pass that on to their children. And we know in families with limited resources, like those families on Medicaid, or whether that's a seasonal worker in our community that doesn't have dental insurance, it's really challenging to access dental care, as we all know here from our previous conversations. And we go back to that statistic of how 25% of our population lives at or below 200% of the federal poverty level. And we know that that population really struggles to access quality dental care. So the Aspen to Parachute Dental Health Alliance has a school program where they provide fluoride varnishes and restorative care, basic dental care to kids in all the schools. And what their statistics show is that children that live in communities that have water fluoridation have a reduced number of cavities. For example, in Rifle and Silt, where there is no fluoridation, no fluoride in their water, approximately 30% of those children have dental cavities. Whereas the children that live in Glenwood Springs or Aspen that do have fluoridated water, the rate is about 10 to 17%. So that's a significant difference between the children that live here and those that live in unfluoridated water in our own valley. Health equity, the definition of health equity, which is important to all of us, is the efforts to ensure that all people have full and equal access to opportunities that enable them to lead healthy lives. And even with all the significant improvements that we've made in health over the years, health inequity still exists, and in Pitkin County, not just our country. But community water fluoridation is one of those efforts that really reduces disparities in tooth decay prevalence, where a person's income level or their ability to receive dental care really is not a barrier to receiving the benefits that community water fluoridation offers. So, Dr. Levin, do you want to?
That's a great introduction. I know I wrote a letter that's included in your board packet. That was a letter that I wrote to the Snowmass Water Board, and there's a lot of information in it. I don't know if up front there's any questions that came up when reading through it at all that I can address.
I just want to make a general comment, but I think the information, the letters that were attached that you presented gave a very diverse background into fluoride, and I know it's been controversial because I've been talked to on the street from people for I don't know how many years I've been here. And so I think it was really well presented, and you guys did a great job, so I want to just thank you. And we haven't heard from Tom yet and CJ, but yeah.
Yeah, I think it's a really complex issue, and it reaches, as you've seen in the newspapers, it's been a very controversial issue. There's very strong opinions and emotions on both sides. And in terms of the medical part of it, a lot of these, there's a lot, and then the information age and the anti-fluoridation websites have fueled a lot of fears. And if you look at the studies that have been done, and there's been a lot of studies done over the years looking at community of water fluoridation. The concerns are that water fluoridation is linked to cancer, and particularly osteosarcoma, which is bone cancer, that it's linked. There's a lot of sweeping concerns out there that it's linked to lowering IQ, has cognitive disabilities, that it's linked to cardiovascular disease, that it's linked to Down syndrome and Alzheimer's, and just about everything. That there's been a study done that has linked this. And so what I really wanted to do was urge people to look at the studies that have examined and created this link. And you know, when you look at a study, you want to look at the authors, whether it's peer reviewed, what the statistical analysis is, and what the level of fluoride is in these communities that they're looking at. Our level now is 0.7 parts per million or milligrams per liter, the same thing. For instance, the IQ study, this was at the Harvard School of Public Health with the China Medical University, and it included 8,000 school children. Now in China, there's communities that have very high levels of fluoride. It's naturally occurring. Water flows over rocks that have fluoride in it. It's naturally occurring in water supplies, and in some communities in Africa and China and India, there's extremely high levels. And so this study, it concluded overall that IQ was lowered by 7 points in communities that had high fluoride in it. Now, these communities, some of them have 20 times the amount of fluoride that we will have in our water, which is 0.7, which is the recommended. So you really have to look at, do those results apply to our communities? I mean, these are much higher levels. And also the reason why this has come up recently, the original recommendation was in 1962 with the Public Health Service when they first linked that fluoride actually prevents cavities. And their first recommendation was the levels were 0.7 to 1.2. Now, since then, dental care and fluoride use has increased significantly since 1962. So Health and Human Services wanted to relook at this and say, hey, we've had so much more fluoride use. Do we still need to put fluoride in our water? Is this still beneficial to us, or is just the topical fluoride use and mouth rinses enough at this point? And so recent studies have looked at communities that have fluoridated water versus communities that haven't, because it's a question on a local level and communities can decide to put it in or not. And assuming that across the boards they use the same amount of topical fluoride, they found that the communities that have fluoridated water still have a 25% reduction. So despite this increased use of topical fluoride, toothpaste, mouthwashes, since 1962, we still need to do both and fluoridate water. And it's really important to actually have systemic fluoride, so not just topical, but systemic, where you drink it and it goes into your body, and it's more of a kind of a lasting and continuous effect in your saliva in terms of having fluoride exposed to your enamel. So you have to look at the studies, you have to critically assess them, and time and time again, the studies that have, there's been a very, very large recent study in New Zealand, one in the UK, none of them have linked to any diseases. Now, at the 0.7 level. Now, if you go above at the 2.0 level, above that, you start getting what's called dental fluorosis, which is staining of your teeth. And it actually is just a cosmetic effect. It doesn't cause anything malignant. But above 4.0, you start getting what's called skeletal fluorosis, where your bones can get a little bit brittle. And above that, it's certainly toxic in some ways, and it probably is linked to a lot of these diseases. But at the level that we have it, at 0.7, it's safe, and studies have shown that time and time again.
Have any of the studies looked at what age does fluoride stop being effective?
The understanding is that it's effective throughout life. Now, it's most effective when adult teeth are being formed. It's actually really effective for for children's teeth, but when their adult teeth are forming, it's that's where it's mostly effective. But throughout adult life, it continues to help prevent cavities. So adults benefit as well.
I want to thank everyone for all of your efforts on this very controversial issue and highly debated in our community. Yeah, it was a pretty tough sale there for about 6 weeks. So thank you all. It's going to come back.
Yes, it will.
It will be back. I've heard we might be anticipating a lawsuit from some residents within Snowmass Village. You know, there's always threats. So I don't know if that's valid.
I mean, I think it will come back. It kind of will probably come and go over the years.
It depends on who's on the board.
Yeah. I just wanted to remind everyone, we mentioned the number of people in Pitkin County. There's 4,500 residents of the 17,600 that live at or below 200% of federal poverty level. So in terms of getting dental care and the dental resources that we have, you look at a public health issue versus an individual right, and really that's where you're weighing here. And public health issue, which is the greatest benefit for the greatest number of people, and helping the people who who don't have resources in our community to help themselves. And then an individual right, there are ways to take fluoride out of your water at home. There are reverse osmosis systems which can take it out. There's also something called activated alumina, which is becoming more and more popular on the market. So there are choices that individuals still have. And there's also, buying water, buying spring water. Now, there's no regulation for bottled water at all. So there actually may be some bottled water that has higher fluoride in it than your own community drinking water. On the whole, it's probably lower, but.
Ann?
Is there a trend across the country to question the safety of fluoride, or are we unique?
No,
in
this is definitely nationwide, and the concern is the fluoride that we're putting in the water a different fluoride than what you would naturally get, what's naturally occurring in we have fluoride in our water that's naturally occurring. It's just not quite at the level that helps prevent dental decay. And I actually looked at it. It's sodium fluorosilicate. And this is a lot of chemistry, but it's a powdered form in snow mass that they put in the water. And basically, all it's doing is taking the fluoride anion from a natural source, and it takes it into a powdered form, and the anion dissociates out in the body. And so it's the same exact anion in a natural source that comes into your body. And so your body sees it in the exact same way that it would if you were drinking water that was naturally fluoridated.
Does it accumulate in your system?
It goes into your bones and into your teeth. So it accumulates in that way, but at the level of 0.7, it's a safe level.
And I think that what keeps bringing it to everyone's attention is the Department of Health and Human Services has recently changed the recommendation for the level down to recently 0.7. So I think with that announcement it raises the awareness, and people begin to question then, why do we have it at all? If we keep reducing it, what?
Sure.
And that reduction again was because Health and Human Services looked at water fluoridation and felt that it was still important, but because we have the topical fluoride now that a lot of communities are using, that it can be lowered to the 0.7. It was the lower end of the point that they had originally done in 1962. So that's why it was lowered. That we do have these supplements now, but there's still not enough than actually drinking water.
Rachel?
I remember going through this discussion on the Aspen City Council and Aspen Water more than about a decade ago. And the decision was made to keep the fluoride in the water. I'm not sure at what levels it was within the recommendation there. I think it was the low level. But I remember very clearly community health weighing in at that time. And so I'm glad that you were able to look at it and see if there's any differences in that 10-year period. And it obviously was another tough case, it being Snowmass, not Aspen, but appreciate your weighing in.
Thank you.
I had a couple of questions. One, is there any natural level of fluoride in our local water sources? And if so, what is that level?
There is, and I think it's probably about 0.1 parts per million, and so we're going to we raise it to 0.7, which is the recommended. And it probably varies as well. I think it's probably around 0.1.
Okay. And in Colorado Springs, where the
Yeah, I think
the
so.
dentist
That's what I remember.
or doctor did the study, what is their level there where they were getting the fluorosis on the teeth, whatever from the staining on the teeth?
Dental fluorosis starts at about 2.0. And sorry, what the question was?
Well, in Colorado Springs is where the
right, where originally
talked about that. So
right,
do you
in the
happen to know what
1920s they originally.
their level is there?
I don't know.
So I used to work in Teller County, which is just in the foothills right there, and we had that issue in some of the private wells, and I seem to remember that we were, 2.2, 2.3, 2.5 were the ones that I remember seeing sampled, because I know there was a concern some of the children actually did have some yellowing teeth from naturally occurring fluoride. It just
okay.
Well water there. But I can't speak absolutely, but that was about what those were when we were talking about it there.
And I was curious about bottled water from a couple of viewpoints. One, the way they make some bottled water is they take all the minerals out through reverse osmosis or something, and then they add minerals back in to give the water some taste. And so I was curious if any of the bottled water companies are putting any fluoride in whatsoever.
We don't know.
Then if you go to Walmart or somewhere and you see some families with their whole shopping cart full of bottled water, I don't think they're drinking any tap water whatsoever. They're just drinking bottled water, probably getting very little fluoride, even if there's fluoride in the water supply.
It's not regulated, so we don't know, but likelihood is that they probably aren't getting enough to help, you know, to that level, but again, it's not regulated.
And then what is the cost to counties, county health departments about caused by dental caries? What are the costs to society from dental caries that are oftentimes untreated?
Well, medical costs, just the association of oral, children having to go to surgery to have teeth pulled because they're full of cavities. Emergency room visits because of tooth decay and pain. A lot of healthcare costs could be saved with the improvement in oral health, which community water, which fluoridation would help support. So a lot of medical costs would be reduced. That's the main thing I can think of.
There's a lot of undocumented costs, I think, that go with loss of self-esteem by children who have such bad dental hygiene that they become reclusive, or they become socially unacceptable, or they're not going to be active as a person who doesn't have that type of effect going on with them. So I think there are a lot of unmeasurable costs that go beyond just the medical thing. And as Dr. Levin pointed out, it's a lifelong exposure that helps determine your quality of life all the way through adulthood. And so if we neglect that early on, I have a suspicion, and it's probably been fairly well documented medically, but that it's going to be, can be very devastating to a young person, especially the underserved or underinsured, who don't have any other way to get some form of preventative care.
And those same, the underserved people are the ones who are coming to our Health and Human Services by and large because they're, you know, they need more help. That's what I'm thinking. I think there's some cost to us that could be traced, at least maybe not exactly quantitatively, but
I have a statistic, I'm not sure exactly where it came from.
Get closer to the mic, please.
Oh, sorry. Every $1 invested in water fluoridation saves $38 in dental costs. But again, that doesn't.
That's a good number. We like that.
What's that?
We like that number.
Yeah. Well, I don't know exactly where that came, but again, that doesn't quantify all these other type of psychosocial costs and medical costs for medical issues that result from poor dental care.
Do we know why Silt and Rifo do not have fluoridated water?
I believe it's been a community decision.
Yeah.
How old is that now, Tom? Do you know offhand?
I don't know, but I don't know that they've ever fluoridated their water. But I don't know how long.
Yeah, I'll talk to Christina. It would be interesting in her perspective.
Patty?
I had two. It's also my understanding there's a correlation with poor dental hygiene and cardiac disease. And so that's something else that we need to think of as our population grows older. So if you nip it in the bud at an early age, hopefully it'll prevent problems in an older age. And Tom, this is a question to you, and then brought up the different types of fluoride, natural fluoride, additive fluoride. I watched a video someone gave me who was an anti-fluoride person here in the community. It was a video really supporting taking the fluoride out of your water. And there were different types of fluoride that could be added to water supplies. One of them had some significant unintended consequences, not good consequences. And the other one was, I'm hoping the one that we're using locally is the one with the least amount of unintended consequences. I'm looking at Tom because he's, or CJ, but you need to get on the mic, so.
Yeah, what Dr. Levin touched on that a minute ago is about what?
My understanding is that there's 3 different ways that you can fluoridate water, and they're all chemical. Well, one's sodium fluoride, which is in toothpaste. Another is sodium fluorosilicate, which is what Snowmass uses. It's a powder. And then there's a liquid. It's fluorosilicic acid, which is liquid. All 3 of them deliver the fluoride ion. Once they're in water, it dissociates. So I don't know what the information was, that there was one that had more side effects.
Compound, and I can't remember what it was. That was not one that would, but it's something that you can find in areas with natural fluoride. It's just a type of fluoride that comes from probably the natural mineralization or geology. So CJ, do you have more?
I was just going to comment, one of the concerns that comes up is also the source of that fluoride and other possible contaminants in the fluoride that's being added to the water. Snowmass has been the most recent in the spotlight, but in 2012 we had a pretty extensive discussion with City Council about water fluoridation. Was our most recent presentation to them, and one of the things that we incorporated into our fluoridation program was testing all of our batches of fluoride that we got to add into our water. So we currently test 10% of any given batch. So we get a pallet, it's got 40 bags of powdered fluoride product. We'll take 4 of those bags just to represent 10, do a composite sample of that 10% and send it off to a lab and test for all heavy metals. And so that's what we're currently doing with our program to just make sure to double check that our
Screening
sources.
out contaminants.
Yep. We have not had any positive hits on any heavy metals with that fluoride that we're using.
We want to keep those heavy metals out of that water supply.
And it's very tightly regulated. There's something called the National Sanitation Foundation, and the NSF, and the National Sanitation Foundation, that has really strict levels for these heavy metals and arsenic, mercury, cadmium. So I'd be surprised if you did find something with it's a national.
Yeah, and we haven't, but that was just, put in as a secondary measure just to make double sure.
Right.
So.
Yep, thanks.
Yep.
Patty lives on Smuggler Mountain, so she has an aversion.
That's why I
to
keep looking at Tom. Heavy metals,
Tom?
Tom. Heavy metals.
Can I just add one thought? When Dr. Levin and Liz and I appeared before the Snowmass Water and Sanitation District Board, we jointly wrote a letter to the paper after that meeting, thanking them for their courage, but also their civility and their courtesy towards everyone who was there on the 21st of October. I joined Liz and Dr. Levin as the Board of Health and Environmental Public Health advocate to encourage the recognition that what we do goes beyond the clinical doctor conversation, and it becomes more of what's for the greater public good, understanding that not everyone is going to be in favor of what the decision is. But in this case, I felt strongly enough, and my experience having been in CJ's position before and in Kurt's position before, where 30-some years ago we were having the same conversation in the city of Aspen and Pitkin County about this same issue, and it's going to come up again. However, our concluding statement of mine to the board was that I encouraged them to vote in favor of restoring fluoride to the city water system, but also encourage them to continue to look at science as the science evolves, so that we base our decisions on true and accurate science and not an emotional message. Everyone that spoke had a good, very personal message to offer, but to objectively remain current on the science of what this means. And it may mean 10 years from now, as Rachel mentioned, things may change. But currently, the best science that we have is what was presented. And so we urged passage of it based on that type of a scientific background.
Thanks, Tom.
Any other questions for us, CJ? Anything else to add from the City of Aspen's
No, nothing in
perspective?
particular.
Okay.
I think we are where Snowmass has just recently voted to return back to. We're at 0.7 parts per million for the City of Aspen's fluoridation program. As I mentioned, we do some additional testing on that. Our most recent direction from council came in 2012, and I would anticipate in the next couple of years, we'll probably be back in front of council to review that decision. It's just kind of the cyclical nature of this issue is that it comes back and gets to kind of a boiling over point where it warrants some public discussion. So I don't doubt that we will be back there at some point in the near future.
Thank you all very much. Thank you. That's it.
Okay,
Thank you.
thank you. Is there anything else for the good of the order of the Board of Health before we adjourn? I'll accept a motion to adjourn.
I'll move to adjourn.
Second.
All in favor of adjourning, say aye.
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 Thanks, Marky. Thank you.
Okay,
Yeah,
thank you.
guys both for coming.
Let's see what time it is here.
Started about 2:15 or something. We weren't that late. We just started.
I'm not sure if everybody's here. Let's take about a 5-minute break, I think. I think we need a.
Oh.
Go into session as the Board of Social Services. All in favor, say aye.
Aye.
Okay, Nan, are you leading on this?
I am, yeah. Being here with you all.
All day long.
I'm happy to punctuate the end before those of us who go on to being mortal, at the Jewish Community Center this evening. So, as always, it's my pleasure to bring the Human Services team here in Pitkin County. We call our department Human Services. Your statutory obligation is to serve as the Board of Social Services and to review our expenditures as well as the payrolls, the money that is granted out through public benefit, through Medicaid, food assistance, childcare. And so those are your two obligations today. And we will also be using this meeting today to introduce you to our new Veterans Officer, to talk a little bit about some things that will be coming your way through Adult and Family Services resolutions, to talk about senior services, and then finally, at your request, Kathy Lyons, our partner from Eagle County, is going to talk to you about CSTAT measures, the Colorado statistical measures, the way that were measured in terms of performance by the Department of Human Services. And after we presented in the summer, you all recommended that we take a few measures at a time and drill down to them a little bit more. So we're going to talk about the food measures because the timing is perfect. And so that's our plan for today. And I have visuals up here for the viewing audience. You have them in your packet. Connie's going to start with our budget expenditures from January through September.
So the chart on page 2 of your budget packet is a budget to actuals comparison for January through September for the main program areas of the Human Services Fund. The 6 main program areas are listed there with both revenues and expenditures and then the net amount for each area. But I'd like to start down at the bottom of the chart where it says total programs. And under total programs, you see that the state and federal revenues are just over $2 million, and the expenditures budget are about $2.2 million. So that's a net deficit of $180,000. That is what is in the budget for the Human Services Fund. This deficit is offset almost entirely by property tax, the mill levy for the Social Services Fund, leaving just a very small deficit budget-wise. We are currently looking at 75% of the year. At the top of the chart, I know it says 41.7. That didn't get updated. I'm sorry about that. But we are looking at 75% of the year. The percentages for the total programs look a little bit skewed, and that's because of the supplemental requests that were brought to the board mid-year for a number of new positions with new funding resources to go along with those positions and programs. We did bring to the board the full amounts for the state fiscal year, which started in July and goes through June of 2016. So that's why our budget amounts look a little bit off compared to the actuals that have come through at this point of the year. On the revenues, we're at 58% of revenues received and 57% of expenditures paid out at this point. So we are balancing out with our revenues and expenditures. It's just a little bit off with all of the different transitions this year with new funding and new programs. We are on track to finish the year better than budget. The only program area that we are expecting to be actually overexpended compared with the county budget is TANF and Colorado Works. You'll see on the following page the increase in that program area. But this is a relatively small amount of our county budget. It's only just a little over 2% of the expenditures for the county budget. So the over expenditure does not have a large effect on the fund, and other savings will make up for it. Does the board have any questions on any of the budget versus expenditure amounts?
Well, I did when I saw the 41%, and we were way over budget, but since it is not 41%, we're actually in good shape. So I had this, you know, the red flags were going up all over.
That was my mistake, not updating the chart.
Rachel?
Well, traditionally on some of these things we're over, then the state will do a closeout of the books of the year, and other counties that have unspent revenues will assist with counties who are over. Do you feel that will most likely be the case this year?
Yes, we have a good history of being mitigated in child welfare and closed out fairly well in the admin area of the fund. So we do have a good history with that and are expecting to finish well. We did this year, the closeout was in August, so that has gone well. There is a difference, though, between the allocations that we receive from the state, which also have the federal funding included, and what we budget in our county budget. So our county budget does take into consideration the fact of what we expect to really spend in the fund, and then just plug in the revenue amounts that we think we might be able to get mitigated through the state. So as we talk about different program areas like child care, where we are overexpended on the state allocation level, on a county budget level, we are actually doing okay.
Thank you. Good to know.
Any other questions? Okay, thank you.
So you want to entertain a motion to approve the
Yeah, I think I would
expenditures?
accept a motion to accept the budget.
Let me ask, do we have to do them individually on the client payrolls and the different elements of the programs you administer?
We, if the motion identifies both, I was both right now, we don't have to address the payrolls.
I'm just thinking maybe if Nan could suggest the appropriate motion for this part. Is it, because it's not the budget, it's...
The first thing, your first obligation is to approve the expenditures through September.
Services okay.
Great, thank you. I don't usually say as much time as we need for Kathy to present the CSTAT measures. So I'm going to ask Mitzi to introduce Scott Ring, our new Veterans Officer.
Very good. Yes, thank you very much. So as you all know, we did have a real change that occurred this past July. For many years now, Garfield County has incorporated Pitkin Service for Veterans as part of an IGA. And they informed us this summer that they were no longer interested in continuing that relationship. So we came before you in August, and you all approved that we could, during this year, 2015, go ahead and hire our own veteran service officer. So we had a recruitment experience, and I'm very happy to introduce Scott Ring, who has been appointed as our veteran service officer. He started on September 28th. So he is in training mode, has spent some time already at the State Department of Military and Veterans Affairs. They provide some intensive beginner training, and then he's also been shadowing our Eagle County counterpart, veteran service officer. And he has talked with Joe Carpenter in Garfield. Joe Carpenter went through a health crisis and so has been somewhat unavailable during this time. Pat Hammond has been terrific. So Scott is really learning the lay of the land, and he comes to Pitkin County from Summit, but he has relocated here, family in Glenwood, lives in Basalt, and so it's very exciting. Tomorrow he is going to be heavily involved with the Veterans Day activities, and you've already worked with Colonel Merritt quite a bit, and yeah, so we're just really pleased. Our goal is to really, Scott's goal is to really meet and provide services to our 900 veterans. So, you know, that's incremental. We hope to, maybe you hope to meet at least 25% of them.
Or more.
In a certain period of time, and, you know, it's just going to be, but his phone is already ringing a little bit off the hook. So it's very exciting to build this veterans unit in our division.
Do you want to say anything?
Any questions? George has something.
Well, do you have an office, or are you just
Yes.
at the Health and Human Services building?
He does. He's in our suite, our administrative suite. We just effectuated a move so that he has a proper office for interviewing. And yes, so, and then you can talk about how you're seeing people, your hours. So
Maybe
far.
lean into the mic. We're in this awkward
Lean into the
room, yeah.
mic.
Thank you.
Okay.
I'm currently working 21 hours a week at Health and Human Services building. My office hours for the time being, and they are flexible to some degree, but for the time being, I'm there all day Monday and Tuesday, and half-day mornings on Wednesdays. I'm very happy to be in this position and to be a part of Pitkin County. And I'm very grateful the commissioners, council members recognized the need for a veteran service officer in Pitkin County. And I look forward to serving the veterans of Pitkin County. Thank you.
If someone can't make it up to Aspen, to the Health and Human Services building, they can contact you and you would go meet with them?
I already have had a case where we met in El Jebel at the Eagle County building.
Mm-hmm.
So certainly willing to travel to make it more convenient for a vet and meet wherever would be easier for them. In the 6 weeks I've been doing my job, I've also made a couple of trips to Grand Junction where we had part of my training. I went to Grand Junction Veterans Administration Hospital with Pat Hammond, Eagle County Veteran Service Officer. And what we were doing that day was taking a vet to the Veterans Administration Hospital so he could get some testing done in order to refill a prescription or some medication. So I think that a big part of my job will be traveling, and either to the Grand Junction VA or Eagle County and Garfield County. We're really trying to work closely with those two counties to serve the veterans the best that we can.
Scott, Pat Hammond had said she had 4 veterans who missed their appointments at the VA in Grand Junction because they didn't have rides down there, and she tried to arrange rides and was not successful. So I think the transportation piece, getting people to the teleclinic in Glenwood is easy because they can ride RAFTA to there, but getting them to Grand Junction probably will always be an issue for some people. And I know there's been work on having a better system to help people get there, but that I think will be part of your charge for sure.
Absolutely. Pat, I've had brief conversations with Pat where there are some services that provide transportation. They're run by volunteers, staffed by volunteers. Her biggest challenge in Eagle County is getting people to Garfield County, to Glenwood, to where it would be easier then to get a ride all the way to Grand Junction. She's got a volunteer van service that runs from Eagle County, but it stops before the canyon. So there's that stretch in Glenwood Canyon that's not really covered now by any service, and they rely wholly on volunteers to make that connection when a veteran's coming from Eagle County. But I think you're absolutely right, Steve, and that is going to be a challenge and a big part of my job. And I look forward to upping the service and And I foresee making quite a few trips, actually, to Grand Junction to assist veterans in getting to the hospital and getting the services they require.
Rachel?
Yeah, I was kind of thinking along the same lines, and, you know, programs like this take time to more fully develop clearly, but I could see something where you could get in working with the VA injunction on kind of regular out-of-region scheduled visits, so that there might be more of a carpooling opportunity, you know, and a little more efficiencies, both with your time and other people's times as well. But that would be a little, you know, further down the line. But I certainly could see something like that coming to pass, so that it didn't take you that far away from your other duties while you're administering someone's needs. But certainly that's the way to go now. But thank you for that. And, you know, I think it's something to keep us informed. We've had vans for carpooling our employees that we've obtained through CMAQ, and I don't know whether 16-passenger van or some other type of van would start to become part of a motor pool to assist with this and carpooling.
Yeah, I think that's excellent. If we could have something scheduled, or knowing that once or twice a month on certain days there would be a van going to Grand Junction. Currently it's kind of hit and miss, and scheduled case by case, versus something that we could carpool and get more veterans.
And certainly when something's acute, that's going to bust right out of a model that you create no matter what. But if it's for more regular activities, it might be really nice. And again, coordinating with their doctors, so they have the openings on those days when we set it up and things like that.
That's a big key, I think, is having that communication with the VA hospital down there, and showing up on the days when they have appointments available.
I really appreciate that. Thank you.
We are super excited to have Scott and to start to make a better connection between our veterans and all of our services up here as well. And I think we come quarterly, and we'll make a point of making time for Scott to present to us numbers that we never really have understood, who he's seeing, what they need, and what are the gaps, what are the strengths that we have. So thanks for coming.
Scott, while you're here, could you tell a little bit about what's happening tomorrow at 11 o'clock?
I'm glad you brought that up, Steve. Tomorrow is a Veterans Day. It's going to be my first one attending, but I understand it's an annual event. For the most part, organized by Colonel Merritt and Dan Glidden. And it's a ceremony taking place, previously it had taken place at the plaza area where the Veterans Memorial is. And they've decided to move it to the fire barn, I believe it's called. I just got a text message on
tomorrow.
that.
Because of the trumpet player.
That's exactly right, due to the weather. And I had a message from Colonel Merritt asking your husband to bring the trumpet.
Oh, the fire barn.
I'll make sure Dick is there in the fire barn.
So the ceremony.
Inside the fire.
Yeah, the ceremony has been moved to the fire station / barn.
Oh, great.
It's taking place at 11 o'clock. And directly after that, the local Elks Lodge is hosting a lunch for veterans, and they're expecting about 150 for that lunch. So a couple of great events going on tomorrow to recognize local veterans.
Thank you. Thanks, guys.
Thanks very much.
Thank you so
Pleasure
much.
to be here. Thank you.
I'm going to have you guys switch out and ask Kim and Marty to come up. Kim first. So Adult and Family Services has 2 resolutions coming before you next week, and just wanted to make sure you have a heads up about it, because we're not coming in through a work session, so we're using this time to advise you about what's coming up.
Great, thank you. Yes, there's actually a date correction on one of these as well. So the first IGA update, the first item that we're going to bring to the board next week on the 18th is a reauthorization or potential reauthorization of our Eagle County and Western Eagle County and Pitkin County IGA intergovernmental agreement to provide child welfare services. We have had this agreement for a little over 3 years, and it sunsets December 31st of 2015. So everybody is very enthusiastic about the possibility of reauthorizing the IGA. So that will be here for first reading, or our next meeting for the first reading on November 18th, and then the second reading will be December 2nd. And then the Child Welfare Citizen Review Panel. This is a requirement by the state that we have 3 people appointed by the Board of County Commissioners for what we call Citizens Review Panel, and that's like the last step in a grievance process that someone might, a caretaker or a parent might want to participate in if they disagree with how we've provided the services that we've, in which we've worked with families on. And we haven't had to use that. We don't expect to use that in the future, but we are required by statute to have that board appointed. That will actually be on December 2nd. Sure.
Make sure I'm not confusing issues. You guys work in a very confusing arena.
We do.
We try our best.
You try
We're
very hard.
confused most of the time, so.
We do.
Is this separate from the review panel that must have a county attorney on it?
The fatality review
That's
panel.
Okay.
Yeah, it's separate.
So it is separate.
Right.
Because there's a kind of an effort, I'm not sure if it's administrative or actual legislative through CCI, that some counties are like, I'm not sure we all need to have our county attorneys there, and can they have someone other than county attorneys on those sort of reviews, more to regional level, but that's not this panel. so I'm
Right,
not
no,
worried
this
about
is if there's a conflict with the caseworker who's working with the family, and we take that through 3 different levels. It would go, they would first talk to the caseworker, and then they would talk to the supervisor. If it's not resolved there, then they would go to the director, Nan. And if it's not resolved there, and we haven't had to use this in the past, and don't, like I said, hope to have all of this resolved in those 3 steps, we would utilize the citizen review panel to review everything and have an impartial disposition of the situation.
You probably know that we get audited on so many different levels,
Yeah.
and the state provides opportunities for families to appeal a finding that a caseworker makes about whether there was abuse or neglect in a home. This is not that. This is simply about caseworker conduct. And so the state has kind of separated out these different levels of complaints, but we're required to have this process. We had a regional process starting in the late 90s with Eagle, Garfield, and Summit. And because we were required by law to have this committee, we never used it. Nobody ever used it because we were able to resolve everything at the earlier level. And the other counties have decided that it's easier for them to maintain a county-only review panel, so that's what we're doing as well. The names that we're putting forward to you are the same positions that we have had in the past. Our partners in Mind Springs, our partners in public health, and in Kids First. And we really feel like they have an understanding of the importance of the customer experience and the importance of what we do and our passion for building relationships. And so if they have to, we think they would have a good ability to assess.
So in this memo, it says on page 7, number 1, it says, all grievances will be forwarded to the county director. And I'm assuming that means you, Nina?
Yeah.
So I just, because I'm like, okay, is the county director John Peacock? Is the county manager? Because it didn't say county social services director is what it means.
County Human Services.
Human Services. And as far as the appointment to the Citizens Review Panel, you're suggesting members with those 3 organizations, somebody who works for them. We don't have a specific name Or-
We do.
Okay, so that
yeah.
will come forward, just because
Right.
it kind of said, we're appointing 3 citizens, and I'm like, who are they, who interviewed them, who's appointing them, so you clarified that. And on the first one, the IGA with Eagle County, have they reviewed their approval for the IGA?
Yeah, so there's been a lot of behind-the-scenes work that's been occurring with their attorneys, our attorneys, their manager and director, our manager and director, to really move this intergovernmental agreement along. There are very minor changes to that, and we'll be talking about that
Okay.
next week. However, it's been vetted with all the various
So hopefully
folks
by
that would
next
be
week,
involved.
we'll know what they're approving.
Right,
Because I'd
right.
hate for us to approve the first part, then it gets changed on
Right.
their part and it comes back to us. So
Right.
we're hoping to do a smooth
We-
first and second read.
Just a reminder, we have a 2-part obligation, they have a 1-part
Okay.
obligation. So
We can get ours first and then it can come
That's
back.
right.
Yeah.
Yeah. So they have lots of time before our second reading, and we'll make sure that we have everything all ironed
Great.
out by then.
Okay, thank you.
Okay, any other questions?
Thank you.
Great.
Appreciate the heads up.
Thanks, Kim. Marty, you want to talk about senior services?
Yes, Marty Ames, Senior Services. Hi again. I'm so glad you're pulling that up
I'm
because
coming. Just don't get sick while I'm
I
rolling the dice.
misplaced my notes sometime
Here,
over
Marty.
lunch. I think
I'm
the
here
ducks
for
ate
you.
them. At the pond. We sat at the pond. Yes, so I did look them over before lunch, and I realized that almost everything in my report has already been said this morning in the budget presentation, so this will be very brief. A slight increase in our congregate meals, which I had mentioned before, and although the difference is we were closed for 2 weeks in July. Had we had those, so August and September are show increases in congregate meals. A slight decrease in the home delivered, which, as you know, just depends on the health of the population. So that number, reduced means we have healthier seniors right now, and typically that does go up in the wintertime. And then the information and assistance reflects calls, walk-ins, Medicare assistance, and all different kinds of information and assistance. If you could, oh, actually, I can do this. I put my glasses on. As far as the nutrition program, oh, I know what I wanted to mention is the care navigation. You'll notice the care navigation numbers are missing. That program and the associated state funding is now fully being transferred to Human Services, to Kim's department, where they have been providing the service with a licensed clinical social worker, Joe Ramsey, for some time now. And it's going to fully transition to their department, including the reporting in the future, which we see as a huge win. We really finally, after years of experimenting, found the right way to provide that service, to provide that continuum from early intervention and prevention, right on through adult protection when it's needed. So that's a happy note. We've implemented a few things. Rachel had asked earlier about the reservation system, which we already had scheduled to start even before the kitchen transition. It was not associated with a kitchen transition. We were planning to start that in September. We actually didn't get it started till October, but we're finding great results with that. The results we wanted in terms of projecting meal preparations and food purchases and consequently the budget. We've also implemented a suggestion box so that people can offer help to our new kitchen staff to let them know what they like and provide suggestions, many of which have been implemented. The blizzard boxes, again, I think I said earlier, have already been taken to the Crystal area, and we even provide them in marble. voluntarily, even though Marble is technically in Gunnison County. We go ahead and include them because it's the right thing to do. And, you know, I really think we went through all the rest of this. Would you like me to briefly go through it again?
I think it would be helpful if you all have questions, because we have more on the agenda. Is there anything in particular that you want to ask Marty?
Rachel?
Well, this is kind of a small thing, but I know that both of the newspapers have a daily calendar, and I know in the past I've seen senior lunches listed as one of those. Have you had a chance to update those with the information that a reservation's needed now, or a call to reserve? Just something to check in on.
Good question.
Okay.
I will check on that. Thank you. I believe we have. I think it's in there.
Yeah, I'm just not sure. Thanks.
Marty, is it possible for somebody to either send a text message or an email message or somehow give their reservation online rather than calling on the phone?
We could do that. That would be easily done, and I will talk with the staff about implementing that. We currently have two options, Steve. One is, those of you who have been to the Senior Center know we have the My Senior Center touchscreen, and that's where people sign in for their various activities, exercise classes, and so on. It has a reservation system built in. So while people are there signing in for that day's lunch, they can go ahead and reserve out for a full month, so they can keep that updated. And that's what most people are preferring to do. Then we have the call-in option, you know, as a backup, especially for those who aren't regulars. But yes, we could do an email. That would work. So we'll get that going.
Okay. Another issue is on delivering meals. Periodically, there's a call for somebody, please help. We need somebody to deliver the home meals. And could you talk about that a little bit? What are the issues there?
Human nature, you know, we use volunteers for our home meal deliveries. We have two routes, we call the Down Valley route and the in-town route. So we need 2 volunteers a day, and sometimes somebody gets sick or has a flat tire or something, and they're not able to give us a lot of notice. That's when we put out those county emails. We typically have a response. If we don't have a response quickly on that, then we have Mary Barber is in charge of this. She will call other volunteers, and as a backup, we will send a staff person. Mary herself delivered meals on Friday when we couldn't find anyone to cover for that absent volunteer. So, I mean, we would never not get the meals out, but occasionally, you know, we do have to scramble a little.
And how many stops are there, like on the in-town or the Down Valley route on that?
Well, right now, with our numbers down a little bit, we only have 10 or 11 deliveries. So it might be 5 in town and 6, you know, in the valley, Snowmass and Woody Creek. And, you know, we will probably, as usual, get up to the 20s. Our capacity really is about 25. And we have added a 3rd route as needed.
Okay.
Rachel? Real quick, Steve, that's great that you brought that up. I really appreciate it. And it makes me think a little, we've already passed through our volunteer board party for the year, but it'd be nice to invite the volunteers who do these home meal deliveries next year, perhaps. And, you know, of all the volunteers we invite, a small percentage actually can make it any given time. But I think that would be nice to include
That's
them.
a great idea. And as you know, we have an annual luncheon, volunteer luncheon, every spring, where all of the volunteers who have done anything for senior services throughout the year are invited to come for a very nice luncheon and program.
I was unaware of that, but I'm glad to hear that.
Yeah, it seems like it's always on a 2nd or 4th Wednesday when we're having or perhaps, it seems like there's always a lot of times a conflict that we can't go to that because we're having a meeting over here.
I think it's the Tuesday. You're right. We have it on an off
Or maybe
our
it's
lunch
on
day.
our Tuesday
So
meeting
maybe
day.
we could move that to Thursday. Great idea.
Yeah. Because I mean, I managed to go one time, but it's like, I would love to go every time and just to honor the volunteers.
Yes, thank you. We can make that happen.
Great, thank you, good questions.
Anything else?
Okay, thank you. So Kathy, you want to come up? And while Kathy's coming up, I just want to introduce Donnie Ryan in the back of the room. Donnie, will you raise your hand? Donnie
Hi.
is getting her master's in social work at DU in Glenwood Springs, and she's working with me this year as an intern. Remember last year we had Gary, now we have Donnie. And Donnie is working on the Stop Fighting It Hurts campaign, and she's spending a lot of time learning about what we're doing, and she'll be involved in some care navigation next year, and we're really excited to have her here. So I just wanted to introduce her.
Thank you.
So Kath, why don't we start with payrolls and just get that done, and then, so you all remember Kathy Lyons from Eagle County, our amazing partner who we love. She drove all the way up here and found the Gant, which is amazing. It's amazing we found it, let alone our Eagle County partner. So the first order of business is to approve the payrolls, and this again is the direct client electronic benefit transfers for the third quarter payrolls, and you'll see comparisons here. And is there anything that you want to say about it, Kath?
I think just a couple things you probably noted on our child care expenditures and our Colorado Works expenditures. We've had increases in those. I think child care you're aware of. We have worked through our 1291 grant with our family engagement coordinator, who has really been able to help families through that application process. And so the caseload has doubled since last year. And so hence that's why we have the much higher child care payrolls. For Colorado Works, we've also seen an increase in that caseload. So the number of families generally that are receiving what we call a monthly basic cash assistance payment. And so that contributes to that large increase. We used to have an average of 1 of those cases a month, and now we have about 5 per month. And then they have had some significant requests for what we call a supportive service. So more of a lump sum payment to help them with something specific that would support them in moving toward employment or keeping the employment they have. So maybe a car repair or something like that that could be several $100s. So that has contributed to the increase in those payrolls for Colorado Works. Any other questions?
That's a huge increase in Colorado Works. It went from $6,400 to $35,000, almost $36,000.
Yes.
Where you're going from 1 case a month to 5. It's dramatic.
Yeah,
I mean,
that's
you know, the
significant.
numbers are still so small for us.
Yeah,
But
that's
that's
just
a
different.
dramatic increase.
Are these benefits based on where somebody lives, physically lives, or where they pick up their mail?
Physical, it's your physical residence.
Or is there any time ever when somebody comes in who lives in Garfield County and they come into your office, Nan, looking for help? Does that ever happen?
Well, hopefully if they do, we get them help, but we don't have them sign up through Pitkin County for eligibility. And there are pretty rigorous boundaries between the 3 counties that you have to apply in the county in which you reside. So
So if anybody did walk in who lives in Garfield,
we would direct
you
them
would
to
refer
Garfield.
them to the appropriate place
That's
in Garfield
correct.
County?
Yeah.
Okay, I was just curious about that. We've had a little discussion about a couple items having to do with Garfield
It's really
County.
different from, say, child welfare, where if we get a hotline call on child abuse and neglect, we have to take it. We cannot say, oh, you live in Garfield County, this is Garfield County, hang up and call them. So we are obligated to take that call. We haven't crossed boundaries in that way around economic security yet. So people have to actually submit their application in their county of residence.
Okay.
Okay.
So we just need a motion to approve the payrolls, client payrolls
I
for
would,
the third
I would
quarter.
accept a motion to approve the quarterly payrolls.
I will make a motion to approve the quarterly program payrolls. Second.
All in favor, say aye.
Aye.
Okay.
Great, and then just briefly, if you can talk a little bit about open enrollment before you go on to the, there's other pieces in your memo that I think you guys can catch up on, but this is open enrollment season, and so we want to talk about that briefly.
So we are moving into our third open enrollment under the Affordable Care Act. And that started November 1st and it runs through the end of January. We have, as you remember, we had a grant through Connect for Health Colorado to establish the West Mountain Region Health Assistance Network, which are our guides who can help individuals through the process of purchasing health insurance through the Colorado marketplace. So when we started that with that grant, we had 4 guides, and at the end of last year, the federal funding ended, and so this year our funding was cut by about 60 to 65%. So we have 2 health coverage guides who are covering the Eagle, Garfield, and Pitkin region. So we have those 2 guides. They are traveling. They will be available in Aspen and the Algebel area 2 days per week during this 13-week period. And we are also hosting some what we call walk-in enrollment events in different areas up and down the Roaring Fork corridor. So that's where we are. And so as a result of open enrollment, as you may remember, that went hand in hand with Medicaid expansion. And so I did report on the numbers. You had requested this previously to see how large how many individuals were now receiving Medicaid. So you can see we moved from 2013, before ACA, 447 individuals were on Medicaid to now 1,532 on Medicaid in Pitkin County. And hand in hand with open enrollment comes a surge of Medicaid applications because people have to apply through Medicaid first to determine if they're eligible for that before they can then see if they're not eligible for Medicaid, they can move on to look at a tax subsidy to purchase their insurance through the marketplace. So just of note, in October, and this is overall, this is Eagle and Pitkin combined, we saw a 75% increase in Medicaid applications. And that was in October, and I just looked at the first week of November numbers, and then for the entire month of October.
Are we able to capture more folks who haven't signed up at all yet, or are we just working more to keep the current?
So folks who have previously been enrolled, some of them are eligible for what we call like auto re-enrollment. So what that means, if they are requesting no change and there's no change in the plan they're enrolled in, they get a letter saying this is going to be your premium during 2016, it's still the same plan, then they can just choose to automatically re-enroll in that plan, so they don't necessarily need to take any action. If someone wants to change their plan or is in a position where they have to change their plan, then they do have to, manually enroll through the Connect for Health system. I mean, we are trying to serve as many customers as we can through that process.
And just a reminder that there are brokers as well who provide this service. And so we've posted a list in our building in case people feel that they can't get access to our Connect for Health staff. So you can go to a private broker, and there's lists on the Eagle County website. I don't know if it's on our website, but we can make sure that it is.
Yeah. And I appreciate the auto re-enrollment and what you're saying. I may not have phrased this as well as I could have, but I'm just wondering if people have really gone through the process once or twice, are they feeling comfortable themselves just going on and re-signing up?
I do not have a sense of of that, whether they are or not.
That would be something to kind of track, you know, even if it's just anecdotally, because, you know, it would be great to get to a point where folks are comfortable with that, or the vast majority are, unless they've had a life-changing circumstance and they need, you know, a little more expert opinion on it. The other is, I'd just like to make a comment. It's potentially scary to see the numbers going up that much, but it's also knowing that there's that many less uninsured. And I have a very close personal friend in Grand Junction, is a young woman who's 36, 2 kids, single mother, who's come down with stage 3 breast cancer. And just, you know, 2 years ago, she would not have had any insurance coverage whatsoever, because Medicaid did not cover adults, and it would have covered her kids. But, I mean, this is really a dire situation, and she's able to receive really great medical care now, and, you know, a possibility of life extension or putting this into remission. But we talked about cumulative effects and impacts of dollars and cents or whatever, but, you know, without that, you know, you can just imagine the cost of caring for those kids later, if they're not able to save her life. And so at a very deeply personal level, I think we all may or may not know that we know someone who this has changed their life. Thank you.
Okay.
I have an issue or question, I guess. I was reading an article about the shutdown of Colorado Health Op, which was a cooperative, and I'll actually be at Farmers Union meeting later this week where this will all be discussed. But it says that without the competition that Colorado Health Op adds to the marketplace, our insurance premiums will go up additional millions every year. So this was a low-cost alternative that had over 85,000 people enrolled in it, and it was shut down because of some failing in the government system. Do you have any insight to offer about why the health cooperative did not, was not allowed to continue operating?
Other than what has been released into the press, that there was an issue with the federal loan that they have, I mean, I do not have any other information about what happened there and all of that, the Division of Insurance decision to shut that down.
We have had people stop by our building who are impacted by that. I've spoken to a couple of people who have walked in, and so it is impacting our community fairly significantly because you know, we have high cost insurance anyway. I believe Carrie Donovan is having a community meeting on Thursday in Basalt to talk about some of these impacts and the impact of the high cost of insurance in our region. And so I will be there. We will continue to participate and try to influence a public policy. And on the local level, we're really fortunate to have our Connect for Health people who are available, and the brokers who can help people find an alternative.
Rachel?
Steve, what I have read at a national level in newspapers is there was just so many requirements placed on the co-ops that they were almost designed to fail, unfortunately. They just far more than perhaps on the private insurance companies, and a little bit like the post office today. Oh, you've got to fund 50 years worth of retirement benefits, which is a requirement that no other agency has, so they always show a deficit, and that there were a lot of very difficult things here, such as not being able to use any of the initial funding grant for marketing. And you're trying to get out there and explain to people what the programs are, or how to sign up, or what the benefits are, and not to be able to use any of the resources for marketing and issues like that. But it's locally, or in the state of Colorado, it was a sense that this was an underfunded item and that they would not potentially be able to fulfill all their commitments, and then people would have been paying in and thought they had insurance and find out that they didn't. And others say that if it just been allowed to go through a downturn and come back up, they'd be fine. But, you know, I don't know that the state agency was able to take that risk when people were paying in, we wouldn't have had an emergency fund to pick it back up. But it seems to be more federal red tape that was wrapped around this program very tightly because some people did not want to see it succeed. You could say that.
We won't say that.
We're not going to say that over here.
Is it partisan issue?
You can say it.
We can say it, staff can't.
I was asked a question mark at the end.
So, we want to respect your request to look at some of the CSTAT measures. This is Colorado Department of Human Services effort to manage by data and to help us look at data and help us improve our impact and our services to customers. And we thought that it would be helpful today to talk to you about the food assistance measures. This is the dashboard that you see up here. This is what you get every month and I get every month and my team gets every month. So we get to see the reds where we have fallen below the state standard and the greens where we are above the state standard. And we're very happy to reflect here that there are actually more greens than reds. And we'll remind you from our last meeting, the point is to look at trends, especially because we're a small county. We could have one case at any time throw us off. But with that said, this is information that we can use to drill down and try to improve our services. So I'll turn it over to Kathy to talk to you about timeliness of food assistance, timeliness of expedited food, and redeterminations of food assistance applications.
So all of our public assistance programs, our adult financial, Colorado Works, food assistance, LEAP, and Medicaid, which is not reflected on this dashboard, are all have what we call a timeliness goal of a 95% timely, meaning we should process 95% of all applications or redeterminations we receive timely. Timely can be different for different programs. In food assistance, for a new food assistance application, timely means 30 days. And the reason it's important that we process an application timely is because when someone comes to our door with an application for food assistance, that means they need some help, they need some food, and we want to get that processed within timely. Our actual philosophy and how we look at things is we really try to look at a 7-day window for for all food assistance applications, whether they meet expedited criteria or not, or emergency processing criteria. So we try to approach it that way because I know if it was me and I was coming in and I said my kids need food, it doesn't mean in 30 days they need food. It means they need food this week, today even. So what we look at is how many applications did we receive. And so for food applications, timely is defined as 30 calendar days. And in September, we received 12 applications from Pitkin County households, and all of them received timely processing. And then as you look back across the 12 months that are reflected on the dashboard, you can see that we have stabilized our rates of timeliness over the last 7 months. Prior to that, we had some struggles where we have a few red blocks. But what we've been working on is our process and how we make sure that we identify any application that will be untimely before that happens and we get it processed. So along with that, we have our expedited food assistance applications. So what that means is you have a family who is in a circumstance that is considered an emergency circumstance, and we have 7 days to process those applications. And so there are a couple issues with that, and one is staff are identifying whether they're expedited or not. And then there's also a couple issues within working with the state on how it is we can do a better job of using our computer system and making sure we're doing accurate determinations. So for our expedited, what we had 8 families who applied in September who qualified for expedited processing, and 7 of those received timely processing. So that's where we have the 87.5% timeliness. And then we have what's called a redetermination. So someone who's on food assistance ongoing, every 6 or 12 months or 24 months, depending on what kind of household it is, we have to relook at their circumstances to see, are you still eligible for food assistance? So what we do is we say, for example, in September, your redetermination is due. They have a packet to fill out, they re-verify their income and a few other pieces of information, and we look at that during the month of September for their benefits to start again in October. So the importance of doing this timely is there's no gap for the customer in receiving their benefits between the 2 months of redetermination. And so in this measure, again, we have not totally stabilized that process. We have been successful the last 2 months in meeting 100% timeliness. Our concern here is when we have, even though the state requests those packets come back to us by the 15th, the family actually has till the very last business day of the month to turn in that packet or any related paperwork we need to go with it. And so if someone walks in our door at 4:45 on the last business day, sometimes it's difficult. It has been difficult for us to meet that timeliness requirement. So what we're piloting is actually identifying what days those are, our last business day, and having a plan for some of our staff to work a different shift that day so they can be in the office a little bit later after 5 o'clock. So if someone does bring us something at right before 5, we have staff already scheduled to be there who can process that paperwork. Hopefully, it'll be everything we need. We can get it done, and we can get it done timely. So we're piloting that, and we piloted that in October. That was our first, October 30th was our first day that we had somebody there planning to be there late to process. And we actually had 4 items, 4 different cases where the item came in between 4 and 5 o'clock that day. And we were able to get those processed.
Is there a penalty to the county if you're below a certain level?
So there's currently not a penalty. I think the discussion is around if the state is in a place where it is not meeting as a whole, meeting the timeliness measure, and there is some kind of a sanction, a fiscal sanction, either from the lawsuit that created some of these measures or from the federal government for not meeting measures that they have set, that there could be a fiscal sanction, and how would that be shared amongst the counties in Colorado?
Perhaps the rules should be
I was just going to
changed.
say, so with these measures in particular, we're obligated to try to meet these measures to ensure that Colorado is successful with the federal government standards. There are a couple of measures here, and we'll talk about them at another time, where there are incentives attached to meeting timeliness of child welfare assessments. But there is not a direct cash connection here for us.
Perhaps another measure of timely, maybe the definition should be changed to say that these must be processed within 1 working day of when it was actually submitted with the complete paperwork. So if someone does bring it in at 4:45 on the last day, that's not your fault. It's you should be allowed to file it the next day and have it still be timely, if it was done reasonably, I think.
I think, we're trying to meet the need of the customer, and we understand that sometimes it's very difficult for the customer to get us what it is we need. So we want to put our best effort forward to make sure we're doing our part. And if we can make a plan to do that, then we will. We'll see how that works.
Let me ask, is it somewhat like planning and zoning? When someone puts in an application, a staff member has to deem it as being complete before any clock starts ticking. So, for example, on this one where it was 7 out of 8, is it more that application itself was not complete and they had to be sent back for more verification of some aspect? Or is it, again, that they dropped it off at 10 minutes to close on a business day?
So for the food assistance program, for a new application, actually all we need is the first page with a name, an address, and a signature. And that is considered an application, and we must accept that. Okay. Whether we have any information about income, who else lives in the household, anything at all.
Okay.
That starts the clock.
So that starts our clock for the 7 days if it's emergency processing, or 30 days for regular processing.
Okay.
So then from that point, we're required to do an interview with the household. And so we as soon as we get that, if we're not seeing the person face to face, we try to do the interview. If they're bringing it in, we try to do the interview right then and get it taken care of. If we get it through our PEAK system, which is an electronic online application, or it gets mailed in, then we're immediately trying to contact that family or individual and schedule the interview. The interview, we then determine, do we have everything we need based on what they're telling us on the application? And we tell them, if we have everything, we go ahead and process. If we don't, we're required to give them a notice saying, these are the items we need in order to process your application. They have 14 days to then submit those verifications. And then once we get those, we can process the application.
And so during that time period between accepting an application that's kind of bare bones and being able to say it's now a complete application, the clock is running so that if somebody canceled 3 appointments in a row and you missed the timeliness goal, it really wouldn't have been our fault as much as somebody didn't get back to you with all the right materials that you need.
So if the customer does not give us what we need, they either don't come for their interview or we don't get all the verifications, we can then deny the application on the 30th day.
Okay. Or it seemed like they should have some sort of suspended application middle ground there, as opposed to making somebody start all over again. But I know you're not designers of the entire system. And the last question is that for quite a while, the state had so much problem with its computerized systems that people would say we'd be starting to put in an application and it would go down or they'd get kicked out, or have the state errors been corrected that lead to delays?
I would say the majority have. There are still, what happens is our programs are always evolving. The federal laws change and the state laws change, which means there have to be updates made to the system. So when an update is made, you always run the risk that it creates another little issue within the system. So I would say for the most part, the big issues have been resolved. We occasionally then run into a hiccup along the way. But I would say for the most part, yes. That is on the expedited food assistance applications, there is a little system glitch, and I think it's a combination of the system and how we are entering information that even though we have decided it's not an expedited application, we get information later that it should have been, and then the system repopulates that, and we're already past the 7 days, so we're already have missed that timeliness mark. So that's the one thing with the expedited that we are really working hard with the state to try and figure out how do we keep that from happening.
Thank you for all the detail. I really appreciate it.
So also in your packet.
Wait, before you leave.
Okay.
There was one more, the food assistance payment error rate. That weird number in the middle of 1,041.2 or 177. Yeah, was that, what is that?
So there was one case that was reviewed by the state where we had determined eligibility and issued a payment to a household. And the error was the entire payment of $177 for one
those
case.
Numbers didn't coincide.
So it was like, it should have been 17 and it was 177, and that's where that weird number came from.
Okay.
So yes, it was
caught
one
my
case where we
attention.
had made an error in the payment calculation.
Thank you.
You're welcome.
So I just wanted to bring your attention to attachment B in your packet, which are pages from the CSTAT report. So every month we get that very thick report, you get it as well. And it gives you more detail about each of the measures and what you have in your packet are the 3 measures that Kathy just described. And then also how we do as compared to other small counties, which is actually all balance of state. So you can see for timeliness, we're doing really well at 100%, and the state average is bouncing up and down here. So I just wanted to bring your attention to this report. I know you get it. It does tell you some very interesting things, like what is the measure, what is the numerator, what's the denominator, and then actually real numbers for Pitkin County, and then real numbers for the 44 small counties. And we won't go over that anymore, but I do tend to go look in the report when I don't understand the measure, like, the error rate measure. Exactly. They're coming out with some new pieces of the report as well. They're going to be highlighting on the dashboard, I believe, what measures are part of our incentives, so that you can we can see at a glance. We've been asking for that for a while. And there may be some other nuances that are coming out with just more eyes on these things and more interest in what they mean. Okay? So I think that's it for us, unless you have any more questions.
You're not going to stay with us longer?
Well, I'm going to go get my seat at Beating Myrtle. I think it's going to be very popular tonight.
Yes, I think so.
Thank you.
Thank you.
Thank you very much.
Thanks, Kathy.
Thanks for coming up, Kathy, and I'm
welcome.
glad you found the Gant over here.
Yeah, good job.
I saw this little sign under the street sign that said the Gant.
Good job.
Would you accept the motion to adjourn the special meeting?
Yes.
Seconded?
All in favor of adjourning the Board of Social Services and the special meeting, say aye.
Aye.
Aye. Okay, board open discussion.
Just a quick reminder for public that might be watching, county offices are closed tomorrow for Veterans Day. The Health and Human Service Building will be open for the nonprofits that are providing services there.
And to tag on to that, the veterans ceremony will be taking place at the in-town Aspen Volunteer Fire District building on Hopkins at 11 o'clock, not at Veterans Park.
Not at Veterans Park because of the predicted snow.
Weather.
Thank you, Patty. Yeah, and that's really all I have.
I had one item, since Tom Oken had put the Ecological Bill of Rights. Tom Dunlop had put, I always mix their names up. Ecological Bill of Rights in our packet. And I just was reading through them. Number 10 says, be free from excessive noise. And number 14 says, expect from our government legislation and active enforcement of land use and development regulations consistent with this Ecological Bill of Rights. And it made me start thinking about the X Games concert at Buttermilk in relation to be free of excessive noise. So I just wanted to point that out, not to discuss it right now, but maybe at some point we would want to, when we're talking about the concerts at the X Games, we might want to think about the Ecological Bill of Rights with relation to that.
I have no open discussion.
Nothing from me? Anyone else?
Okay, nothing else for the good of the order. Thank you, Grassroots, for being here. We'll be back in our regular small room over at the courthouse on the next go around.
Are we ready?
Okay.
Thank you.